Good evening, respected doctors, scholars, and esteemed participants. On behalf of the organization committee, it is my great pleasure to welcome each one of you to the first day of the Pranava National Seminar. This seminar stands as a testament to the collective passion and commitment towards advancing the field of Ayurveda and fostering meaningful discussions that benefit practitioners, researchers, and society as a whole. First and foremost, I would like to extend a special and heartfelt welcome to the panel members who have worked tirelessly day and night to make this program a reality. Their expertise, dedication, and meticulous efforts in planning, coordinating, and ensuring the smooth execution of this seminar deserve the highest appreciation. It is through their unwavering support that we have been able to gather here today. This seminar is not just another academic event, it is a celebration of Ayurveda's timeless wisdom and its relevance in today's rapidly evolving healthcare landscape. Ayurveda seminars like Pranava are vital platforms that bridge the gap between tradition and innovation, bringing to the ancient knowledge and modern research. They provide an opportunity to learn, share, and grow, and to strengthen to the foundation of Ayurveda as a globally respected science. Today's sessions will feature a series of insightful presentations by participants who have invested their time and knowledge to bring forward thought provoking research, clinical practices, and innovative ideas. Each presentation is a step toward enriching the field of Ayurveda and inspiring new ways to address the health challenges of our time. Without further delay, let us move to the first presentation of the day. I urge all participants to engage wholeheartedly, ask questions, and contribute to making this seminar a truly interactive and enriching experience. Once again, welcome to Pranava National Seminar and thank you for your presence and enthusiasm. Let us make this event a memorable milestone in the journey of Ayurveda. First, we go to the first presentation. It is a paper presentation. First, I would like to invite Dr. Sapna Sitaram Patil for the paper presentation on the topic Uncovering the Secrets of Kadara and Ayurvedic Perspective.
Hello everyone, myself Dr. Sapna Patil, second year PG scholar from the Department of Shalyatantra, Shri Jayendra Saraswati Ayurveda College, Nazaratpet, Chennai. My topic is Uncovering the Secrets of Kadara and Ayurvedic Perspective. Introduction. There are few diseases that have a simple pathology but are difficult to cure, called Kshudra Rogas. Kadara is one of them. Kadara means corn, is initially painless in condition, but with progress, it may become painful. So, causes of corn: excessive pressure on the feet, abnormal foot deformities, abnormal foot mechanics, sweaty feet, aging, genetic, nutritional deficiency. So, in contemporary science, for the management of corn, salicylic acid caps are available. Also, there are many invasive procedures like cryosurgery, chemical cauterization, electric cauterization, surgical excision, and laser therapy are there. Then also the rate of recurrence is also found to be very high. Hence, the treatment modality that is simple, less invasive, and safe is required. Kadara is one among 20 Kshudra Rogas mentioned by Acharya Sushruta in Chikitsa it is a condition with simple pathology but causes intense suffering to the patient. Acharya Sushruta mentioned Kadara as Sakila Kathana Granthi. It is caused due to repeated pressure over the foot during barefoot walking, injury due to thorn prick, etc. It is caused due to repeated pressure over the foot. This causes aghata to the pada, results in aggravation of vat and kapha doshas. So aggravated doshas in turn vitiated medha and rakta dhatu. With the involvement of this dosha and dhatu, heart swelling is produced. That heart swelling, its symptoms of granthi resemble kolofal, kantakadivi, utsanna mas, kathina, sthira, kanduyukta, vedana strava. Kshara is caustic chemical, alkaline in nature, obtained from the ashes of medicinal plant. It causes ksharana to mamsa and other dhatu. It superior among the sharp and subsidiary instrument because of performing chedan, bhedan, lekhan and destroyed tridosha disorder. Though Kshara is Shukla Varnatmak, then also it has a Dahana karma. So every procedures having three stages: Purva Karma, Pradhan Karma, Pachat Karma. So in Purva Karma, counsel the patient about the procedures. Whatever the material required for the Kshara Karma, you just collect that. Surface of the corn will be painted and with antiseptic solution. Inspection palpation should be done. A corn surface in Pradhan Karma, corn surface will be debrided. Up to that, the Pankta can see easily. When we saw that Pankta, we'll apply a Kshara, Apamarga Kshara or whatever Kshara we are taking. Just apply on that as per quantity sufficient and keep it over there till 100 seconds. After that, Apamarga Kshara will be washed with Nimbu Swaras as a neutralization process. Aloe vera pulp, apply aloe vera pulp with the up on the surface of area of corn. Aloe vera is doing a runner opener. Bandaging will be done. The subject will be asked to avoid any contact with water for the next 24 hours on the surface of area of corn. Procedure will be repeated once a week for the next 4 weeks. So the discussion and conclusion, Sushruta's delineation of Kshara is precise, focusing on its attributes of Ksharana and Kshanana. Ksharana is melting away, Kshanana is destroying and mitigating morbid growth. Kshara possesses several qualities that make it beneficial in the management of Kadara. Lekhan Kshodan Rupad. Lekhan has the ability to scrap and remove unhealthy tissues, aiding in the process debridement. Shodhana. This property allows Kshara to clean the infected surface thoroughly, preventing infection. Ropan. It supports the regeneration of healthy tissues. Thank you.
Thank you, Dr. Sapna. Thank you for the wonderful presentation. Next, we go to the next presentation. I would like to invite Dr. Kajol Hemant for the paper presentation on the topic cardiovascular complication in chronic kidney disease.
Hello, myself Dr. Kajol Hemant Mhatre, second year PG scholar, PG department of the Kai Chikitsa. Today I am going to present the cardiovascular complication in CKD under the guidance by the Dr. Suvendu Raut. So, chronic kidney disease is the slow and the progressive kidney deteriorate the kidney functions, which leads for the glomerular filtration rate below for the 60 per ml per minute develop over the minimum of the 3 months. The stages of the CKD, the 5 stages of the CKD, depending upon the GFR rate, that is 90 ml greater than the 90 ml per minute. Then second one is 60 to 89 per ml per minute, 30 to 59 ml per minute, which is moderate, 15 to 29 ml per minute, severe, and 15 ml per minute, which require the dialysis. The causes of the chronic kidney disorders included diabetes, hypertension, renovascular, glomerulonephritis, polycystic kidney, polionephritis, uncertain, and other missings, which the graphical representation shows that the 38% of the diabetes and the high blood pressure is 28%. Pathogenesis included uremic toxin, electrolytes and water excretion, erythroproteins and 25-hydroxy cholecalciferol, renin and PTH. The symptoms and signs are depend upon the various systemic systems. We are focusing on the cardiovascular systems. The symptoms are include fatigue, dyspnea, orthopnea, chest pain, edema. The sign includes hypertension, pericarditis, circulatory overload, blood volume, and debilitation. The cardiorenal syndromes are 5 types. First one is acute cardiorenal syndromes. Second type is chronic cardiorenal syndromes. Third one is acute renocardio syndromes. Fourth one is chronic renocardio syndromes. Fifth one included the secondary cardiorenal syndromes. The pathophysiology of the cardiorenal syndromes are the 73.4% of the end-stage renal disorder patients goes for the dialysis, which lead for the left ventricular hypertrophy. It causes the predominant cardiac abnormality in CKD, and end-stage renal disease is related to the left ventricular structural and functional disturbance, which leads for the 35% of the patient for the left ventricular dilatation and 14.8% which lead for the left ventricular systolic dysfunctions. The other cardiac problems included the ischemia, myocardial cell damage, fibrosis, and coronary artery diseases. The coronary artery disease in CKD and end-stage renal disorders causes for the myocardial hypertrophy and fibrosis, leads in a reduction in a capillary and coronary reserves, which causes the imbalanced oxygen supply and demand, which leads for the ischemia. When ischemia is happen, two possibilities are there: ventricular arrhythmias, which leads for the cardiac death, cardiomyocytes, apoptosis, and accumulation of the extracellular matrix and collagen causes the interstitial fibrosis, leads for the cumulative left ventricular stiffness, causes the increased left ventricular filling pressures, lead for the impaired diastolic filling and diastolic dysfunctions. The non-hemodynamic factors included the hyperphosphatemia, which causes the associated with the high blood pressures, increase the left ventricular mass and diastolic dysfunctions, lead for the contribution to develop left ventricular hypertrophy and cardiomyopathy in CKD. The angiotensin II accumulation in the heart can promote the myocyte hypertrophy, interstitial fibrosis, microvascular diseases. The mechanisms and the cardiovascular risk factors are traditional one and CKD related risk factors. We are focusing on the CKD related risk factors, which are anemia, mineral metabolism disorder, albuminuria, inflammation, hyperthyroidism, hypermyocytosemia, oxidative stress, and malnutrition. The uremic cardiomyopathy causes the hypertrophy, which leads for the mechanical dysfunctions, ischemia, cardiomyocyte metabolic dysfunctions. Another side, fibrosis leads in electrical dysfunctions, electrolyte stiffness, and volume fluctuations lead for the sudden cardiac death. The investigations included the electrocardiography, echocardiogram, plasma level, which included the BNP, NT-proBNP, GFR rate, albuminuria, and albumin and creatine. So now the Madhav Nidana mentioned the Mutrakrucha and Mutraghata differentiation. That Mutrakrucha, Mutraghatayoshcha Visheshaha, Mutrakruche Kruchatvam Atishayam, Ishita Vibandam. That in Mutraghata, Mutraghate tu Vibandam Balvanam, Kruchatvam Iti Alpam. Sutra from the Madhav Nidana, Mutraghata Tika. Charak Sushrut Ashtavruda and Madhav Nidana mention the types of the Mutrakrucha. Charak and Sushrut mention the 8 types of the Mutrakrucha. From the Vatpitta, Kapha and Sannipata are same. Then Ashmari, Sharkaraj, Shukra and Shonita are mentioned by the Charak. Sushrut differ from the Purushaj and Abhigataj Mutrakrucha, in which Sharkaraj Mutrakrucha leads for the Sharkaraj Mutrakrucha Samprapti leads for to develop the symptoms of the Vrutapida, that is Marga Avrot can causes the Vrutapida and Kampa, Kukshi Shula, Agni Draubalya and Murcha. The Lakshans are Vrutpida, Sakti Sadaram, Kukshi Shula, Vepatu, Trishna, Krishnata, Draubalya, Pantu Varna, Orochaka Vipakam. Upadravs of the Ashmari Mutrakrucha mentioned in the Nidhan, Sushrut Saita Nidhan Stan are Durbalta, Sadanam, Ushnavatam, Vrutpradesha Vedna, Trishna, Vamanam, Kukshi Shula, Arochakam. Chikitsa Sutra are mentioned in the Sushrut Saita Uttar Tantra, which say that the Ashmaricha Samishatrascha Samashritasya Yaduktam Prasamiksham Tataha Yathadosham Prayujitam Snehadi Apimam Chakramam. They focus on the Snehadi Upakramam for the Mutrakrucha and Ashmarish Chikitsa. Thank you.
Thank you, Dr. Kajol Hemant. Thank you for the well-explained presentation. Next is also a paper presentation. I would like to invite Dr. Sangeetha Kannan for the paper presentation.
Good evening all. This is Dr. K. Sangeetha, second year PG scholar, Shalyam department from SJS ACH College, Chennai. My topic today is Kshara, a precise approach to Ayurvedic Surgical Excellence, which is guided by Dr. Vasudeva Reddy sir and Dr. Uday Kiran sir, head of the department of Shalyam department. Introduction, Utpatti, according to Shabda Kalpadruma, it is Ksharati iti Ksharaha, and according to Shruta, Tatra Saranat Chananat Va Ksharaha. Definition: Kshara is a herbal alkaline substance derived from the ash of the medicinal plants. Is processed into solution of paste in the specific alkaline agents relevant to medicinal modern practice with increasing resistance of antibiotic and complications of invasive surgical. Kshara offers a minimal invasive and holistic alternate materials for Kshara. Kanija, Pranija and Vanaspatya. Kanija is Naisargika and Kritrima. Pranija is Shanka, Shukta, Pravala and Kapatika, and Vanaspatya is Chincha, Arka, Palasha, Pamarga, Beda, and based on application it is Paniya and Pratisaraniya. Paniya is internal and Pratisaraniya external, based on potency, Mrudur, Madhya and Tikshna, and Kshara Beda is Dvi, 3, Sapta, Shashta, Panchami and Ashta Kshara Sada. Kshara Guna is Tridoshagna, Saumya, Daha, Pachana, Dharana, Katuka, Ushna, Tikshna, Vilaya, Shodana, Ropana, Shodana, Shoshana, Stambana, Lekana, Krimigna, and Shukragna when in the large amount. Pratisaraniya Kshara is derived from the word Ksharana, which means something which removes a deformed flesh skin and tissue, which has a corrosive nature and helps the elimination of necrosed and inflamed tissues. As the pH value typically between 10.1 and 13.88. Elimination of general method of preparation: Shoshana, Agni, Stapana, Glana, Agni, that is reburning. Kshara, which is prepared in Varsha Ritu, is Uttama. Kshara prepared in Shishira Ritu is Madhyama, and Kshara prepared in Vasanta Ritu is Adama. Preparation of Mridu Kshara: collecting the plants, drying, burning to form ash. Add 1:6 ratio of water and straining for 21 times. Depending upon different acharyas, this has been changing. Madhyama Kshara, Antikshna Kshara. Madhyama Kshara is Kat Sharkara, Bhashma Sharkara, Shankanabi has to be heated and it is dipped into the Ksharodaka. 8 pala of the above said substance are added to Rudroni of Ksharodaka and it is heated repeatedly. When it should not, the consistency should be neither too thick nor thin. Store them in the iron pitcher with covered mouth. Tikshna Kshara: 1/6 powder of Danti, Dravanti, Chitraka, Langala, Putaki, Pravala has to be added in the mixture to form to get the Tikshna Kshara. Application: Kshara Varti, Kshara Taila, Kshara Pichu, Kshara Sutra, and Kshara Karma. Kshara Varti, it can be used in the cavity containing lesions such as sinus and fistula, and Kshara Taila is used to treat the deafness, ear infection, pus discharge lesions, etc. Kshara Pichu is used in non-healing unhealthy granulation tissue ulcers. Kshara Sutra is mainly used in arshas and bagandra, and Kshara Karma, which is used in arshas. The mode of action, probable mode of action of Kshara Karma, it is coagulation and cauterization, coagulation of the heme and globulin, and blackish brown discharge. Cauterization decrease the size of mass, necrosis of the tissue, necrosis and slough out in 5 to 7 days, and fibrosis, scar formation, obliteration of hemorrhoidal vein, complete wound healing in 21 days. Kshara Varti with the effect of ceasing of bleeding, necrosis, digestion of amok leda, removal of blockage of the srotas, promotes epidermal migration and reduces the inflammation. Action of Kshara Sutra, effect of Kshara Sutra on the local tissue, granulation and capillary formation, fibroblast proliferation with coagulation formation, epithelial hyperplasia, endures granulation to possible only to the more novel drug delivery of the Kshara Karma. The indication and contraindication: indication Bhandara, Nadivrana, Arsha, Dushtavrana, Vrana, Vidradi, Arbuda, Atimamsa, Yoni Arshas, and contraindication: osteomyelitis, tuberculosis, intra-abdominal cold abscesses, chronic ulcerative colitis, appendicitis, Crohn's disease, etc. Some of the chemical composition I have collected in various articles. Due to time, I couldn't explain this. And Paniya Kshara, administration Kshara by oral route in the form of Ksharodaka, Churna, Gutika, Avalegya is known as Paniya Kshara, and the pH value of Paniya Kshara is 10.4 to 12.29 depending upon the type of Kshara. And Paniya Kshara indication is Garavisha, Gulma, Udara, Agni, Ajirna, Aruchi, Sharkara, etc. According to Shishruta, according to Charaka, it is Raktapitta is here it is indicated, which was contraindicated by all the other acharyas, and he has indicated in Ashmari, Arshas, Swasakasa, Gulma, Grahani, Udara, etc. Contraindications of fever, individuals of Pitta Prakriti, Rakta Pitta, Timira, and excess use of these causes baldness, grey hair, debility, sterility, consumes excess in this. The dosage of Paniya Kshara, Uttama Matra is 1 phala, Madhyama Matra is 3 tola, and Hina Matra is half phala. According to Rasatarangini, Kshara oral administration is 125 milligram, and as per the classic, it is advised for the Paniya, but particularly it is not safe. It causes erosion in the mucus of the esophagus and stomach and forms strictures. It can be taken in the form of capsule form with the dose of 250 milligram to 500 milligram for the period of 2 to 3 months only. Paniya Kshara in Ashmari, due to the Bedana, it disintegrates the urinary stones, diuretic property, and Shodhana and Ropana beneficially, it heals the lacerated mucosal sulfur of mucosal surface of the urogenital tract. Commonly used Kshara the management of Arshas, Eva Kshara, Mulaka Kshara, Palasha Kshara, Kadali Kshara, Koshataki Kshara. Formulation, special formulation is Ananta Yoga. And Mutragata, benign prostate hypertrophy due to the Mutrala, and it acts, it inhibits 5-alpha reductase action. Kshara causes impotency, probably affecting the androgen levels. Common used Kshara of BPH is Yava Kshara, the Tilanala Kshara, Kamala Kshara, Kadali Kshara. Paniya Kshara and Pittaja Ashmari. Kshara is Vedana Guna, helping disintegrating of the stones, that is a lithotropic action. Due to his Kafahara, it helps the Kafa Vilayana and proper channelization of Vata and remove the stasis of the bile. In gallbladder, the bile gradually becomes acid and its pH goes down to 4.7 to 4 alkali. The commonly used Kshara in cholelithiasis is Aragvada Kshara, Kutaja Kshara, Palasha Kshara, Kutaja Kshara and Palasha. Paniya Kshara in Amla Pitta Kshara, when combines with Amla Rasa, it becomes Madhura Rasa. In the same way, when Kshara taken internally combines with gastric juice, which acidic in nature, becomes Madhura Rasa, pacifies the symptoms like Hrit Kantak Daha, Tikta Amlodgara, and prevents gastric ulceration formation for protecting the mucus of the stomach. By the Ropana action, it heals the gastric ulcer. By its Pachana Guna, it improves the digestion. By its Krimigna action, it helps a H. pyloric induced gastritis. Commonly used Paniya Kshara is in Amla Pitta is Chincha Kshara, Kadali Kshara, and Aragvada Kshara. Conclusion: Paniya providing the minimal Paniya Kshara, providing a minimal, invasive and cost-effective alternative to surgery, ideal for the individuals who are aged and fear for surgery, are contraindicated for invasive technique. Can be administered on an OP basis with a low recurrence rate, making it a practical and accessible treatment option. Pratisarani Kshara, a typical application with Vedana, Lekana, Ropana property, affecting managing localized condition like hemorrhoids, abscess and ulcers, offering a precise and non-surgical solution for the condition requiring targeted treatments. Both Pani and Pratisarani emphasize the minimal invasive, cost-effective, holistic approach of Ayurveda, providing safe and effective management of various medical conditions while avoiding the surgical complications. Thank you one and all for giving opportunity for this presentation.
Thank you, Dr. Sangeetha, for the well-explained presentation. Thank you so much, Doctor. We go to the next presentation. I would like to invite Dr. Avinash for the next paper presentation. I would like to invite Dr. Avinash Bharadwaj for the paper presentation on the topic Swayam Bhasma Unveiled an Insightful Literature Review.
Namaste. Myself, Dr. R. Avinash Bharadwaj, PG Scholar, Department of Shastra Evam Vaishajya Kalpana, SJSACH, Chennai. Here I am going to give the talk on Swayam Bhasma Unveiled, Insightful Literature Review. So, introduction. In modern Ayurveda practices, Shastra stand out with its powerful therapeutic applications, offering shift actions in smaller doses, alpa matra. And over the time, the virya of these preparations will improve and ensures the long-lasting benefits of the prepared medicine. So one medicine which I came across in the textbook of Sahasra Yogam is Swayam Bhasma, which is indicated in Shula. So Shula, according to Acharya Sushruta, it identifies that Shula is mainly due to Vata. Shula Vatam, Daha Pittam, and Kandu Kava. So we know this concept, and Shula arises from Vata. Shankas Putanavatasya Yasma Tivrahi Vedana. So we know that is the definition of Shula, according to Vriddha Sushruta and Yoga Ratnaka. According to Madhava Nidana, he says that the Shula is due to either single dosha or due to other doshas as well. So he classifies the Shula into subcategories. So which is like Vataja Shula, Pittaja Shula, and Shleshmaja Shula is treatable, whereas if any multiple dosha is involved, it becomes a little bit tougher challenge. So the abdominal discomfort, which primarily arises from Pitta, often tandem with Vata and Shleshma. Now materials and methods. So relevant information was meticulously collected from classic Ayurveda texts such as Sahasra Yogam, along with comprehensive data from modern databases like PubMed, Google Scholar, etc. So Sahasra Yoga's reference. This is the shloka where the ingredients are mentioned here. So 1 part of Gandhaka, 1 part of Parada, 2 parts of Gandhaka, and 3 parts of Loha Bhasma has been used here with Bhavana Dravya as Kumari Swarasa and Anupana as Gura. So here we can see 1:2 ratio of Parada Gandhaka Jaranam, which finally they do Murchana to prepare Kajali. So that is used here along with the 3 parts of Loha Bhasma. So we know that as per Rasamrita and Rasaratana Samuchaya, the properties of Parada and Gandhaka has been mentioned, where Parada is having Shadrasa Pradhanyam, Snigdha Saraguna, Ushna Virya Madhara Vipaka, and Yoga Bahi is the Prabhav. Whereas Gandhaka is Madhara Rasa and Pradhanyam, Ushna Virya and Kadu Vipaka. So mixing these forms the black sulfide of mercury, which is Kajali, and it is used for many therapeutic purposes. Loha Bhasma. This reference is taken from Bhava Prakasha, where the rasa is Tikta Rasa, Guna Sara, Guru and Ruksha Guna, Madhara Vipakam. And Kumari Swarasa from Kaidevani Gantu, Rasa Tikta Madhara Rasam, Guru Sara Mridu Guna, Shita Viryam and Katu Vipaka. So this is the property of Loha Bhasma as per Bhava Prakasha. Result. In Ayurveda, all forms of Ruja, that is Shula, are associated with aggression of Vata, as we discussed earlier. And Vata Vriddhi, due to Vata Vriddhi, the Shula thing is happening, and it is also responsible for the formation of Vata Vyadhi. So it is divided into 2 groups, which is Swatantra Vata Dosha Prakopa Hetu, which is independent factor, and Paratantra Vata Dosha Prakopa Hetu, which are dependent factors. So here comes the Samprapti of Shula. So Vata Vriddhi is seen, leading to Kha Vaigunyam, Etra Sangha Kha Vaigunyat Vyadhi Tatrupayate. So Khai Vaigunya site is there, leading to Shula, spasmodic or spasmodic pain in Koshta. So Shula in Koshta is seen. So Sankas Putanavat Esma Tivrahi. So Vedana, that is there, and finally the manifestation of Shula happens. Now with the discussion. Kajali, the one which is prepared for 1:2 ratio. For Parada and Gandhaka, which is prepared. When used with other substances, it is Tridosha Hara in nature, Shukra Vardhaka, and it is Vyavai, Shrota Shodhaka with the Saraguna and Yoga Vahi in nature. So which means, so whatever other lohas or whatever other rasas are added with this Kajali, it increases the virya of the particular formulation. So Kajali created with the Sagandha and Niragni Murchana, which ensures the Sagandha Murchana of mercury remains safe for the body. So it removes the toxicity of the mercury. Again, next, the Loha Bhasma, which is the important ingredient. It is Kapha Pitta Hara, Lekhana, Garahara, Shula Hara, and Ashogna. Kumari, the Bhavana Dravya, has the properties of Vishagna, Jwarahara, Kasa Shwasanasaka, Kushtahara, and Tridosharam. And the main constituents include alonin and amodin, which is analgesic, antibacterial, and antiviral in nature. And other 4 main chemical steroids include cholesterol, campestrol, beta-sitosterol, and lupiol. And lupiol is the main ingredient which is found in the swarasa of aloe vera, which is having anti-inflammatory action and possesses antiseptic and analgesic properties. So finally, the properties of Kajali, Loha Bhasma, and Kumari Swarasa enhanced by the Bhavana process, which reduces the size of the particle and increases the efficacy of the substance. As we know, Mardhananam Guna Vardhanam, as per Ayurveda principles. With the Jaggery as Anupana, it is Agni Deepaka, Tridoshahara, Shramahara, and it is also one of the Mitra Panchakas and the Dravaka Gana explained in the concept of Rashastras. And Guda is described by various acharya. Approximately, the gunas which are described in the Guda by different acharyas are approximately similar. So there are some references where Guda is used solely in the treatment like Virechana, Ajirna, Shula, etc. And Jaggery act as a very good cleansing agent, like the Vairejaka in nature. So it acts as a purificatory agent for the organs which include respiratory tract, stomach, intestines, etc. And it has been reported that there are many micronutrients such as main vitamins which are essential for the bodily functions and plays a major role in antitoxic and anti-carcinogenic properties. Now to the final. Swayam Basma contains Parada, Gandhaka, Loha Basma with Kumari as Bhavana Dravya and Guda as Anupana. So with the synergized effect of all the ingredients which has been given here, it shows it has the main property of Tridoshahara and Sholahara in nature. Conclusion. There are many unexplored Aushadhis with commonly used metals, minerals, herbs, etc. So one such mineral preparation which I came across is the Swayam Basma, which is found in the text of Sahasra Yogam, which acts on Shula. And in modern medicine, the iron fillings or the iron powder is used mainly to treat only iron deficiency anemia. But in Ayurveda, the concept of Loha is very, very broad, and it is not only used in Pandu, but also used in other Roga Digaras like Jvara, Shula, etc. And the further need of research is required for the validation of Swayam Basma in its practical applicability. These are the references. Thank you.
Thank you, Dr. Avinash Bharadwaj. Thank you for the meticulous presentation. Next is also a paper presentation. I would like to invite Dr. Amrita Kadesh Abhiram for the paper presentation.
So very good evening to the respected organizers. Myself, Dr. Amrita Kadesh Abhiram, PG scholar from Department of Panchakarma, Sri Jayendra Ayurveda College and Hospital. So what's my topic is analytical view of Agni in Snegapana, special reference to lipid metabolism. So what's my core idea of this paper presentation is, so whenever the patient comes to our clinic or hospital who is having the lipid profile fluctuation, increase in cholesterol or something, we'll use to give advice to the patient that don't go for fatty foods like oil contents, ghee, or any other fat related food particles. So as a Panchakarma student, so what we will do, what we will follow, or all Ayurvedic physicians follow, is Negapana, where we will give the fat content directly to the patient to intake. Whether our Snega, set in our classics, will increases or fluctuates the lipid or not. So that's my core idea of this paper. And what is the importance of Agni playing a major role to stop the fluctuation. Going to my paper. The contents of my paper are introduction, Agni Pariksha, Karmakatha of Snega, discussion and conclusion. When coming to introduction part, according to Charaka Sutra Sthana, Annapana Vidya Adhyayam, slogan number 342, gives the importance of Agni. Balam Arokyam Ayucha, Pranacha Agno Pradishtitaka. That means for strength, for health, for increasing lifespan, for all process, Agni is very important in our body. Agni has many functions. where I'm taking the metabolism property or function of Agni on metabolism. Then we coming to Snega. So Abhyantara Snega and Bhagya Snega. Abhyantara Snega, internal Snega, that is intake of Snega. It's of three: Shodhananga, Shamananga, and Brahmananga. Here I'm taking Shodhana Snega Pana, where we used to administer to the patient in a large quantity. In that Shodhana Snega Pana, we can again divide into three, that is Achapeya, Vicharana Snega, and Sadhya Snega. According to Arunadatta, he says Achapeya, Acha Kevaloye, Snega Piyatesa. That means without any mixture of any other substance, the direct snega is administered in the large quantity according to the Agni. It can be a duration from 3 to 7 days. Okay. Vicharana snega, mixture of any other substance along with snega. Sadhya snega imitates snegana effect. So I am taking this Achapeya in an elaborate manner, going to explain of the importance of Agni in Achapeya. So before administration of any snega to the patient, we will go for this Agni Pariksha. According to Charaga Vimanasthana 8th chapter, slogan number 89, the Agni can be assessed by three things. One is Dharana Shakti, Abhyavahana Shakti, and Ruchi. So what is Dharana Shakti? So Jirna Agara Lakshana was said in Madhava Nidana 6th chapter, slogan number 4, that is Utsaga, Laguta, Udgara Shuddhi, Shud, Krishna, etc. After intake of food, after digestion, if the patient is feeling the so set symptoms or lakshanas, then we can say that the Dharana Shakti is normal and proper. When it comes to Abhyavagana Shakti, the quantity and quality of food taken, and Ruchi is nothing but appetite. This is according to our classics. But while administration of Snega, how we can assess or analyze the Agni Bala? So there is some formula called as ABI, that is Agni Bala Index, where the test dose by given dose and time taken for digestion of Snega. Here I'm taking ghee, so it's called as ghee. For example, 30 ml of Snega is digested in 3 hours. That is 30 ml is a test dose. Given dose is 30. The time taken is 3. So the ABI will be 3. For the same patient, 300 ml of Snega is given and digested in 6 hours. So the test dose will be 30. That is the first day we are given 30. So the test dose will be 30. The given dose is 300 and time taken is 6. The ABI will be 0.6. Practically, for 300 ml of Snega, it should take 30 hours to digest, but it digests in 6 hours. That means the Agni is enhanced. So by this ABI index, we can find whether this Agni is increasing while administration of Snega or not. Then Karmagata of Snega, everyone knows about the time of administration. So according to Ashtanga Kridaya Sutrastanam 16th chapter 19th sloga, Rastanne Jirna Evanne Snegocha Suddhi Bahu. That means Jirna Evannam, the digestion of previous meal or food, we should administer this Snega. Okay, the ideal time is 5 to 6 a.m. Why? Because that is Kapha Vriddhi Avastha will be seen. Because if it is a Pitta Vriddhi Avastha, if you're giving any Snega, due to the formation of Agni, enhancements of Agni, the Snega will easily digest. Then the outcome we are expecting will not get properly. So it should be given in Kapha Vriddhi Avastha, where the Utklesh of dosha can be happen, Upashista dosha can happen, and we can go for Shodhana. There is many concepts or controversies circulating the field that Pitta and Agni are same, or the Pitta as a function of Agni, or Agni is having the function of Pitta. So one question I will raise that if the Pitta dosha attributes the Agni resides, any change in Pitta dosha will have an effect of Agni. Is that so? For example, when the Pitta dosha shows increase in Drava guna, as you know, the guna of Pitta, the Drava, is there. The resulting of Dravatva is bound to cause Agnimandya, where Acharya Vagbhatta clearly explains that the Pitta is of 5 and Pachaka Pitta, which resides in the Amashaya, doesn't, it is a lack of, which is having a lack of Drava attribute, Drava guna. So the Pachaka Pitta can be said as Agni, which has the functioning of digesting the food material. So the Kaya Agni is seen in the Pachaka Pitta. Then what happens after taking the Snega? So administration of Snega and Pradhana Kala, where initially in Amashaya the Madhura Rasa Paka will happen, followed by Pitta, where the Agni is enhanced by Pachaka, and Maruta dried up, and in Musmagragni, where the Bhutagni Paka is happened. From liver, the pre-homogeneous substance is released and digests the Snega which I have taken. From there, the transport of Snega reaches to the Dhatus, from Rasa Rakta, and so on and so on. So what's my discussion? My discussion, whether the lipids, the Snega we are taking, is fluctuating the lipid profile or not. Before that, we have to understand the Snega are mostly Stavara or Jangana, that is animal origin and vegetable origin. But the chemical compound of Snega, if you see, it is a hydrocarbon chained material or molecule. It may be saturated or unsaturated in nature, where it has to be divided into 4, that is short chain, medium chain, long chain, and very long chain. In short chain, which is less than 8 carbon atom molecules, in medium chain it's around 8 to 12, in long chain it is more than 12, and very long chain it is more than 20. So all our Snega, that is Chadur Snega, we are saying, all our Snegas comes under short chain and medium chain fatty acid, which means the Snega we are taking inside, it absorbs directly through the wall of colon, as it doesn't require for any enzymes or lipase or secretion to digest so and so. So the direct absorption happens to the wall of the abdomen. That means the Snega doesn't need to go for further metabolism. If it goes for further metabolism, it may be separated into water soluble, non-water soluble. Then the fat will sediment. That sedimented fat will change into harmful nature, which causes fluctuation of lipid. But here, due to its presence of short chain and medium chain, there is no fluctuation of lipid profile. To prove this concept, I have attached an article. It clearly says the term that short-term escalating administration of long amount of Snega does not increase blood lipids. Where in the conclusion, the study found that the use of Snega Pana in 29 healthy volunteers for 4 to 6 days caused statistically significant reduction in abdominal circumference. That is, weight reduction is seen, where the serum triglyceride and serum very low density lipoprotein. Furthermore, 6 out of 29 volunteers showed a significant weight loss of more than 2 kgs. So it shows that our Snega Pana is not causing or increasing the lipids or harmful lipids, but in results, it's decreasing the lipids, which is not at all necessary for our body. In conclusion, what I'm going to conclude is, you can see in the picture, Agni has a property or guna of Ushna, Tikshna, Lagu, and Ruksha, where Grida, why I'm taking Grida is mostly will administer Snega Pana with Grida. So I'm taking Grida, which is Shita, Mridu, Guru, and Snigdha. So you can see Agni and Grida are completely opposite in nature. Okay. So what's my conclusion is, in this picture you can see it is a omam where the fire is in peak. If even though the fire is in peak, we are not pouring a ghee in a plenty manner, that is 500 ml or 1 kg, 1 liter of ghee and all. We're just pouring a ghee in a spoon. That means a small amount of sneha will never diminishes the agni, it will enhances the agni. Okay. So the action of snega in different posta can be understood based on samyak snigdha lakshanas. And snega jiramana lakshana and jirna lakshana explains the role of agni in the metabolism of snega. Thank you. These are my reference. Thank you so much.
Thank you, Dr. Amrita Kadesh Abram. Thank you for the wonderful presentation, Doctor. Next presentation is related to the Haridradi Churna importance. I would like to invite Dr. Netravati is taken for the paper presentation.
Namaste everyone. Myself Dr. Netravati S. Tegin, final year PG scholar, Ashwini Ayurveda Medical College and PG Center, Davangere. I would like to thank Pranava 2024 National Seminar Series for giving the opportunity to present my seminar. And my topic is a clinical study to evaluate the efficacy of Haridradi Churna in the management of Kafaja Panduroga. It was guided by Dr. Jayanti Ma'am, HOD and PG Guide, Department of PG Studies in Kaya Chikitsa, Ashwini Ayurveda Medical College and PG Center, Davangere. Contents. First one, introduction. Second, aims and objectives. Disease review. Under the disease review, Nidana of the disease, Samprapti of the disease, Lakshana of the disease, and Chikitsa of the disease is explained. And materials and methods, results, discussion, conclusion, and references. First one, introduction. Pandu is one of the most common illness that people face, and it's a clinical condition mentioned in Ayurveda with a skin manifestation of Ketaki Dhuli Saniba, that is whitish yellow in color, and the Pandu comes under Rasapradoshaya Vikara. A prominent diagnostic feature is failure on the skin, which occurs due to the quantitative and qualitative deficiency of Rakta Dhatu, that is Alpa Raktata, and it was correlated with anemia. It's a major global public health problem and the most prevalent nutritional deficiency disorder in the world. Majority of the people living below poverty line, unhygienic food habits, nutritional deficiency and illiteracy, and mechanical lifestyle which is fast, hectic, full of stress. All these factors create a Panduroga, and it is the most prevalent disease, appears to be common disease irrespective of their age, sex and religions. Hence the study was taken. And aims and objectives of the diseases. Aims: to evaluate the clinical efficacy of Haridradi Churna in the management of Kafaja Panduroga. And the objectives are to review the literature of Panduroga and anemia, to observe the clinical efficacy of Haridradi Churna in the management of Kafaja Panduroga with special reference to anemia. And the hypotheses are, that is research hypothesis and null hypothesis. The null hypothesis, first H0, is there is no significant effect on administrating Haridradi Churna on Kafaja Pandu with special reference to anemia. And the research hypothesis is there is a significant effect on administrating Haridradi Churna on Kafaja Panduroga with special reference to anemia. Next going on to disease review. First one, Nidana. In Panduroga, many are Pittakara Ahara Viharas are told. So I have taken only Kafakara Nidana, that is according to Sushruta Samhita Sutra 21 chapter 23rd shloka. It says Kafakara Nidanas, the persons who indulge in excessive Madhura and Amla Lavana Ahara and Snigdha Guru Pichila Abhishandi Guna Ahara and Viharas are Asya Swapna Sukha, Ajirna, Diva Swapna and Alasya. Who are more indulging Swapna, Diva Swapna and Alasya, they are going to take Kafakara diseases. And Ahara, that is excessive sevana of Yavaka, Masha, Mahamasha, Goduma, Tilapishta Vikruti, Ati sevana of Dadi, Dugda, Kushara Payasa, Iksha Vikara, Anupa, Udaka, Mamsa and Vasa, and excessive intake of Ahara Dravya containing Snigdha, Madhura, Guru Pichila Guna, and excessive use of Navana, Navamadhya, Pashita Anna, sedentary lifestyles like Cheshta Dveshi, Diva Swapna, Shaya Sukha and Asana Sukha. To Samprapti goes, the person who indulge in Nidana Kara Ahara Vihara result in Pitta Pradhana Tridosha Prakopa through the Vana Vayu. The Dushita doshas goes to Hridaya and circulation through Dasha, Damanis and Rasavaha and Raktavaha Sroto Dushti taken place, and Dushita doshas take sthana samshaya in Tvak Mamsa Ashaya and result in Dhatu Shaitilya and Dhatu Gauravata and result in Panduruga. And another Samprapti, like due to the Kafakara Ahara Vihara, Agni, Jataragni Vikruti takes place, and that is Manda Agni causes Rasavaha and Raktava Sroto Dishti result in Panduroga. And Lakshanas of Kafaja Pandurogas are Gauravata, Shweta Varnata of Netra, Tvakka, Mala and Mutra, Sada, Tandra, Brahma, Klama, Shwasa, Madhura Asya, Alasya, Aruchi, Praseka, Ritrava, Murcha and Shvayatu. Chikitsa mentioned for Kafaja Panduroga, Shlaishmiki Katutikshnoshnam, Shlaishmiki Katurukshošnam, and the drugs which are containing Katutikta Kashaya Rasa and Ruksha Tikshna Gunas and Vishnavira drugs and are overcome with Kafaja disorders and Tikshna Vamanati Virechana. The Shleshmana Vidhina Yuktam Tikshnam Vamana Rechana Manna Rukshatal Tikshnoshnam Katutikta Kashayakam. And materials methods, clinical data. The 40 subjects are taken from Ashwini Ayurveda College, and the literary data from modern books, medical journals and retrospective studies and internet studies. The drug source, the Aridradi Churna drug was taken by the Sushruta Uttara Tantra Panduroga Adhikara, and the Aridradi Churna contains Amalaki, Aritaki, Vibhitaki, Haritaki, which Haritaki and Haridra, each one part was taken and made into powders by pulverizers and passed through the mesh size 80, and ingredients were homogeneously mixed using blender and stock in container. The inclusion criteria are patients of either sex with a age group between 18 to 50 years and patients showing classical signs and symptoms of Kapaja Panduroga and HB below the normal range in men 8 to 13 and female 8 to 12. Exclusion criteria are patients having systemic and infectious disease, patient with genetic congenital acute blood loss associated liver cirrhosis, and pregnant and lactating mother. Laboratory investigations are HB percent MCH, MCV, PCV, MCHC, ESR for the diagnosis, and intervention. The Aridrada Churna given 6 grams twice daily with the honey for about 3 months, and each 30th, 60th, 93rd are the follow-up. The grading subjective parameters are given the gradings, that is Gaurava 1 to 3, Shweta Varnata 1 to 4, that's why the 14 symptoms are giving this much scoring. And the results taken 40 subjects here shows highly significant results on all the parameters except Shwayata and Morsha. Shwayata and Morsha only significant results are found, highly significant in all parameters. From the above stated total, the Aridradi Churna is having highly significant in all the parameters on Kafaja Pandu with a p-value less than 0.001. The average improvement was, total average improvement was 56.62%. In this work of 10 male patients, Kafaja Pandu, the HP improvement is 26.31 and 30 female 53 0.39 improvement results, and MCV 3.2% improvement, MCHC 1.65, and MCH 4.01, PCV 6.09, and RBC 9.79% improvement taken place. And discussion: probable mode of action of based on Rasapanchaka. The Haridradi Churna contains Haridradi Churna based action based on rasa are: the drug combination of Haridradi Churna is Katutikta Kashaya Madhura Amla Pancharasam. In whole, the dominant rasa of churnas are Katutikta Kashaya rasa, will break down the sampravti of Ama, Kapha Dushti, and Kapha Srotoroda. And probable action based on gunas are: the drugs are Lagu Ruksha Guna, which does the decrease of Snigdha property in Pitta, Srotoroda, and Kapha Ratva. Probable action based on Virya, that is, the drugs are Ushna Veera, do Kafahara effect except Amalaki. Probable mode of action based on Vipaka, Madhura Vipaka, which helps to restore the strength by acts as Rasayana. Probable mode of action based on Karma, it's a Tridosha Shamaka, Rudya, Balya, Ruchya, Kafagna, Rasayana, Ekrut, Uttejaka, Anulomana, Deepana, Pachana, etc. works to overcome with a Panduroga. That is, effect of Amalaki on Kafaja Panduroga. Amalaki is also a potent source of vitamin C, which is the most potent enhancer of non-heme iron absorption. Adding vitamin C source to a meal increase non-heme iron absorption up to 6-fold, which makes the absorption of non-heme iron as good as for better than that of heme iron. Further, ascorbic acid facilitated iron absorption by forming a chelate with phyric at acid pH level. Effect of Haridra, that is, Haridra maintains the normal function of Ekrut, convert rasa into Rakta, thus produce excellent quality of Rakta Dhatu by virtue of appetizer, digestive, and effectoprotective. As Kurkuma longa is provided an antioxidant, it has been found to be a very good immune enhancer. And overall effect of Haridradi Churna: Haritaki Churna and Amalataki Churna are the Rasayana Dravas which increase the Dhatus and also acts as iron supplement, and Amlaras of Amalaki and Haritaki helps in the absorption of iron in the intestine. The properties of other ingredients like Deepana and Pachana act on Jatra Agni by improving the Agni, relieving symptoms like Agni Mandya and Aruchi. By effect of Haritra Haritaki as Sroto Shodhana, they act at Datvagni level, helping in absorption. The Sroto Shodhana property along with Varnya Tvacha Guna reduces Pandutva. Madhura Vipaka in both formulation help in Pitta Shamana and does Tarpan of the Rasadhatu help in controlling Brahma. Because of Ushna Tikshna Lagu Rukshana, it pacifies the Kapha dosha. Because of the same guna, it increases Pitta dosha. Once it increases the Pitta dosha, the quantity and both the drug are having property of Sota Shodhana and Amapachana. These gunas helps in dosha to move from Shaka to Koshta. Once the dosha moves from out of the body, it relieves the Panduroga. Conclusion: the present research work was mainly aimed to explore the disease Kafaja Pandu with special reference to iron deficient anemia. Panduroga type here can be assessed iron deficiency because of the similarities in respect of etiology, pathogenesis, and clinical features and prognosis. According to statistics under the beneficiaries of Anemia Mukta Bharat campaign, 57% females are anemic and males 25%, and 31.1% in adolescent boys, 59.1% in adolescent girls, 52.2% in pregnant women, and 67% in children. Panduroga is Rasarakta Janya Vyadhi due to Kafaja Nidana. Most of the patients were having Madhura Katu Amla more. So Panduroga is Sadhya Vyadhi. Hence the Haridradi Churna effect on the Kafaja Panduroga because of its Ushna Guna and Katu Kashaya Rasa Pradhanas, it relieves in Panduroga. And these are the references. And finally, thank you for the opportunity, Pranava series. Thank you.
Thank you, Dr. Netravati. Thank you for the well-explained presentation. We know that pharmacology is an important area of Ayurveda. Next presentation related to the pharmacology. I would like to invite Dr. Deepthi TV for the paper presentation on the topic Ayurvedic Pharmacology, Dynamics and Kinetics unveiled.
A warm welcome to all of you. Myself, Dr. Deepthi TV, second year PG scholar from Department of Rasa Shastra and Bhaishajya Kalpana from Sri Jayendra Saraswati Ayurveda College, Chennai. Here I am presenting my topic entitled as Ayurvedic Pharmacology, Dynamics and Kinetics Unveiled. Having done the review study, here my prime aim is to understand pharmacodynamic and pharmacokinetic aspects of Ayurveda drugs with reference to Ayurveda principles, specifically Rasa Panchaka concepts. As we all know, pharmacology is the science which deals with interaction of drug with living organisms. The two main areas of modern pharmacology comprises of pharmacodynamics, that is, effect of drug on biological systems, and pharmacokinetics, which includes absorption, distribution, metabolism, and excretion. On the other hand, pharmacological action of Ayurveda drugs of formulation are based on the concepts of Tridosha, Panchamahabhuta, and Rasa Panchaka. In that, Tridoshas are the biological entities which maintains and controls the body with the combined effect of Panchamahabhuta. Rasa Panchaka comprising of Rasa, that is taste, Guna, physicochemical properties, Virya, potency of the drug, Vipaka, biotransformative effect, Prabhava, that is innate action or inexplicable energy. The first four factors of this Rasa Panchaka are based on comparative superiority or inferiority theory, Tara Tama, for the therapeutic action of the drug. For the Prabhava, more or less is the innate action or inexplicable pharmacological action is justified. Aims and objectives: to understand pharmacodynamic and pharmacokinetic concept as per Ayurveda theories, to review the importance of Rasa Panchaka in Ayurveda pharmacology, to understand pharmacodynamic and pharmacokinetic aspects of Ayurveda drugs with reference to Rasa Panchaka principles. Materials and methods. This study was thoroughly carried out after reviewing various classical Ayurvedic texts like Charaka Samhita, Ashtanga Hridaya, Sushruta Samhita, and reference books of Dravyaguna Vijnan by different authors. In addition to that, previously published articles, papers relating to the concerned topic of herbal drug interaction, pharmacological action of herbal drugs, etc. were also reviewed. The pharmacological action of Ayurveda drugs may be explained based on theories of Panchamahabhuta, Tridosha, and Rasa Panchaka. As per Ayurveda, the site of absorption responses on the properties or attributes of the drug. When drug get administered inside the body, then it forms Saraketta Vibhajana, absorbable and excretal function due to the action of Agni. Sarabhaga resides in body tissue, causes growth or vriddhi and loss, kshaya of particular tissue, that is dhatu, leading to pharmacological effects. The specific guna of the drug contributes towards some biological responses. Rasa, that is the taste of the drug, offers various physicochemical properties and contributes towards drug action. Virya is the concept of drug action which generally describes potency or strength of the drug. Drug possesses Shita Virya, causes contentment and maintains soothing effect. Ushna Virya of drug contribute towards digestive effect and is responsible for perspiration. Vipaka is another important aspect which is usually inferred to as the biotransformative phase of rasa or the post-digestive effect. Vipaka means metabolite of the drug, retaining rasa in its transformed form. Therefore, as per Ayurveda, the metabolite of drug may possess Madhura, Amla and Katu Vipaka. It can be assessed by its final action produced on dosha, dhatu and mala. Another concept of prabhava contribute towards drug action in the form of inexplicable energy. In fact, prabhava is the innate action of a particular drug, which is irrespective of other four logical factors. The pharmacological action mainly depends upon the predominance of rasa panchaka in the formulation or drugs. Example, Nimba is having Tikta rasa, Katu vibhaga, having rasa predominance, thus capable to pacify the Pitta dosha. Assessment parameters of rasa panchaka to the traditional medicines are Pratyaksha, Anumana, Aptobadesha. Modern parameters also mentioned by Dr. S.C. Dhyani are as follows. That is, taste thresholdment assessment, RESA, by measuring molecular weight of the substance or glycemic index, etc. for guna. Thermodynamics, that is endothermic and exothermic reactions for assessing the virya. Biotransformative phase of RESA or assessing product of the metabolism for vipaka. Lab techniques like TLC, HPTLC, HPLC, etc. for prabhava. As it is demonstrated on the table, also there are some assessment parameters described by ancient scholars as well as modern parameters as per the opinion of Dr. S.C. Dhyani, as we already discussed. So, Rasa Panchaka, Rasa, the traditional parameters are Pratyaksham, through direct means Anumanam, logical inferences, Aptobadesham, mentioned by ancient scholars. As per the modern parameters by Dr. S.C. Dhyani, taste threshold assessment. For guna, that is physicochemical properties, traditional parameters are Pratyaksha, Anumana, Aptobadesha, and the modern parameter like by measuring molecular weight of the substances, glycemic index, etc. For virya, Pratyaksha, Anumana, thermodynamics. Vipaka, Anumana, Aptobadesha as traditional parameters, biotransformative phase of rasa, assessing product for the metabolism as modern parameters. For Prabhava, Anumana and Aptobadesha as modern parameters, lab techniques like TLC, HPTLC, HPLC, etc. can be considered. Unlike contemporary medicines, Ayurveda formulations contain multiple herbs, minerals, and metals which possess multiple active principles and are expected to generate multiple actions. Hence, to understand the action of Ayurvedic medicines, it is imperative to conduct high-quality research works like network pharmacology, etc. So, what is network pharmacology? The one drug or one target or one disease approach to drug discovery is presently facing many challenges like safety, efficacy, and sustainability. Thus, new discipline called network pharmacology has emerged, which helps to understand drug actions and interactions with multiple targets. It uses computational power to systematically catalog the molecular interaction of a drug molecule in a living cell. It is also attempts to discover new drug leads and targets. So, network pharmacology analysis not only opens up new therapeutic actions, but it also aims to improve the safety and efficacy of existing medications. Finally, moving towards conclusion, it may be stated that Rasa, Guna, Virya, Prabhava contributes towards pharmacodynamic profile of Ayurveda drugs, while Vipaka resembles metabolic pharmacokinetic profile. A wise Vaidya should always accurately apprehend these concepts to explain the action of individual drugs or formulations. Still, it is impractical to modernize each and every concepts of Ayurveda, but utilizing and applying them practically with the help of modern parameters will create a firm base and help in yielding even more globally acceptable results. With this, I would like to conclude my session. Thank you.
Thank you, Dr. Deepthi. Thank you for the wonderful presentation. Next, we go to the next paper presentation. We know that Kharjura has many medical properties has been there. Next, we go to the Kharjura in importance in the Ahara Kalpana. Next, I would like to invite Dr. Megha Lakshman Padare for the paper presentation. Next, I would like to invite Dr. Megha Lakshman Patare for the paper presentation.
Hello everyone, myself Dr. Megha Lakshman Pathare. I am MD Scholar of Dravyagun Vigyan. I am from college LRP Islampur, Sangli. Today my topic of paper presentation is conceptual review of Kharjur as Ahar Kalpana in Bruhat Trey. Let's start my topic. Introduction. In Ayurveda, we use many plants as Aharya Dravya as well as Aushadhi Dravya also. Kharjur is the most traditional medicine as well as Aharya Dravya in India. Its fruit is known as date, which is the edible part of that plant. It is valuable food and medicinal properties stated by systems of medicine like Ayurveda, Siddha, Unani medicine, and secure valuable status in many formulations. It contains high amount of tannins and are used in different disease conditions like swara, like Shwaskas, Raktapitta, Daha, Murcha, Abhighat, Kshaya. The fruits are rich source of carbohydrates, vitamins and proteins. Acharya Charak has described Phalavarga, that is group of fruits. In Sutrastan 27th chapter, Annapan Vidhi Adhyay. Kharjur is the most used fruit in various contexts. In this review, we have collected various uses of Kharjur as Ahar mentioned in Charak Samhita. Also in Shushruta Sutrastan chapter 42, Rasa Vishesh Vijnaniya Adhyay and Sutrastan chapter 46, Annapan Vidhi Adhyay, Kharjur is mentioned. In Sarth Vagbhata, Sutrastan chapter 6, Anna Sarup Vijnaniya Adhyay, Kharjur is mentioned. Acharya Charak has described various properties of Kharjur in Phalavarga. It is mentioned in Shramahar and Virechanopak Gana, also in Madhur and Kashaya Skanda. Acharya Shushrut and Acharya Vagbhat also mention Kharjur in Phalavarga and Madhur Varga. Pinda Kharjur is also known as date palm, cultivated for its edible sweet fruit. Date fruits are a good source of low-cost food. It is sweet, astringent in taste. In Ayurveda, it is presented that dates should be consumed daily. Date is a potent nutritive aphrodisiac, tonic, laxative fruit. It has different pharmacological actions like antibacterial, anti-inflammatory, anti-diabetic, anti-asthmatic, nephroprotective, and aphrodisiac activities. Nowadays, its fruit is being used in the different Ayurvedic formulation for the treatment of various diseases like fever, cancer, pitta disorders, etc. Phytochemical investigation shows that the fruit contains anthocyanin, phenolics, sterol, carotenoids, and flavonoids. Objective: to analyze Kharjur in Bruhattrayi and to understand Guna, Karma, Rasa types and Ahar Kalpana of Kharjur in Bruhattrayi. Material and methods. Material for this we refer Bruhattrayi with few articles related to Kharjur published on internet, and method is conceptual review. For this we study Kharjur. Its Latin name Phoenix sylvestris. Types: there are two types of Kharjur found in market. One is Kharjur and second one is Pinda Kharjur. Latin names are different for these two. Synonyms: in Sanskrit it is called as Kharjur, in Hindi Khajur, Pinda Khajur, in Marathi Khajur, in Gujarati Khajur, in Kannada Kharjura, in Malayalam Prantha Puzam, in Bengali Khejur, and in Punjabi we called it as Pinda Khajur. Botanical classification of Kharjur. It is from kingdom Plantae, order Ericalis, family Ericaceae, genus Phoenix, species Sylvestris. Kharjur's botanical description. It is medium-sized plant, 12 to 25 meter tall, growing singly or forming a clump with several stems from a single root system. The leaves are 4 to 6 centimeter long with spines on petiole. Fruits are oval. After ripening, fruit is 2 to 2.5 centimeter long and 6 to 8 millimeter thick. Chemical composition of Kharjur. It contains flavonoid, glycosides, flavonols, free phenolic acid, steroids, enzymes, and anthocyanin. Properties and actions. Guna Snigdha Guru, Rasa Madhur Kashay, Vipak Madhur, Virya Sheet, Karma Vata Pitta Shamak, Balya, Hridya, Brain Tonic, Tarpak, Vatahara, Vamak, Kapha and diuretic. Properties of Kharjura mentioned in Ayurvedic Samhitas. In Charak Samhita, it is Madhur, Guru, Sheet, Brihan, Rushya. In Sushruta Samhita, it is Rudya, Sheet, Tarpan, Guru. In Ashtang Hriday, Madhur, Guru, Sheet, Brihan, Rushya. Vishtambakarak, Pitta and Rakta Shuddhikar. In Bhava Prakash, it is Deepan, Balya, Shukran. In Raj Niguntu, it is mentioned as Kashay, Rushya, Brihan, and antimicrobial properties. In Dhanvantari Niguntu, it is mentioned as Ridya, Sheet, and Guru. In Kayyadev Niguntu, it is mentioned as Sheet, Madhur, Guru, Snigdha, Ridya, and useful in Shwas, Kas, Jwara. Part used and their uses. We use fruit, seed, leaf, flower and gum for many useful remedies. Nutritional value per 100 grams of Kharjur is mentioned in this image. It contains energy, carbohydrates, protein, fat, vitamins, etc. References of Kharjura in Bruhattrayi. In Charak Sutra Sthan, Charak Viman Sthan and Charak Chikitsa Sthan, Phala Majja of Kharjura should be used as Ahar Kalpana. In Rakta Pitta, Rajakshma, in Pittash Gulma, Kharjur should be used. But in Charak Chikitsa Sthan, Acharya Charak has mentioned that it is contraindicated in Ashmari. Acharya Shushrut mentioned Kharjur in Madhur Varga and in Phala Varga. in Shushruta Sutrasthan Adhyay 42 and Adhyay 46. Acharya Vagbhat mentioned Kharjur as a phala in Ashtangruday Sutrasthan Adhyay 6. Discussion and conclusion. Kharjur is a nutritious fruit. It has been used for treating Pittashvikar, Madatte, Jwar, Shwaskas, Swarbhed, Rajakshma. Acharya Charka has mentioned it is in Shramahar Gana, Phala Asav and Phalavarga. It has sweet and astringent taste which help in Tarpana Karya. Kharjura is relatively cheap, nutritious and is devoid of toxic effects. This plant has a great medicinal value as it has been reported to have versatile phytochemicals including phenolics, sterols and carotenoids. It also contains different types of minerals and vitamins. These phytochemicals have been responsible for the different pharmacological effects like antibacterial, anti-inflammatory, anti-diabetic. It is safe to suggest that their consumption should be recommended on a daily basis for better health. References for this study are as follows. Thank you so much for giving me opportunity to present my paper in front all of you.
Thank you, Dr. Megha. Thank you for the wonderful presentation. We know that Kana Saindavadi Anjana has been very important in the Ayurvedic field. It has been many importance is there. The Kana Saindavadi Anjana has been used in the eye doshas, etc. Next, we go to the paper presentation related to the Kana Saindavadi Anjana. I would like to invite Dr. K.K. Chaitanya for the paper presentation. Next, I would like to invite Dr. K.K. Chaitanya for the paper presentation on the topic Kana Saindavadi Anjana.
Good morning to one and all. Myself, Dr. Chaitanya. A paper presentation on Kana Saindavadi Anjana. It is taken from Ashtanga Hridaya Uttarasthana Timira Pradisheda Madhyaya. Dadhyat Ushira Niryuhi Shurnidam Kana Saindavam Tat Shrudam Sagridam Bhuyaha Hajet Shaudram Ganek Shipe Shidech Masmin Idam Sarvaje Timire Anjana. So the method of preparation is the decoction of Ushira is prepared where 20 gram of Ushira is taken with 20 ml of water and the content is reduced to 80 ml. Then Pipili and Saindava is taken 2.5 grams each and it is made into fine powder. So this is the Kalka Dravya. Now the prepared Kwada has been added onto the Ghalva Yandra and it is mixed well. Now 20 ml of ghee is taken. Now the Grida Kalpana method is adopted. The 20 ml of ghee is added onto a bronze vessel with no water content. Then add the kalka well mixed in 80 ml of water. Cool, cook until the madhyama paga is obtained and then filter. Once cooled, madhu 15 ml is added and it is stored in an airtight container. Yeah. So the clinical indication, the patient indication was a seborrheic blepharitis, where the patient complained of itching in the lid collaterals with eyes swelling, foreign body sensation, burning sensation, mild lacrimation, pain in bilateral eyes since 1 year, and the patient was also having dandruff. Now, the treatment was only with Kadas Saindavadi Anjana drops twice a day for 20 days. So the result was absence of itching, swelling, foreign body sensation, and the scalp deposits, burning sensation, and pain in bilateral eye symptoms was seemed to be mild. So the Kadu Tiktarasa, Lagu Prukshaguna, and Ushna Virya have acted for Kapha Shamana, and it is also acting as Reghana. So the scales are being removed, reducing all the signs and symptoms. Thank you.
Thank you, Dr. Chaitanya. Thank you for the wonderful presentation. We know that diabetic neuropathy is complete or partial damage to the nervous system caused by long-term diabetes. Next is a diabetes neuropathy related presentation. I would like to invite Dr. Saraswati Balajapalli for the paper presentation on the topic integrating Ayurveda into managing diabetic neuropathy.
Greetings. Under the guidance of Dr. Pradeep Kumar Maharana sir and Dr. Vijay Raja sir, I, Dr. Saraswati, will be presenting on the topic integrating Ayurveda into management of diabetic neuropathy. Introduction. Diabetes mellitus is a chronic condition and its prevalence is expected to rise worldwide. According to the International Diabetes Federation, 537 million people are diagnosed with diabetes, which is projected to rise to 643 million by 2030. Peripheral neuropathy is most common and concerning complication of diabetes, with up to 50% being asymptomatic. The prevalence of peripheral neuropathy is estimated to be between 18.8 to 61.9% among adults with diabetes. The exact cause of diabetic peripheral neuropathy is not known. Proposed theories include metabolic, neurovascular, and autoimmune pathways. The patient with peripheral neuropathy often present with varying degrees of numbness, tingling, aching, burning sensation, weakness of limbs, and pain. DPN is the main triggering factor for foot complications, which can lead to significant complications ranging from paresthesia to loss of limb and life. These together can inflict significant economic, social, and health burden. Early assessment of symptoms of peripheral neuropathy helps avoid neuropathic foot ulcers to combat potential morbidity and mortality. Coming to the case, a 57-year-old female patient has approached our OPD with complaints of burning sensation and numbness in both her feet for 1 year but aggravated in the past 3 months, which has interfered with her day-to-day chores. She is a known case of diabetes for past 10 years and her HbA1c being 8.7 and under contemporary treatment for the same. Despite allopathic treatment, her symptoms persisted, leading the patient to opt for Ayurvedic management. Clinical examination revealed signs of diabetic neuropathy, and DNE, MNSI, and TCNS were the scales used for assessment. The patient was advised to get admitted in the IPD for further treatment, including external procedures and internal medication. The personal history, her appetite was reduced with metallic taste in the mouth along with increased burping. Bowel was regular and increased nocturnal frequency of micturition. Sleep was reduced due to burning sensation, and due to unbearable pain and numbness, the patient was dependent on her family and house help for daily chores, which took a toll on her mental health and confidence. And she has shown early signs of depression due to her physical condition. These are our Ashtavida Pariksha and Dashavida Pariksha. Internal medications were given were Nisha Katakadi Kashayam, Yogaraja Gugulu, Chandraprabhavati, and Gandhira Rasayanam, which was added during follow-up. Nisha Katakadi Kashayam is the most known Ayurvedic formulation, and the formulation has anti-hyperglycemic effect, along with regulating the blood glucose level. Haridra not only regulates the blood glucose level, but also improves insulin sensitivity in resistant stages. Yogaraja Kukulu helps in reduction of the pain and helps in reduction of Rameha Upadrava Lakshanas and is Dhatu Pushtikara. Chandraprabhavati was given 1 tablet thrice a day after food, which acts as Tridosha Shamaka, has anti-hyperglycemic effect and useful in urogenital disorders. Gandhira Rasayanam has mugi as its main ingredient, which is known as anti-diabetic, antioxidant and immunomodulatory, which helps in reduction of symptoms and also improving the immunity and imparts strength to the dhatus. External therapies were Abhyanga with Pinda Taila and Karpuradi Taila, which helps in blood circulation, lymph drainage, and stimulates nervous system and reduction in the pain. Pinda Tailam helps in reduction of Daha and Shula, while Karpuradi Tailam helps in reduction of Shula and Suptata. Patrapinda Sweda helps in local Svedana and further helping in reduction of pain and tingling sensation. Kshiravasti with Triphala Kshirapaka. Kshiravasti has been explained in Vata Rakta Chikitsa for reduction of Daha and Shula. And Triphala being Tridosha Shamaka was taken for Kshiravasti, which helps in reduction of the symptoms. Matravasti with Dhanvantara Mergupakam helps in reduction of excess Rupshata and also helps in Shula and Suptata reduction. The patient was already on diabetic diet prescribed by her contemporary physician, so we advised her to follow the same diet throughout the procedure. She had significant relief from the symptoms and nocturnal micturition has reduced from 3 to 4 per night to 1 to 2. Her sleep improved. Her appetite, she gained her appetite and she became relaxed and energized. The patient was afraid to even put her foot down before, but later she started doing her daily chores without interruption and regained her self-confidence. These are the observations where HbA1c before treatment was 8.7 and after follow-up was 6.2. Ayurveda has extensively explained about Prameha along with its Purvarupa, Beda, Samprapti and Chikitsa. It also mentioned about different treatment approaches and it also emphasized on diet and lifestyle maintenance in Prameha. Diabetic neuropathy is a complication of type 2 diabetes, while the symptoms of DPN are similar to Purvarupa of Prameha. So was correlated to Prameha and Prameha Upadrava, and treatment protocol was tailor-made according to the condition of the patient and her history. Ayurvedic management, including therapies like Abhyanga, Patrapinda, Sweda, Kshiravasti, along with Ayurvedic medicines, dietary and lifestyle adjustments, have shown promise in alleviating symptoms and improving the patient well-being. Ayurveda has many formulations explained in Prameha, which has shown impeccable results in long-term use. The most commonly used contemporary medicine, metformin, has resulted in side effects, in which some of which are GI related and were also reduced during the Ayurvedic formulation during this process of internal medicine. Metformin acts only as a anti-hyperglycemic, whereas Ayurvedic formulation has exerted insulin sensitization action also, which helpful in prevention of insulin resistance and related complications. This curriculum of management of diabetes and related complications can be effectively modified, including Ayurvedic concepts of healthy living and by following a proper regimen. Proper implementation of Ayurvedic management can yield enormous results and hasten recovery. Ayurveda yet again has shown its benefits in reduction lakshanas of prameha, which is one of the leading non-communicable disease in present day, and also helps in improving the quality of life. I would like to conclude saying that if systematic and dedicated research happens in this direction, Ayurveda could revolutionize and contribute a great deal to non-communicable diseases management and can be mainstream healthcare system in near future. Thank you.
Thank you, Dr. Saraswati. Thank you for the wonderful presentation. Next, we go to the Haridra Khanda related paper presentation. I would like to invite Dr. Prajakta Harida's story for the paper presentation on the topic Therapeutic Study of Haridra Khanda in the Management of Shida Pitta.
Good evening, everyone. Myself, Dr. Prajakta Haridasuri, MD Chickitsa, second year from SST Ayurvedic College, Sangamner. My paper presentation topic is Therapeutic Study of Haridra Khanda in the Management of Shita Pitta. Shita Pitta is the most important and common skin problem described in Ayurveda. याच्यामध्ये प्रकोपित झालेला वात आणि कफ दोष पित्तासोबत मिक्स्ड होऊन शीतपित्त व्याधी निर्माण होते. तर प्रकोपित वात निर्माण होण्याची वेगवेगळी कारणे सांगितली आहेत, ज्याच्यात डाएट, एन्व्हायरमेंटल फॅक्टर्स, लाईफस्टाईल फॅक्टर्स हे सर्व येतं. आजकालच्या लाईफस्टाईलमध्ये स्पायसी फूड्स, फास्ट फूड्स ज्याची न्यूट्रिशनल व्हॅल्यू कमी आहे, या गोष्टींमुळे खूप साऱ्या ॲलर्जिक रिॲक्शन्स निर्माण होतात. ज्याचं एक मोस्ट कॉमन एक्झाम्पल म्हणजे अर्टिकॅरिया. तर शीतपित्त व्याधीमध्ये वात, पित्त, कफ हे 3 दोष इन्क्रीज होतात, वाढले जातात, आणि ज्याच्यामध्ये पित्त दोष हे मोस्ट ॲग्रिगेटिव्ह फॅक्टर आहे, ज्यामुळे शीतपित्त निर्माण होतं. मग आपण शीतपित्त हे अर्टिकॅरिया सोबत कोरिलेट करू शकतो. तर शीतपित्तावर हरिद्रा खंड हे युजफुल आहे, कारण त्याच्यामध्ये शोथहर, कंडुग्न आणि रक्तशोधक ह्या प्रॉपर्टीज हरिद्रा खंडामध्ये असल्यामुळे ते शीतपित्तामध्ये होणाऱ्या कंडू म्हणजे इची किंवा काही रॅश असतील हे सगळं घालवण्यासाठी हरिद्रा खंड युजफुल आहे. तर शीतपित्त हे त्वकविकार मानलेलं जातं. शीतपित्तामध्ये 2 वर्ड्स आहेत, एक तर शीत आणि पित्त. शीत म्हणजे वात आणि कफदोष जे की पित्तासोबत मिक्स होऊन एक्सटर्नली आणि इंटरनली म्हणजे आभ्यंतरता आणि बाह्यता मार्गात सगळीकडे बॉडीमध्ये रॅश निर्माण करतात. त्यामुळे शीतपित्त निर्माण होतं. माधव निदानांनी सांगितलेलं आहे की थंड हवेचं सेवन केल्यानंतर, मारुत सेवन झाल्यानंतर वात वाढला जातो, कफदोष वाढला जातो आणि तो पित्तासोबत मिक्स होऊन शीतपित्त व्याधी निर्माण होतो. तर वात, पित्त, कफ ह्या त्रिदोषांची दृष्टी झाल्यानंतर रक्त आणि रसधातूची दृष्टी निर्माण होते, ज्याच्यामुळे ते रॅशेस निर्माण करतात. आता आजकालच्या जगात खूप इम्प्रॉपर आणि अनहेल्दी फूड हॅबिट्स आहेत, त्याचप्रमाणे फास्ट अर्बनायझेशन आहेत, पोल्युटेड एन्व्हायरमेंट, वर्क, काम हे ड्युटीज शिफ्टमध्ये आहे आपल्यासारख्या, त्यानंतर स्ट्रेस फॅक्टर आहे, अँझायटी, ह्या सगळ्या कारणांमुळे वात इन्क्रीज होतो, ज्याच्यामुळे शीतपित्त व्याधी निर्माण होऊ शकतो. आपण आता शीतपित्त अर्टिकॅरिया सोबत सुद्धा कोरिलेट करू शकतो, कारण त्या दोघींचे कॉजेस आणि सिम्पटम्स सेम आहे. आता हरिद्राखंड हे ड्रग ऑफ चॉईस आहे शीतपित्तवरती. तर हे भेषज रत्नावलीमध्ये मेन्शन केलेले. हरिद्रखंडाचा जो कटू तिक्त रस आहे ज्याच्यामुळे अग्निमांद्य निर्माण होतं, कमी होतं. चाटराग्नी वाढतो. चाटराग्नी वाढल्यामुळे तो धात्वाग्नी वाढवतो आणि रस आणि रक्तधातूची दृष्टी कमी करण्यास कार्य करतं. तर आता ह्या शीतपित्ताचे रूप सांगितलेत, म्हणजे लक्षणं सांगितलेत. त्याच्यात काय काय? इन्फ्लामेशन लाईक इन्सेक्ट बाईट, म्हणजे टोचल्यासारखी वेदना निर्माण होते. वरती दष्ट संस्थान शोथ, त्यानंतर कंडुभवन, सिव्हिअर इचिंग, तोदभोल, एक्सेसिव्ह पेन लाईक प्रिकिंग, त्यानंतर छर्दी, कधी कधी वॉमिटिंग होतं, फिवर येतो, ज्वर, विरह, बर्निंग सेन्सेशन, हे सगळे शीतपित्ताचे सिम्पटम्स म्हणजेच लक्षण आहेत. तर याच्यावरती हरिद्रखंड हे ड्रग ऑफ चॉईस आहे. तर हरिद्रखंडाचे कंटेंट पाहूया. हरिद्रा, शुंठी, पिप्पली, मरीच, एला, नागकेशर, लोहभस्म, घृत आणि शर्करा पाक. तर हे हरिद्रखंड आपण बनवणार कसं? तर हरिद्रा हे घृतामध्ये फ्राय करायचं, म्हणजे भाजून घ्यायचं, त्याच्यामध्ये शर्करा पाक टाकायचा. शर्करा पाक टाकल्यानंतर शुंठी, पिप्पली, मरीच, एला, नागकेशर यांसारखे सगळे जे पावडर ड्रग्ज आहेत, म्हणजे चूर्ण स्वरूप आहे, ते सगळं मिक्स करायचं आणि एक ग्रॅन्युलर कन्सिस्टन्सी आल्यानंतर, म्हणजे आपण तार येतो असं म्हणतो, तार आल्यानंतर हरिद्रखंड निर्माण झाला असं समजायचं. याची मात्रा आपण 6 ग्रॅम घेऊ शकतो बीडीमध्ये. बीडी म्हणजे सकाळ आणि संध्याकाळ 6 ग्रॅम. अल्पोष्ण जले सेवन काल हे व्यान आणि उदान काल, सकाळी आणि संध्याकाळी जेवणानंतर. तर हे हरिद्रखंड शीतपित्तावर कसं ऍक्शन करतात, म्हणजे त्याची संप्राप्ती बघणं कशी होते. तर कटू तिक्त जो रस आहे हरिद्रखंडाचा, ज्याच्यामुळे अग्निमांद्य कमी होतं आणि जठराग्नी वाढतो. जठराग्नी वाढल्यामुळे धात्वाग्नी वाढून रस आणि रक्ताची दृष्टी ही कमी करतं. तर अग्नी जर करेक्ट झाला तर जे रसधातू आहे ते व्यवस्थित निर्माण होतं आणि रसधातू निर्माण झाला की त्याच्या समोरील धातू म्हणजे रक्तधातू, हे सगळे धातू नीट फॉर्म होतात. तर हरिद्रखंड हे वात आणि कफदोषाला बॅलन्स करतो आणि बॉडी मधले टॉक्झिन्स म्हणजे आम्लद्रव्य बाहेर काढलं जातं. त्याच्या अँटीप्युरेटिक आणि सुदिंग प्रॉपर्टीज मुळे इचिंग म्हणजे कंडू, स्वेलिंग आणि काही रॅश असतील तर ते सगळे कमी होतात. आता हरिद्रखंडामधले जे कंटेंट्स आहेत, जे घटक आहेत, त्याचे विषग्न, कंडुघ्न, कुष्ठघ्न, शोथघ्न, ह्या सगळ्या प्रॉपर्टीजमुळे ते संप्राप्ती भग्न करण्यासाठी पण उपयोगात येतात. त्याचप्रमाणे हा शीतपित्त व्याधी मध्ये त्रिदोष इन्व्हॉल्वमेंट आहे, म्हणजे त्रिदोषांमुळे शीतपित्त निर्माण होतं. त्यामुळे हरिद्रखंड हे त्रिदोष ड्रग पण आहे, ज्याच्यामध्ये हरिद्रा हे जे आहे मेन इन्ग्रेडियंट, त्याच्यात त्रिदोष शामक प्रॉपर्टी आहे. त्याच्यामुळं त्रिदोष इन्व्हॉल्व असलेलं शीतपित्त कमी करण्यासाठी त्रिदोष ड्रग आपण वापरतो. त्याचप्रमाणे हरिद्राच्या प्रॉपर्टीज आहेत, अँटी अलर्जिक आहेत, अँटी इन्फ्लामेटरीज आहेत. हरिद्रा ग्लूथ, शुगर म्हणजे ते शुगर लेह, हे सगळं बॉडीजला साथमी आणि वर्ण्य प्रॉपर्टीज आहेत, बाकीचे इन्ग्रेडियंट, ज्याच्यामुळे आपल्या त्वचेला नॉर्मल स्टेजमध्ये आणण्यास हे उपयोगात येते. यावरून कन्क्लुजन असं आहे की हरिद्रखंड हे सेफ आहे आणि इफेक्टिव्ह. आता आयुर्वेदिक सगळेच ड्रग सेफ आणि इफेक्टिव्ह आहेत, ज्याच्यामध्ये शीतपित्तावर हे चांगलं कार्य करतं. हरिद्रखंडामुळे एकतर बॉडीचं डिटॉक्सिफाय होतं, म्हणजे टॉक्झिन निघून जातात, दोषाच बॅलन्स होतात. त्यामुळे हे एक होलिस्टिक ट्रीटमेंट म्हणून आपण यूज केली जाते. त्याचप्रमाणे हरिद्राखंडामधले हरिद्रा हे मेन कंटेंट, ज्याच्या खूप वेगवेगळ्या प्रॉपर्टीज आहेत. अँटी इन्फ्लामेटरी येते, अँटी अलर्जिक आहे, त्रिदोषग्न आहे, वर्ण आहे, कंडुघ्न आहे, जे की सिम्पटम्स आहेत शीतपित्ताचे लक्षण आहेत, ते सगळं कमी करण्याचं काम ह्या हरिद्रखंडामध्ये, ज्याच्यामुळे संप्राप्ती भग्न होऊ शकते. त्याचप्रमाणे निदान परिवर्जन ही तर प्रत्येक व्याधीची चिकित्सा आहे. निदान परिवर्जन फॉलो करून सुद्धा आपण ह्या डिसीज पासून, ह्या व्याधीपासून दूर राहू शकतो. रेफरन्सेसमध्ये भैषज रत्नावली, चरक संहिता, भावप्रकाश, निघंटू आणि माधव निदान या सगळ्यांमध्ये शीतपित्त व्याधीवर हरिद्राखंड कार्य करतात हे दिलेलं आहे. तर असा हा माझा टॉपिक आहे की हरिद्राखंड हे आपण शीतपित्त व्याधीमध्ये मेन चॉईस ऑफ ड्रग म्हणून यूज करू शकतो, ज्याचा की खूप चांगला इफेक्ट जाणून येतो. थँक्यू सो मच.
Thank you, Dr. Prajakta. Thank you for the presentation. We know that medicinal plants are of great importance in Ayurveda, as their specific properties are used for a wide variety of diseases and treatments. However, protection of these plants from nature is essential. Cryptopreservation is a new method of storing plants at low temperature to preserve their vitality. Our next presentation topic is cryopreservation technology, new vision to preserve Ayurvedic medicinal plants. I would like to invite Dr. Adira S. Kumar for the presentation.
Good afternoon, one and all. Myself, Dr. Adira S. Kumar, second year PG scholar from the Department of Dravyaguna Vignana, Amrita School of Ayurveda. I am going to present my seminar on the topic Cryopreservation Technique, a new approach to conserve the Ayurvedic medicinal plants. Moving to the introduction, cryopreservation is known as an applied aspect of cryobiology or the study of life at low temperature. Plant cryopreservation is a genetic resource conservation strategy that allows plants such as seed, pollen, shoot tip, or dormant buds to be stored in liquid nitrogen at minus 196 degrees Celsius. This methodology ensures maintenance of samples viability after thawing. This genetic resource can be regenerated into plants and used in the field. India is having one of the richest biodiversity of plant species, including medicinal plants. Due to overexploitation of medicinal plants, there is scarcity to meet the increasing demand of raw material. So, to tackle the situation, cryopreservation technique is one of the powerful tools for preserving the various parts of medicinal plants. Aims and objectives. The present study aims to review how the cryopreservation technique helps in the field of Ayurveda to conserve the medicinal plants. The medicinal plants contain an effective bioactive compound used in manufacturing medicine against various diseases. As a result, species of medicinal plants have become rare, endangered, and critically endangered due to the high consumption rate of plant-based medicine compared to growing. So, the risk of plant material loss is increasing day by day. To compensate for those risks, the culture of medicinal plants should be maintained or conserved for a long time by using cryopreservation technique. Methodology. Literature search was done from PubMed and Science Direct by using keywords like cryopreservation, medicinal plants, Ayurveda. From these numerous articles, 8 of the most relevant articles were selected. Observation and result. In this study, we come to know that various endangered Ayurvedic medicinal plants like Picrosia guruva, Balaneria jadamansi, etc. can be preserved through various cryopreservation methods. Some of the methods are cryopreservation by encapsulation dehydration, vitrification, weak cryoplate technique. The resulting plants after high cryopreservation appeared normal without any callus formation or morphogenic variation. Compared with mother plants, there is no change in the chemical constituents that are generated from cryopreserved plants. Discussion. Plant cryopreservation at ultra-low temperature in liquid nitrogen at minus 196 degrees Celsius has proven to be an effective, long-term, low-cost, and suitable conservation method for many plants. Technique of cryopreservation include selection of plant material, addition of cryopreservant, freezing, storage in liquid nitrogen, thawing, washing, and reculturing, measurement of viability, regeneration of plants. By using vitrification method and plant vitrification solution 2 shows the highest shoot recovery, that is 91.6% of vulnerary dormancy when compared to the plant vitrification solution 3. Cryopreservation of zygotic embryo of Podophyllum hexandrium was done with vitrification and weak cryoplate technique, and it was found that in weak cryoplate technique 90% of regrowth was obtained as compared to vitrification. Axillary bud of Cannabis sativa was cryopreserved by using weak cryoplate droplet vitrification. It was found that mother plants and regrown cryopreserved plants were highly comparable to each other. By using different cryopreservation techniques and culture medium, we can increase the survival of the plant material. We can also use shoot tips, axillary bud, pollen, embryo, etc. for cryopreservation. From all this study article, we can see that cryopreservation technique is the ideal method for conservation of Ayurvedic medicinal plants. Disease-free plants and endangered species can be conserved, propagated, and maintained for a long time. Conclusion: the medicinal plants and secondary metabolites are extensively used in the drug and pharmaceutical industry. Meanwhile, due to overharvesting, these plants has got endangered. So, conservation of this Ayurvedic medicinal plant resource is of high priority. In order to overcome this situation, we can use the cryopreservation technique that conserve the Ayurvedic medicinal plant for the future. These are my references. Thank you.
Thank you, Dr. Adira. Thank you for the well explained presentation. Dear participants, diabetes mellitus is a prevalent disease worldwide, and various factors have contributed to its development. Next is an interesting topic. I would like to invite Dr. Vaishali N for the paper presentation on the topic Future of Ayurvedic Treatment for Diabetes, a Holistic Approach.
Good evening to everyone. This is Dr. Vaishali from Sri Jayendra Sasri Ayurveda College and Hospital, Nazratpet, Chennai, doing second year in PG Department of Kaya Chikitsa. Here I am going to present a case study titled The Future of Ayurvedic Treatment for Promegam, a holistic approach, under the guidance of Dr. Suvendu Raut sir, who is Professor HOD PG Department of Kaya Chikitsa, and co-guidance of Dr. Vijay Raja sir, who is Assistant Professor PG Department of Kaya Chikitsa. Let's go inside it. What is diabetes? It is one of the metabolic disorder characterized by hyperglycemia resulting from defects in insulin secretion, insulin action, or both. And recent studies shows that diabetes is caused by impairment of immune system. Diabetes is on the rise, and India is one of the top 10 in the prevalence table. It is steadily increasing everywhere and has become a rising risk for healthcare globally, with a considerable impact on human life and health expenditures. Here, I gonna present a case who is around 63 years old, a retired government staff, came to our hospital with complaints of frequent urination associated with increased appetite, burning sensation of palms and foot, and letharginess. He was diagnosed with diabetes mellitus with HbA1c of 12.5, along with fasting blood sugar of 210 mg per dl and postprandial of 300 mg per dl. Gradually, he developed increased urination during nighttime and diagnosed as type 2 diabetes mellitus in contemporary medicine. The patient was not interested in taking other medicines, hence he came to our college for betterment. His personal history was found to be he was a vegetarian with increased appetite. His sleep was disturbed due to increased during nighttime maturation, and his bowels were regular. He has a habit of taking coffee 5 times a day, and his addictions were nil. His vitals were very normal, and his weight was found to be 75 kg. And the systemic examination includes CVS was normal, the respiratory system was normal. He was conscious and oriented with his abdomen soft and non-tender. In Ayurveda, we did Ashtavida Pariksha and Dashavida Pariksha, and he was found to be a Kaphavata Nadi with Prabhuta Mutrata, and his Jigva was Liptam, his Drip was Pravaram, Akriti was Madhyam, and in Dashavida Pariksha we found he is a Vata Prakriti with Kaphavata Vikruti, and his Sattvam is Madhyamam, Ahara Shakti is Avaram, and his Vayas is Vriddha. Hence, we administered medicines which as working in Kaphavata Hara, like Nishakatakadi Kashayam, Nishamlaki Churnam, Vasanta Kusmakararas, Chandra Prabhavati, and Shilajit for the duration of 6 months from May to December in permutation and combination of these medicines. The results was found to be this fasting was reduced from 210 to 95, postprandial was reduced from 300 to 140, and this HbA1c was found to be reduced from 12.5 to 6.5. How this medicine works? Let's see the mode of action. Like Nishakatakali Kashayam as Kashaya Tiktarasa, Lagu Ruksha Guna, and Vata Kafahara Karma because of its Shita Ushna Viryam and Madurakatu Vipakam, and it has hypoglycemic activity. Vasanta Kusmakararas, which acts as a rasayanam, it helps in improving the beta cell function. And Chandra Prabhavati, it has Katutikta Kashaya Madurarasa, Ushna Virya, Lagu Ushna Guna, Tikshna Ruksha Guna, and it has Virukshna and Chedaniya property, which acts on Kapha dosha, and it also acts as a Rasayana property, and it works in Balyam. Shilajit tablets works in islet cells by accumulation of cytotoxic free radicals, and it has a cyanum effect, and it also has anti-glycemic property. Nishamlaki churnam has anti-diabetic activity and acts on Vata Kapha dosha, and it has been said in Chakradatta that Nishamlaki churnam can be administered with honey. Hence, in this case, it was very helpful to reduce the Medo Dushti and Mansakleda Dushti, which has been the main cause for Pramegam. This Mansakleda Dushti affects Mutravagashrotas and Vankshana and Basti Margam, leading to Pramega. In Pramega persons, Kaphavata Vikruti will be there, hence treatment has to focus on Samprapti Vikadara. Medicines that works in pancreas promote proper insulin secretion and acts as Rasayana therapy can be administered to the patients. Thus, I conclude my study that Ayurvedic herbal mineral drugs helps in making people free from medicines and helps in reversing diabetes. Thank you.
Thank you, Dr. Vaishali. Thank you for the wonderful presentation. Dear participants, the use of Narayana Churnam is very effective in healthcare. Digestion rate, sweating rate, and energy requirements are considered to be ancient scientific radiation according to the universe. It works in perfect destiny to achieve Panchagama functionality and protected health. Next presentation related to the Narayana Churnam. I would like to invite Dr. Veguru Pravadika for the paper presentation on the topic Literary Review of Narayana Churnam.
Namaste, myself Dr. V. Pravalika, first year PG scholar, Department of RSBK. Today I am presenting literary review of Narayana Churna. Narayana Churna is an Ayurvedic formulation. explained by many acharyas, which can be used in various conditions like udara, gulma, vataroga, etc. by using the suitable adjuvants. Here, the Narayana Churna, which is a destroyer of the group of diseases. In its presence of this Churna, the diseases don't grow, as the demons doesn't grow before the Lord Vishnu. Due to its Dipana, Pachana, Rechana, Anulomana, etc. properties, it acts as a Virechana Dravya. It mainly acts in Majjama and Abhyantara Roga Marga, especially in Koshtagada Rogas. Materials and methods. Here I collected the references from Charaka Samhita, Ashtanga Hridayam, Sharangadhara, Bhava Prakasha, Chakradatta, Vangasena, Yoga Ratnakara, Rasa Ratnakara, Gada Nigraha. Observation and results. Here the main ingredients are the Saptala, Vishala, Trivrit, Danti, which has been taken in 4 parts, 2 parts and 3 parts. Remaining all dravyas taken in Samabhaga, that is 1 part. Anupana. Anupana, which acts as an adjuvant for internal administration of the medicaments. Based on the diseased condition, the quantity of Anupana for Churna is for Vata dosha 3 pala, Pittam 2 pala, Kapha 1 pala. For Rogas and Anupana, for Udara, Takra or Ushtradugdha has been explained. Gulma, Badara Ambu, Anaha, Sura, Vataroga, Prasanna, Vitsanga, Dadimanda, Arshas, Dadima Ambu, Parikartika, Vrikshamla, Ajina, Ushnambu, Visha, Grida. Discussion. The main ingredient found in Narayana Churna is Danti, Trivrit, Vishala, Shatala, that is Saptala, which has been taken in 3 parts, 2 parts and 4 parts. The common ingredients found is Yavani, Hapusha, Danyaka, Trifala, Pippali Moola, Ajagandha, Shati, Vacha, Shatapushpa, Jeeraga, Trikatu, Swarnakshiri, Chitraka, Dviksharam, that is Yavaksharam and Sajiksharam, Pushkara Moola, Panchalavana, 5 types of salt, Kushta, Vidanga. The drugs which has the following actions: Haritaki, which has the Anulomana property, Chitraka, Swarnakshiri, Bedana, Shunti, Jeeraga, Grahi property, Yavani, Shula Prashamanam, Pippali Moola, Chitraka, Ajamoda, Maricha, Chavya, which has Deepana property. Kushta, Vata Samshamana property, Shatapushpam, Pippali, Vacha, which has Kapha Samshamana property, Yavaksharam, Saindavam, Vacha, Kushta, Chitraka, Lekana property, Indravarni, Trivrit, Rechanam, Trivrit which acts as the Mrudu Virechak, Vacha, Pramadi, Vacha which has the Kapha Samshamanam, Lekhanam and Pramadi properties also. Maricha which has the both Chedana and Pramadi property. Danti which has Prabhavajanya Karma. It acts best as a Virechana Dravya because of its Katurasa, Katu Vipaka, Ushna Virya. Saptala, which is Shatala, which has Vikashi, Tikshna, Ruksha properties. It acts best in Hridroga and Gulma when taken in Akshamatra with Prasanna and Saindava, mainly caused due to the Kapha and the Vata doshas. Vishala Phalamaja, which acts as a Tivra Virechaka Dravya. Vishala Moola, Saumya Virechaka. Vangasena has explained Ajamoda instead of Ajagandha because both have similar properties like Katu, Tiktarasa, Tikshna Guna, Ushna Virya, Katu Vipaka, Kapha Vadahara properties. And he also explained Dadima Ambu and Vrikshamla Ambu in Arshas. Sharangadhara has mentioned that Ajagandha and Ajamoda, but not mentioned about the Upakunchika. He also explained that Grida as the Anupana for Visha and for Udara, Ushtra or Gotakra should be used as an Anupana. Vangasena, Bhava Prakasha, Yoga Ratnagara, Charaka, Ashtanga Hridayam, Chakradatta has explained this Churna in Bagandhara, Panduroga, Kasa, Shwasa, Galagraha, Hridroga, Grahani, Kushta, Mandanale, Jwara, Damstra, Mula, Gara Kritrima Visha. In Gadanigraha, this Churna explained in Bagandhara, Kasa, Shwasa, Pandu, Galagraha, Damstra, Mula, Gara, Kritrima Visha. The 4 types of Visha has been explained here. Narayana Churna, which has the Katurasa, Ushna Virya, Tikshna, Sukshma, Vyavayi, Vikashi Guna, it acts best as a Vireshana Dravya. Because of its Sukshma Vyavayi Guna, the Dravya spread through Damani by Agni, and by Tikshna Guna, it breaks and liquefies the Dosha Sangatam and reaches the Amashayam. As Prithvi and Jala Mahabhuta is predominant, the liquefied dosha expel in downward direction. Conclusion. Narayana Churna, which has been mentioned in Udara Chikitsa, can be used for many disease conditions like Gulma, Grahani, Arshas, Parikartika, Bagandhara, Kasa, Shwasa, etc. diseases. It acts as an Anulomana, Bedana, Grahi, Shula Prashamana, Deepana, Lekana, Rechana, Pramadi, Chedana properties. It acts as a Virechana Dravya, and it can also be used in Abhyantara and Madhyama Roga Markas. And market availability. Narayana Churna, which follows the Yogaratna Kara reference, is manufactured by Baidyanath Company. Thank you.
Thank you, Dr. Veguru Pravalika. Thank you for the wonderful presentation. We know that diabetic mellitus is not a single disease, but an underlying metabolic disorder that may develop in heritable ways. Next presentation is related to the diabetes mellitus. I would like to invite Dr. B.K. Mugilwadi for the paper presentation on the topic An Insight on Ayurvedic Management in Diabetes Mellitus.
Greetings everyone, myself Dr. B.K. Mugilwadi. I am going to present on an insight on Ayurvedic management in diabetes mellitus. The word diabetes took its origin from diapenin, a Greek word that refers to a siphon. Diabetes comprises of chronic hypoglycemia, which occurs due to relative insulin deficiency or resistance or due to the combination of both. Coming to the classification of diabetes mellitus, it is of 2 types, type 1 and type 2. Type 1 is called as insulin-dependent diabetes mellitus, which is further divided into type 1A and type 1B. And the other type is type 2 diabetes mellitus, which is also called as non-insulin dependent diabetes mellitus. So here the type 1 diabetes is caused due to destruction of pancreatic cells leading to insulin deficiency. It is characterized by lean build and circulating islet autoantibodies. Whereas the type 2 diabetes mellitus is caused due to beta cells dysfunction leading to insulin resistance slowly progressing to insulin deficiency. It is mainly characterized by central obesity. In Ayurveda, this can be correlated to prameha. It is of two types, Krisha Pramehi and Sthula Pramehi. So on coming to Krisha Pramehi, there is predominance of Vata. The person here is of lean build. This comes under Sahaja Janya Vyadhi and can be correlated to type 1 diabetes mellitus, where more than 90% of patients carry HLA-DR3 or HLA-DR4 or both. LADA diabetes, that is latent autoimmune diabetes of adulthood, leads to slow progression to insulin therapy. Whereas in Sthula Pramehi, there is predominance of Kapha and Pitta to an extent. Here the person is obese and it can be correlated to type 2 diabetes mellitus, where there is presence of central obesity. However, we cannot correlate all insulin-dependent diabetes as Krisha Pramehi and all non-insulin dependent diabetes as Sthula Pramehi. For example, double diabetes is a condition where type 1 diabetes is present with insulin resistance and obesity. Coming to Chikitsa according to Ayurveda, Sthula Pramehi Balavan Hekaha, Krishastataika Pradi Durbalascha, Sambrahmanam Tatra Krishasya Karyam, Samshodhanam, Dosha Baladikasya. So, some Brahmana or Santarpana therapy should be done in weak and emaciated person, whereas Apatarpana or Samshodhana therapy should be done in Sthula Pramehi, who is strong with more vitiated doshas. In Krisha Pramehi, Santarpana nourishing therapy can be done. Tatra Krisham Annapana Prati Sanskritabihi Kriyabhi Chikitsayet. So here, Krisha Pramehi should be treated with measures supported by proper food and drink. Snehapana works effectively in managing this disease. It might also act as a disease-modifying drug. Acharya Charaka has mentioned that decoction of Dharvi, Surahua, Triphala and Musta mixed with honey and haridra along with amliki rasa should be used in the preparation of medicated oil and ghee. Siddhani Tailani Gritani, Chaiva Deyani, Meheshu Anilatmakeshu, Meda Kafas Chaiva, Kashaya Yogai, Snehaishta Vayu Shamameti Tesham. Here, the medicated thaila and grita can be used to manage Vatika Prameha. The vitiated Meda and Kapha gets corrected and Vayu gets elevated by Sneha administration. Coming to the management of Sthula Pramehi, Apatarpana reducing therapy must be administered here. Shodhana procedures like Vamana, Virechana and Vasti along with Vyayama are found to be useful. Urdhva Tatha Adashta Malayopatite Meheshu Santarpana Meyeva Karyam. So, Urdhva and other Mala Shodhana should be done in obese and strong Prameha patients where the Mala should be clean from the body. Coming to Vamana therapy, where there is Kapha predominance, Urdhva Mala Shodhana or Vamana is indicated. So, in diabetes, presence of glycosuria and polyuria is there. Kidney. So, this can be understood that kidney plays an important role in the pathogenesis of the disease. Kidney or Vrakav is also the Shota Mula of Meda Dhatu. So, it is understood that here Meda Dhatu is also affected. In this condition, Vamana can be administered as it acts effectively in reducing Kapha and Medas and might help in minimizing insulin resistance. Next, coming to Virechana. Virechana can be administered in Pitta predominance conditions. So, one of the causes for hyperglycemia is increased glucose production. Liver is the principal organ for glucose hemostasis. It is also the stotomula of Rakta Dhatu. So, here Virechana is helpful in condition as it might lower the hepatic glucose production, leading to changes in the glycemic levels. Vasti. Astapana Vasti is indicated in vitiated Pitta. Decoction of drugs of Surasadikana added with the paste of Musta, Devahua and Nagara along with drugs of Negrodadi Gana can be used for Astapana Vasti. Vyayama. Vyayama is a type of Langana therapy which plays an important role in all types of Meha. Vyayam Jatamakhilham Bhajam Mehan Vyapohati. So, Shushita has also explained that in advanced stages of Prameha, one should practice physical exercise, wrestling, sports, etc. Now, coming to the role of Shamana therapy in diabetes mellitus, when the person is not strong and when the person is ineligible for Shodhana therapy, he should be given Shamana therapy irrespective of his build. This is because progressive insulin secretory failure is characteristic for both types of diabetes. Samshodham Narhatiya Pramehi Tasya Kriya Samshamani Prayojya. So, coming to the conclusion, Prameha Mukta Lakshanas are mentioned by Acharyas, which indicate that Prameha can be reversed. Pramehinam Yada Mutram Anavillam Apichilam Vishadam Katutiktam Cha Tad Arogyam Pratakshati. So, insulin-dependent diabetes mellitus might be converted into non-insulin-dependent diabetes mellitus by appropriate Santarpana and Apatarpana Chikitsa. Apart from medicines, lifestyle modifications plays a very important role for the management of diabetes mellitus, as diet alone contributes to 50% of the diabetes. So diabetic health is in our hand. Thank you.
Thank you, Dr. Mugulmati. Thank you for the well-explained presentation. Next is a paper presentation on the topic Effect of Shirisha Ashoka Suppository after Kshara Sutra ligation in the management of post-operative pain in fistula in ano. A case report. I would like to invite Dr. Lakshmipriya M for the paper presentation. Dr. Lakshmipriya, are you there?
Yes.
Good evening, doctor.
Good evening, everyone. Welcome to my presentation on the topic Effect of Shirisha Ashoka Suppository after Kshara Sutra ligation in the management of post-operative pain in fistula in ano, a case report. Moving on to the introduction. Fistula in ano is an epithelial lined tract connecting the anal canal to the perianal skin. Anal fistulas can have many causes, but the anorectal abscess is the most common cause. The greatest risk of surgical treatment involves disruption of external sphincter resulting in the fecal incontinence. So, there is a constant throbbing pain in the anal region that may worsen when sitting, moving, coughing, even passing stool. The most widely used parasurgical treatment for Bhagandara in Ayurveda is Kshara Sutra. This medicated seton chemically and physically cures out the tract and slough off the epithelial lining, thereby allowing the fistula tract to collapse and heal. The word Vedana is derived from Vid Dhadu, which means knowledge, perception, feeling, sensation, etc. Acharya Charaka has described a group of 10 drugs called Vedana Sthavana Gana for alleviating pain. So, we selected 2 drugs from this Vedana Sthavana Gana, that is Shirisha and Ashoka, and a suppository is made to decrease the pain in fistula in ano after Kshara Sutra ligation. The management of a case of fistula in ano with Kshara Sutra followed by insertion of Shirisha Ashoka suppository is presented here. A male patient of age 44 years working as a driver came to our OPD with complaint of swelling in the perianal region associated with pain since 3 months. On anorectal examination, on inspection, there was a swelling in 11 o'clock position 3 centimeter away from the anal verge. On palpation, there was induration. On probing, no external opening was obtained. The Kshara Sutra was ligated in situ after making a semi-lunar incision at the area of swelling, and the Shirisha Ashoka suppository was inserted. The pain was assessed after every 6 hours. The Shirisha Ashoka suppository was made up of cocoa butter and Bhavita Shirisha Ashoka churna in the Kashaya of Shirisha and Ashoka cells in the ratio of 2:1. The assessment of pain was taken with VAS scale. At the insertion of suppository, the pain score was 8 and it was reduced to 1 after 1 hour, and there was no pain at all after 2 hours. So moving on to the discussion, Kshara Sutra is a successful parasurgical measure in the treatment of fistula in ano. It promotes the drainage of discharge of pus from the tract, which helps to clear the infection and relieves the pain. The drugs Shirisha and Ashoka mentioned in the Vedana Stabana Gana has the Shirisha is having Ishat Ushnavirya and the Ashoka is having Shridavirya. When the drugs are assessed for local action, then virya of the drug plays important role as the drug doesn't comes into contact with Apni Samskarana. In Vedanastabana Gana, group of drugs, few are having Shridavirya, which helps to reduce the pain, which is caused by Pitta and Rakta, and a few drugs are having Ushnavirya, which helps in relieving pain caused by Vada. During the curettage, the mechanical and chemical curettage of fistula tract, there will be nociceptive pain due to the tissue damage. So, the Shirisha and Ashoka mentioned in Veda Stabana Gana possesses analgesic and anti-nociceptive properties. Therefore, it reduces the pain during the cutting of tract using Kshara Sutra. The Ashoka is having Daha Shamaka, Krimigna, Vranarobhaga, Sandhaniya, and Stambhaga properties. Shirisha possesses Shobhara and Vranahara properties. So, along with pain relief, they have anti-inflammatory property and helps to heal the surgical wound without causing any infection. So, together, the Kshara Sutra and Shirisha Ashoka suppository is a good combination for treating fistula in nano. The pressure effect of Kshara Sutra makes the cutting of tract faster, and the coating of Kshara Sutra causes burning sensation, even though it relieves pain in fistula in nano by eliminating the accumulated pus. The gate control theory of pain suggests that the non-painful input can reduce the pain by closing the gates to painful input. Here, the suppository exerts a pressure which is a non-painful input, and also the local analgesics interrupts the neural conduction of pain. So, this local analgesic suppository helps to raise the Ayurvedic surgeries to a very next level. These are the references. Thank you.
Thank you, Dr. Lakshmi Priya. Thank you for the wonderful presentation. We know that Vajada Churna is an important Ayurvedic formulation that helps in alleviating Vada dosha and managing conditions like Vada Gulma. Next presentation is related to this. I would like to invite Dr. M. Amir for the paper presentation on the topic Vajada Churna in the management of Vada Gulma with reference to diverticulitis.
Hello everyone, my topic is Vachadi Churnam in the management of Vataja Gulma with reference to diverticulitis. Vataja Gulma refers to type of abdominal lumps or mass caused by imbalance of Vata dosha. It is associated with digestive disturbances and bloating. Vachadi Churnam having therapeutic effects like Deepanam, Pachana, Anulomanam of Vata and relief symptoms of abdominal conditions. Diverticulitis is inflammation of diverticula due to outpouching of sigmoid colonic wall, often associated with digestive irregularities. Constipation leads to imbalance of Vata dosha. Vachadi Churnam may help as therapeutic intervention to restore balance in digestion and alleviate abdominal symptoms. Introduction. Gulma is a Pradeshika Nijashota in due to Vata Prakopa having features of Sofa and Shula is called Gulma. The Prakopa of Vayu occurs in Gulmasthana, which is Koshta. Koshta involves numerous sites like sigmoid colon, Amahashaya, Pakvahashaya, Shudrantram, Stulantram, Uttaraguda, Adoguda, Papavahanam, Hridaya, Nabi, and Basti. According to Shishruta, Gulma having features of Gupta Anila Mula, Udamula, Gulmatvat, Vishalatvat. Definition: Vataja Gulma, it is an intra-abdominal swelling that occurs due to vitiation of Vata dosha. The abdominal lump is typically hard and round. The aggravating factors include intake of Vata Ahara foods which are dry and hard to digest, and suppression of natural herbs, adopting regimens which are exceedingly cold. Diverticulitis is outpouching of diverticula with or without ulceration or colonic wall. Diet, lifestyle, medications plays a role in risk factors for diverticulitis. Acute diverticulitis may be present with fever, left lower quadrant pain, change in the bowel habits. When we come to pathogenesis of Vataja Gulma, Vata thus aggravated enters the alimentary canal Mahashrotas, which later become hard and round due to Ruksha Gunavritti and spreads to and get localized in Hridaya, Nabi, Vasti, Parshvasthana, produces colic pain. Persons feels like ants are crawling in limbs, fever, loss of power of digestion, intestinal gurgling, distension of abdomen. Pathogenesis of diverticulitis: increased intraluminal pressure in colon, making back pressure in diverticula, leading to distension of abdomen and increased inflammation. Intake of low fiber foods and cold items, constipation, obesity, increased old age. Vachadi churnam, the powder of vacha, haritaki, hingu, rock salt, yavani, amla vetasa, yavakshara, taken equal parts of powder, compound these materials into fine powder and taken. The dose is 1 to 2 grams. Anupana Ushna Jal. Therapeutic indications: within 7 days, gulma associated with colic pain, power of digestion will be relieved. Vachadi churnam having Deepana, Pachana, Anuloman actions, and each ingredient explained along with its therapeutic uses as explained in the table. Vacha, Acorus calamus. Properties include rasa, katu tikta, guna, lagu tikshna, virya, ushna, vipaka, katu. Pharmacological actions: Vata, Kafahara, Deepana, Shakrut, Mutra, Vishodana, Shula, Adamana or Vibanda. Haritaki, Terminalia chibula. Properties: rasa, all rasas except lavanam, guna, ruksha and lagu. Virya, Ushna, Vipaka, Madura. Deep. Pharmacological actions: Deepana, Tridosha Hara, Anulomana, effective in abdominal diseases, intestinal growth, Shota, Shula and Vibanda. Hingu, Ferula asafoetida. Properties: rasa, katu, guna, tikshna, lagu, snidda. Virya, ushna, vipaka, katu. Pharmacological actions and uses: Pachana, Vata Kafahara, Anulomana of Vata, effect on Shula, Udara, Gulma, subsets spasmic pains, abdominal distensions and upper abdominal distensions. Saindava Lavanam, sodium chloride, Rasa, Amlaha Madura, Guna, Tikshna, Ushna, Virya, Shita, Vipaka, Madura. Deepana, Pachana, Lagu, Snidda, Hima, Rucha, enhanced taste perception, Tridosha Hara. Amla Vetasa, Gracinia pedunculata. Properties are rasa, amla, guna, lagu, ruksha, virya, ushna, vipaka, amla. Pharmacological actions and uses: Vata Kafahara, Deepana, Gulma, Shula relieves intestinal growth, distensions, indigestion, expels out hard feces. Yavakshara, Hordeum vulgare. Rasa, Madura, Guna, Mrudu, Virya, Shita, Vipaka, Katu. Pharmacological actions and uses: Laghu, Snidha, Deepana, Gulma, Anaha, intestinal growth, distensions, cures colic, Vata and indigestion. Yavani, Trachyspumum amylin. Properties include rasa, katu tikta, guna, lagu, ruksha, tikshna, virya, ushna, vipaka, katu. Pharmacological actions and uses: Vata Kafahara, Pachana, Deepana, Shula, Udara, Gulma, Krimi, subsides intestinal growth and abdominal distension and indigestion. Vataja Gulma treatment: Langhana, stimulation of power of digestion, intake of unctuous hot foods, Vata Anulomana as well as Brahmana foods and drinks. Vachadi churnam with its ingredient having pharmacological actions like Deepana, Pachana and having therapeutic uses in Gulma due to vitiation of Vata associated with Pitta and Kapha, Vibanda, Adamana, etc. Diverticulitis treatment: increased fiber intake, hydration, pain control, oral or intravenous antibiotics like metronidazole and amoxicillin. Vachadi churnam having ingredients in which vacha having many chemical constituents such as beta-acerone, butyric acid, streptoterpine, oporon. These plants having anti-inflammatory, antispasmodic, antipyretic and antibacterial activity. Yavani contains phenolic substances have the capacity to prevent pro-inflammatory mediators from being produced or from acting, resulting in ability to reduce inflammation. Amla Vetasa having anti-inflammatory and antioxidant property. Hingu having antispasmodic property, relieves colic pain associated with Gulma. Saindavalavana, it is appetizer, digestant, having anxious property and cooling in potency. Discussion. The signs and symptoms of diverticulitis and Vataja gulma are similar within the gastrointestinal system. Diverticulitis occurs mainly due to increased intraluminal pressure, causing protrusion of colonic wall. The cause of increased intraluminal pressure is related to irregularities in bowel habits due to low fiber diet, constipation, obesity, age, having symptoms like inflammation, left quadrant pain, fever. Similarly, Vataja gulma having symptoms like Shula, Hasofa, Vibanda or Adamana. So, when we come to conclusion, the karma of Vachadi Churnam may be effective in improving digestion and regulate bowel movements and prevent intestinal growth and distension of abdomen. References.
Thank you, Dr. Amir. Thank you for the well-explained presentation. Next, I would like to invite Dr. Sriranjani for the paper presentation on the topic a case study on the clinical assessment of Brihatpurna Chandra Jasa in post-COVID-19 rheumatoid arthritis interstitial lung disease.
Today, I'm here to present a case study on the clinical assessment of Brihatpurna Chandaras in post-COVID-19 rheumatoid arthritis interstitial lung disease. SARS coronavirus is an incriminating pathogen in the etiology of autoimmune diseases like rheumatoid arthritis. The incidence of RA has increased post-COVID-19, with the greatest increase occurring before the first year post-COVID. RA is a chronic systemic autoimmune disease marked by inflammatory polyarthritis and extra-articular involvement. ILD is a common extra-articular disease that affects 5 to 16% of the patients with RA, and the respiratory symptoms typically appear within the first 5 years of RA manifestation. This is a case study of RA-ILD where opioid-based treatment was provided and a combined treatment of the Rasayana had a significant clinical effect in this case study. In this case, a 42-year-old female patient was positive with COVID-19 in the year 2020. And in December 2020, she presented with complaints of multiple joint pain in bilateral wrist joint, PIP joint, elbow, knee joint, and ankle joint, associated with swelling, morning stiffness, lasting more than 1 hour, restricted range of movements, and loss of appetite. In the year 2021, April, she presented with complaints of chronic dry cough and breathlessness, and patient finds an increase in the cough in supine position and finds relief in sitting posture. Patient has a moderate build. Patient has a mixed diet, poor appetite, bowels and maturation both are regular, and sleep is disturbed due to pain, and patient has almost 4 hours of sleep a day. Dashavida Pariksha, patient is Vata, Pittaja and Prakriti. Ahara Shakti is Avara and Vyayama Shakti is also Avara. During the respiratory examination, the shape of the chest was bilaterally symmetrical. The rate of respiration was 16 rates per minute. In palpation, the tactile vocal flemmitis was dull in the left apical region. And during auscultation, the fine crackles were heard. And the cough was for a duration of 6 months with hoarseness, and it was a dry cough along with dyspnea. On local examination, swelling, tenderness, local temperature, the range of movement was restricted, stiffness was more than 1 hour, all these were present. During investigation, the CRP was 4.5, ESR was 12 mm, and the RA factor was 24.85. From chest CT, the CT showed fibroathletic changes with ground glass opacity, and there was also interlobular septal thickening in both lung fields. And according to the ACR classification of RA score, it is 7 on 10. Based on the investigations and signs and symptoms, we have come to the diagnosis that the patient is a known case of Amavatam Vatamaka that is rheumatoid arthritis, interstitial lung disease. The therapeutic intervention started with Deepana Pachana with Panchakola Churnam 3 grams before food along with Ushna Jalam, and Sadhya Virechana with Tribrit Legium with 30 grams, and the patient had 6 Vegas. Rasana Chikitsa was done with Brihapuna Chandras 101 at the dose of 250 mg for a period of 30 days. This is the assessment of AMA. Before the treatment, it was 9 on 10. Post Virechana, it was 7 on 10. And after the Brihapuna Chandras, it is 3 on 10. On the subjective parameters, before the treatment, the patient's pain, tenderness, everything was 4, which was severe. And post Brihapuna Chandras, it has come to mild and moderate. According to the MMRC scale, before treatment it was 2 on 4, and post Brihapuna Chandras, it has come to 0 by 4. And according to the King Bill questionnaire scoring, before treatment it was 46 on 100, and later it has come to 84 on 100. On the 6-minute walk test, on day 1, the patient could walk for only 200 meters with severe dyspnea and fatigue. On day 34, the patient could walk for 500 meters with mild dyspnea. Coming to the probable mode of action of Deepana Pachana, the Panchakola Churnam has Katarasa, Laguroksha Sukshma Guna, Ushna Virya, Kata Vipaka, it is Agni Vardhanam, Ama Pachanam, and Sroto Shodhaka. In Sadhya Virechana, Tribrit Legium is both Kaphavata Haram, and Tribrit is Kaphavata Haram, and Shankara is Vata Pitta Haram. Hence, since Samakashwasam is characterized by Kapha dosha and Vata dosha, this has a probable mode of action in relieving the symptoms like dyspnea and cough. And Tribrit Legium was also Guna. Thus, it does Sthanika Pitta dosha chikitsa and also does Sroto Shodhanam and Amapachanam. Hence, it relieves the inflammation and pain. The proper mode of action of Brihapuna Chandras is it is Hanti Shwasa Kasa Shwasam Arvochakam and is also Amavataharam. It is mentioned Vaishya Ratnavali Rasayana Prakarana. Brihapuna Chandras, it's Tridoshaharam, it acts on Rasavaha and Astivaha Dhatus. It is Agni Vardhanam, Ama Pacharam, and is Rota Shodhakam in nature. Swarna has the potential. It is highly potential agent. That is, it is a bronchodilator in nature. Karpura decreases the allergic responses, and the cumin extract, that is a Jeerakam, will reduce the inflammation and improves the lung function. Similarly, this Brihapuna Chandras, the Swarna suppresses the kappa B binding activity and has the activation of inflammatory cytokines and tumor necrotizing factor alpha, interleukin 1 and interleukin 6. And similarly, the cuminaldehyde, which is a phytochemical that is found in Jeeraka, has both analgesic and anti-inflammatory action. As a result, the treatments progressed and the patient found relief in both stiffness, swelling in all the affected joint. After Virechana and Rasayanam, she experienced satisfactory elevation from dyspnea, pain, and cough. Due to the patient's low economical status, patient was unable to afford entire Panchakarma procedures. Despite these limitations and scope, this case was efficiently managed and the patient could not afford to take post-treatment investigation since a follow-up has been done over the phone and it has not been mentioned in this case report. These are my references. Thank you.
Thank you, Dr. Sriranjani. Thank you for the wonderful presentation. Next is a paper presentation. I would like to invite Dr. Neetha Anand Nakhade for the paper presentation.
Good morning. I'm Dr. Neetha Nakhate, second year PG scholar from Department of Rasashastra and Vaishya Kalpana, Sri Jayendra Saraswati Ayurveda College and Hospital, Chennai. The topic of my presentation is authentication of Ayurvedic pharmaceuticals through modern scientific methods. Ayurveda, a traditional medical system of India, with its fundamental principles and scientific approach, documents a diversity of healthcare practices incorporating plants, animals, metals, and minerals-based medicines. Ayurveda proclaims that there is no substance that is absolutely safe, and safety can be assured only by a proper use of a substance. Due to presence of heavy metals like lead, mercury, and arsenic, and some poisonous herbal drugs, some scholars are apprehensive about their safety. Ayurvedic texts elaborately discuss about methods of detoxification to nullify toxicity of heavy metals. Scientific validation of traditional preparation and evaluation of safety profile is important for global acceptance and for national and international regulatory guidelines. Aim of my study was to understand better safety evaluation system for safety, efficacy, and purity of Ayurvedic drugs. For these, published articles and papers were reviewed, and methods include toxicological standardization, safety studies, preclinical or experimental studies, and pharmacovigilance. The standardization of drug means confirmation of its identity and determination of its quality and purity throughout all the phases of its cycle, that is, shelf life, storage, distribution, and use by various parameters. Toxicological standardization include determination of pesticides, determination of heavy metals, determination of radioactive contaminations, and determination of aflatoxins. For determination of pesticides, gas chromatography and mass spectrometry is used. For determination of heavy metals, instrumentals like atomic absorption spectrometry and inductively coupled plasma mass spectrometry, and non-instrumentals include hashing or digestion of formulation and analysis, Namburi-phased spot test. For determination of radioactive contaminations, gamma ray spectrometry, alpha particle spectrometry, beta particle spectrometry is used. For determination of aflatoxins, thin layer chromatography, high performance liquid chromatography with mass spectrometry, gas chromatography, mass spectrometry, enzyme linked immunosorbent assay, lateral flow immunoassay, aptometer based lateral flow assay, cytometric bead array used. Second comes toxicity studies. It investigates the safety profile of the candidate compound. They also provide important information about absorption, distribution, metabolism, and excretion of the compound in the body. A candidate compound must be assessed in many different kinds of non-clinical toxicity studies before it can be administered to the first human volunteer. Even more toxicity studies are required thereafter before the medicine receives market authorization. It includes systemic toxicity studies, reproductive and developmental toxicity studies, spatial toxicity studies, and local toxicity tests. For systemic toxicity studies, single dose toxicity, that is acute toxicity, repeated dose toxicity, that is long-term toxicity. For reproductive and developmental toxicity studies include female fertility study, teratogenicity study, perinatal study. For special toxicity test includes genotoxicity test, carcinogenicity test, and local toxicity test includes dermal toxicity study, photoallergy or dermal phototoxicity study, allergenicity or hypersensitivity. Third, preclinical or experimental research. The preclinical toxicity testing on various biological systems reveals the species-specific, organ-specific, and dose-specific toxic effect of investigational products. The preclinical toxicity testing helps to calculate no observed adverse effect level, which is needed to initiate the clinical evaluation of investigational products. Pharmacovigilance in Ayurveda. So it is the science of detection, understanding, assessment, and prevention of adverse drug reactions and related untoward effect. Concept and regulations of pharmacovigilance in Ayurveda. The adverse drug reactions in Ayurveda could be due to the drug interactions, iatrogenic effect, drug overdose, administration of unwholesome drugs, administration in diverse pathological states, and therapeutic procedural complications. So, subjective variation, irrational use, adulteration, contamination, poor quality of drugs, and inadequate clinical research necessitates the practice of pharmacovigilance in Ayurveda. So, based on WHO guidelines regarding the safety of herbal drugs, the Department of Ayush, Ministry of Health and Family Welfare, Government of India took initiative and established National Pharmacovigilance Resource Centers for Ayurveda Siddha Unani in 2008-9 at IPGTRA, Jamnagar. So, some parameters that can improve a pharmacovigilance system, like pharmaceutical companies, drug usage, global electronic database, education, Indian regulatory system, web market monitoring, association of stakeholders, regulation of herbal medicines. So, efficacy, safety, and purity. Efficacy claims substantiation through modern biology and testimonials. Validation by experts to confirm Ayurvedic scriptures. Safety. Safety studies are undertaken to ensure that heavy metals, pesticides, harsh solvents, and microorganisms are within safety limits. And purity. Fingerprinting of ingredients and recipes to conform to standards. So from this, we can conclude that the inherent strength of Ayurvedic medicine is safety. So to capture its extent, better safety evaluation system is required. Raw material used in Ayurvedic formulations should always be tested for maximum limits of heavy metals specified by WHO, World Health Organization. Preventive measures should be taken throughout the stages of production, transportation, and storage to avoid cross-contamination of a radionuclide with herbal materials. Ayurveda's Anupana therapeutic method and Shodhana pharmaceutics principle probably contribute to the prevention of many undesired and unforeseen events. These are the references I have gone through. Thank you.
Thank you, Dr. Neeta Anandakade. Thank you for the presentation. We know that Vaskasa is primarily caused by an imbalance in the Vata dosha, which leads to dryness and irritation in the respiratory passages. The next presentation is related to this. Next, I would like to invite Dr. Sapkal Akshay Raghunath for the paper presentation on the topic Management of Viral Cough through Ayurvedic Medicine, a case study. Good evening, Doctor.
Good evening, sir. Good evening. Am I audible?
Yes, Doctor. Audible.
Good evening to one and all. Present here, myself, Dr. Akshay Sapkal, currently pursuing MD in Panchakarma from Yashwant Ayurvedic College, Kodoli, Kolhapur. Our topic of presentation is Management of Viral Cough, Vata scars through Ayurvedic Medicine, a case report. 11 years old A male patient from Bhokardan, Jalna, Maharashtra came to OPD on 12/1/2023 with chief complaints of dry cough, chest pain, hoarseness of voice for 1 month, and weakness from 15 days. History of present illness: the patient was alright before a month. After that, he had dry cough, chest pain, hoarseness of voice, weakness, and after treatment, gradually all symptoms were gone. Past history: no history of TB, DM, hypertension, hypothyroidism, any surgery or chronic illness. Family: no evidence of this type of disease in the history. Astavit Pariksha, Nadi, Pitta Pradhan was found, Mutra, Pita Varna, Mala slightly harsh stools, Jiva was Sam, Shabda was horse voice, Sparsha was Koshna, Druk, Dhusar Varni, Akruti was Krishidehi. Personal history: diet was vegetarian, appetite was poor, boil were mildly constipated, maturation 3 to 4 times a day, sleep was sound, allergic null, addiction null. On general examination, BP was found to be 130/80, pulse was 88 per minute, respiratory rate was 22 per minute, temperature was 98.2 Fahrenheit, weight was 25 kg. On systemic examination, inspection, bilateral symmetry, no deformities, no scars. On palpation, chest expansion was normal. On percussion, no resonance. On auscultation, normal breathing was found. At this level, investigations, no specific investigations were required. Later, the diagnosis was made viral cough, Vatajka. Differential diagnosis also includes asthma, Shwasa, chronic bronchitis as Chirakari cough, chronic cough as Kapha-Vatajkasam, COPD, Kapha-Jwar. Pathogenesis of Vatkaja is Adha Pratihato Vayu, that is Apan Vayu Avrut, Urdhva Srotas मध्ये आश्रित उदानसह उरकंठ शिरोप्रदेश व्याप्ती हनुमन्या नेत्रस्थानी आक्षेप तथा पृष्ठ उर पार्श्वस्थानी आक्षेप and शुष्क कफ युक्त कास forms. Then treatment given him for was 7 days. That is Dashmur Kadutram Kashan 10 ml BD with honey. BD means twice a day after food, and Dhanvantar Gulika 2 tablets each BD with warm water, and Karpuradi Tel was given for local application at chest region. Advice was given for Pathya that takes steam with warm water at once a night. Bath overhead once in a week. Avoid fruits and spicy food. Drug review: the Dashmur Trikadu Kashayam possesses Kapvatah Rukshaguna property, and further contents of Kashaya are classified follows. Dashmur has the following property: Trikatu Ushnavirya and is a Kapvata Shamak, Shulhara and Shofagna. Trikatu has a Katuras Ushnavirna, Amashe Samudva Ampachan, Kapvat Shaman properties. Vasa has Tikta Kashayaras, Sheet Virya, shows Kasagna, Kantya, Swarhar, Radya, Kshayhar, etc. Properties. Vasa is an effective also in expectorant and potent anti-cough medicine. It is also antispasmodic, antibacterial, and useful in the management of respiratory diseases like cough, bronchitis, asthma, fever, anemia, etc. The Dhanvantar Gulika given 2 tablets BD with warm water is given, and it has a Katuras, Ushnavirya, Kapavatar, Srota Shodhan, Vat Anuloman properties. The Karpuradi Trail, local application over chest, and has Ushnavirya and Vatashaman properties. Result: the cough associated symptoms were reduced after the treatment given for 7 days, and later at the follow-up given Pathya for next 7 days, which lead to complete upashar. The present case was diagnosed as viral cough, Vatashka. The patient come with the complaints of dry cough, chest pains, hoarseness of voice, and weakness. He was advised to take the medicine honey, Dashmur Kadutrayam Kashayan 10 ml with warm water twice a day, which works as a Vyadhi Pratyanic medicine. The Dhanvantar Gulika 2 tablets with warm water twice a day works as Apananulaman in this condition. And as local massage with Karpuradi Tel over chest region, which is mentioned as the Kaphasthana, it helps get absorbed and do Srota Shodhana and reduce the Vata in the following sthana and act towards reduction of pathogenesis in this disease. The medicine which were given with honey, which works as Kapha Chedana, shows significant improvement in signs and symptoms. Conclusion: the presented case was diagnosed as a viral cough. The patient was advised to take the medicine with proper Pathya Apathya. The Dashmutri Kutu Kasha had Kaphavata Rukshaguna property, which was beneficial, and the Dhanvantar Gulika has Koturash Ushnavirya, Kapavathar Sroto Shodhan, Vadanulaman properties. On the other hand, Karpuradi Tailam, local application over chest region, and it has Ushnavirya and Vatashaman properties. These all properties has given in hand to reduce the symptom. Thus, a drug used in the management of viral cough, that is Vatashkas, are beneficial. Significant improvement was noticed in both subjective and objective parameters after the treatment. References were taken from the following books. Thank you.
Thank you, Dr. Akshay Sapkal. Thank you for the well-explained presentation.
Thank you, sir.
We know that early identification of developmental delay at the primary care level is crucial for timely intervention. Next presentation is related to this. Developmental delay, identification and management at primary care level. I would like to invite Dr. Shilpa Sadashiv Bodage for the paper presentation.
Everyone, I am Dr. Shilpa Sadashiv Bodke, PG Scholar at ADMC Ashta Assembly in Kaumari Vruddha Department. Today, I am presenting a paper presentation of developmental delay identification and management at primary care level. So, first of all, we have to discuss what is a developmental delay. Developmental delay occurs when a child does not achieve developmental milestone in a comparison to peers of the same age range. The degree of developmental delay can be further classified as mild, moderate, and severe. A significant delay is defined as performance that is 2 or more standard deviation below the mean of age appropriate standard as the normal reference testing. After that, what causes developmental delay? So there are multiple causes or illnesses can contribute to developmental delay. The causes listed in box 1 are not executive but cover most of the common etiologies. These can be broadly divided into 4 categories: prenatal, perinatal, postnatal, and other causes. Studies evaluating the causes of GDD have indicated that in 1/3 of the cases, the cause can be established through history and examination alone, and in another 1/3 through clinical evaluation prompting investigations. The remaining cases can be identified through investigations alone. Now, how do I identify the developmental delay? In primary care setting, children with developmental delays are normally identified through 3 major channels: during routine developmental surveillance or screening, following parental consent, and after third patient, such as preschool teachers or nursery care professional raise concern. The child's health booklet is a useful resource that should be wisely utilized by parents and clinicians to monitor a child's development. An important step to improve the early identification of developmental delay is educating the parent to make use of health booklets development checklist. Other details regarding developmental surveillance and screenings have been discussed in our previous article. How relevant is this to my practice? Singapore does not have a national database to track the prevalence of developmental delay or disability. However, based on data from other developed countries, developmental delay are reported to occur in 10 to 15% GDP of children under the age of 5 years. Various factors determine the prognosis or eventual outcome of children with developmental delay. These include the causes of the delay in a treatable cause such as nutritional deficiencies, areas in which child is delayed, how significant the delay is, the age at which the child concerned, and intervention, and the extent of parental caregivers involvement. What can I do in my practice? So this is the most important part of this paper presentation, that what can I do in my practice for the developmental delayed patient. During each consultation, the primary care physician should encourage parents to share any concern they might have about their child's developmental behavior, conduct, and opportunistic evaluation, and ensure that the child has attended developmental screening at the prescribed touch points. Based on the consultation, a decision can be made to review again and refer further or discharge. For children presenting with mild developmental delay, in the absence of any red flags and no abnormality detected on clinical examination, parents can be advised about appropriate stimulation activities and a review conducted in 3 months' time, especially if earlier milestones were achieved. For example, an 18-month-old child may present with concern of expressive language delay as he has only started saying a few single words with meaning. In the absence of any other concerns, example, the child has good eye contact and joint attention with no behavioral concern, advice on language stimulation activities should be given. In children presenting with significant developmental delay or with the history of regression in development and those a risk for developmental delay, a prompt referral should be made to a developmental pediatrician. So the next part is take-home massages. Developmental delay are common and can involve either a single domain or multiple domains of the child functioning. Early identification of developmental delays and appropriate management can positively alter the child's developmental trajectory. Primary care physicians play a pivotal role in early identification of developmental delays through developmental screening and surveillance. For children presenting with mild developmental delays and in the absence of any red flags, appropriate stimulation activities can be suggested with close monitoring of the child. There should be a low threshold for specialist referral for children at high risk of developmental problems, such as those who are in care, have an underlying chronic medical condition, or have a primary caregivers with mental health problems. So guys, this is the paper presentation about developmental delay, identification and management at primary care level. Hope you could understand this, and thank you all.
Thank you, Dr. Shilpa. Thank you for the wonderful presentation. Next, I would like to invite Dr. Sharavanan B for the paper presentation.
Myself, Dr. Savan. Today, I'm going to present the topic on Sudha Kadravya in Rasasastra, application and benefits. Rasasastra is an important branch of Ayurveda. It deals with the use of metals and minerals. Simply, we can say that inorganic pharmaceutical science. This is an integral part of the healthcare system. It involves the various alchemical process to enhance the therapeutic properties. Sudha Kadravya is one among the important group in Rasa Sastram. All the calcium compounds are classified under the Sudha Kadravya. References are available in Sangeetha, Sangraka, and Sishikaranja, also known as the Sukla Rasamritam, also explained that Sudha Kadravya. All the calcium compounds are classified under this Sudha Vinyanam. The Rasamrita recent textbooks is mentioned that almost all the calcium compounds substance in the group is play the important role in the therapeutical purpose. So it's used for the Amlapittam, Parinamazulam, Swasa, Kasa, Hridroga. Also used for the calcium supplementation for the bone health and muscle function. Importance of calcium in human physiology. It's also play the important role in the bone structure, muscle movement, regulation of the gastrointestinal secretions, and cardiac functions. So that's having the several synonyms. Sudha means ambrosia, nectar, water, milk, and honey. In Sudha Gadravya's Sudha lime, Kadiga chalk, Godaldi gypsum, Sankra conch, Sambuga snail cell, Mukta Shakti Easter cell, Kabarta, Kauri, Kurma crystal, tortoise cell, Samtrapana, patternfish bone, Pravana coral, Mukta core, Mrigasringa, deer horn, and Puranda egg cells adjust the bones of goat. These are the substances mainly classified under this Sudha work. Among these, all of the calcium carbonate in nature, except that Milkasunda. Milkasunda is the calcium phosphate in nature. Utility of this Sudha Loka Veda point of view and Deka Veda point of view. Loka Veda point of view means it's used for the alchemical process. Deka Veda point of view it's used for the therapeutical conditions. Loka Veda point of view, the Sudha is mainly used for the Parada Sodana, Parada Banta, Vajra Marana, Mrudakarana, Melana, Harikala Sodana, Udi Loka Sodana, and Dharana, Sangatravaka, especially used for the liquefaction of the metal gold. Deka Veda point of view, it's used for the external purpose as well as the internal purpose. External purpose, Churnadaka. How to prepare the Churnadaka means 2 Rati Sudha Churna and 5 tola water is to be given for the Triyama period. Then the filtrate solution used as a Churnadaka. It can be placed for the Prakshalana as well as the labor used for cleansing and healing external wounds and conditions. Sudha along with Samutrapena, Saindava and Pitpali used as Anjana in treatment conditions like Shuklagada Rogas. Netravati, Sudha along with Samutrapena, Haritaki and Tutta used for conditions like Potaki. Karnasrava, Samutrapena used to treat the air discharge and related conditions. Prana, wounds, Samutrapena and Mudasanga used for labor for wounds is healing and treating the external wounds and ulcer. Internal application of the Sudha Vakadravya, Surnadaka used for Bhakti and Kavala, and Kapapita Jara, Samutrapena along with Hingula used for Kapapita Jara, Sukragadara, Samutrapena, Kokilaksha, Katfala, Ushira, Yiksu used for the Sukragada Rogas, especially enhancing the reproductive health and treating later conditions. Godandi is having the properties like Sita, Pitta Samaka, so it's used for the conditions like Raktasrava, hyperacidity, peptic ulcer treatment, and relieve the burning sensations, Rakta Adhisara, calcium deficiency conditions like precursor and osteoporosis, also useful for that Sweda Pradara and Rakta Pradara. Mrigasringa useful for the chest pain, Ursula, allow if you give along with the ghee or butter, This provides the soothing relief and helping in managing the chest pain. Because Swasam, if you have Sringa Basma along with Apabaka Bija, equally used for the conditions like Hika and Swasa. It alleviates the symptoms of hiccup and breathing difficulties. Kurmapusta is especially used for the conditions related to the back and spine, used for treating the spinal and back disorders. Prasuda, postpartum care, supports and recovery and health of the new mothers. Shaya helps in managing conditions of severe weight loss and muscle wasting. Balababa, pediatric disease, used in treating various childhood disease and promoting the children's health. Apasmara supports the management of the treatment of epilepsy. Ajayasti helps the recurs, helps in treating recurs due to the calcium content. Nursing mothers supports the health and recovery of nursing mothers, provides essential nutrition, hair fall, used to manage and reduce the hair fall, promoting healthier hair growth. Prenatal care supports the health of the pregnant woman, ensuring the proper calcium intake and overall well-being. Kukudanda is used for the conditions like liquor, used in the treatment of liquors due to rich calcium content. Lactating woman provides the essential nutrition to support the health of the nursing mothers. Asthma helps in the management and treatment of the asthma symptoms. Pratharam effective in treatment conditions like menorrhagia and menstrual bleeding. Menorrhagia, Adhisara used to manage and treat the symptoms of diarrhea. Specific formulation, Prabhala Panjamrita, especially used for the conditions like Amlapittam. Mukta Panjamrita, this formulation used for the Jora and Rajakshma. Gadika Churna, this formulation used for the Pravagita, Pitta Adhisara and Grahani. Specific formulation Mukta Pasti, highly beneficial Ummada, Artadhisara, Vishar, Daha. Also the Balagiri Vantanam, enhance strength and vigor, this formulation. Specific formulation Pravala Pasti, Hridyam, Succession, Pitta Samaga, Atyanda Saumyam, and Ayushya. Astiviruddha, Pravala Pasti and Sringabasma used in treating conditions like osteoporosis and bone brittleness. Preparation of the Sudhavati Devya, Churna, Gadigadi Churna, Dasana Samskara Churna, Samudra Fena Churna, Mukdarasa, Deva, Sangadravaha, Pisti, Pravala Mukta, Vadi, Shanka, Peya, Gadigadi Peya, Parpadi, Sudha Parpadi, Potali, Singakarpa Potali, Loganadharasa, Basma, Mukta Basma, Corona Basma, Kavarta Basma, etc. Udaka, Chunodaka. The purification of the calcium compounds such as mainly used for Sodana purpose, Amlavarka, Kanchi, and Kumaris are mainly used. We coming to the discussion point of view. Overall, through that, Godindi is used for the beauty conditions, Sringabasma is used for the cardiovascular system, Pravalabasma is used for the respiratory system, Shuktika is used for the GIT, Kachaba and Sambuka is mainly used for the dialectical conditions, Sandabasma is used for the GIT, Varadiga is used for the CNS, Ukuranda is used for the uterus and ovarian cyst conditions. Coming to the conclusions, Sudharka plays an important role in Ayurvedic therapeutic as well as the modern medical scenario. Sudharka derivatives mainly contain the calcium compounds, chiefly calcium carbonate, calcium oxide, and calcium silicate. Calcium being the main ingredients plays an important role in many physiological activities, not only related to the bone, but includes the blood clotting, nerve conduction, muscle contraction, regulation of the enzymes activity, and cell membrane function. So the use of this Sudharka gas in all diseases related to the calcium and gastrointestinal disorders. So with its proper use, success can be achieved on many diseases in future. Thank you.
Thank you, Dr. Sharvana. Thank you for the wonderful presentation. Next is a paper presentation on the topic effect of Sidavida, Madhutailika, Bhakti, Vadari Varasa, and Shidajadu Rasayana in Madhumeha Upadrava, diabetic peripheral neuropathy. I would like to invite Dr. Pallavi DM for the presentation.
Hello. Hello. Namaste, sir.
Good evening, doctor.
Hello. Hello.
You are audible, doctor.
Sir, already I sent that video clip to sir,
Okay,
sir.
okay, doctor. Okay, doctor. Okay, doctor.
Namaste everyone. Myself Dr. Pallavi, I am final year Kajol PG Scholar, Tarnam Government Ayurveda Medical College, Ballari. Under the guidance of Dr. Madhav Diggavi, Professor in HOD Department of Kajikitsa, TGMC, Ballari. Topic is effect of Siravada, Madhukalika Vasti, Vaptharilasa and Shilajatu Rasana in Madhumeha Upadrava, that is diabetic peripheral neuropathy. So, introduction. Diabetic peripheral neuropathy is a common complication of diabetes, characterized by damage to the peripheral nerves. Damage to peripheral nerve means there will be destructed or degeneration of the myelin sheath, which will be covering on that nerves. It will destruct or degenerate due to the chronic hyperglycemia and metabolic disturbances associated with the diabetes. Primarily affects the nerves in extremities, particularly feet and hands, in glow-stalk pattern. Symptoms of pain, tingling sensation, weakness, and some patients will be having loss of sensation. These all will lead to risk of foot ulcers, infections, and amputations. In Ayurveda, there is no direct reference for the diabetic peripheral neuropathy. We can take it as a Madhumeha Upadrava, as it is already mentioned in the Samhitas. It's a Rogantara Kalaja Roga, which has symptoms related to dosha or complications, and is unique type of neurodegenerative condition where it involves the avarana Satokshesha Samprapti. This is about the case study. One 43-year male patient came with the complaints of Chimchimayana, the burning in the sense Suchivattoda and Dorgalla. Since 2 years, with the history of diabetic mellitus since 8 years. First pick is about nerve conduction study, second is about hyperdication. So nerve conduction study shows bilateral assurance and exonopathy. In that, two values will be there, latency and amplitude. Latency means it will be measured in meter per second. It is how much time one nerve take to conduct the impulses. So in demyelination, there will be myelin sheath degeneration or destructions or damage. That's why the nerve will not conduct the impulses regularly within the time. So it was 3.89, 4.96, 4.91, 5.80 in respective nerves. Those nerves are left peroneal, left tibial, right peroneal, right tibial. Exonopathy means the functional exon, number of functional exons in that particular nerve. So it will be that exons will be damaged or destructed in that patients. So it was 3.3, 8.91, 4.98, 5.99 respective to that nerves. Interventions conducted were Siraveda Madhukalika Yoga Basti, Vatarasa and Shilajatu Rasayana. Siraveda first and 16th day, we removed 80 ml, that is Avaramatra. Madhukalika Yoga Basti for 2 sittings with 16 days gap. Vatarasa and Shilajatu Rasayana for 47 days from starting from first day. So Patya advised were Amalaki Haridra, Yavasogdin, Trifala, Kvata, Karavelaka, Shidru, Patra, and Sindavaravana. Apatya advised were Gadisevana, Divasapna, Mahida, bread, oil, and fried items, Madhyapana, smoking, and exercise. Subjective parameters which were improved. Before treatment, Sukti was grade 3. After treatment, it improved to grade 1. Graha before it was grade 3. After treatment, it was totally absent. Kunchmayana before it was grade 2. After treatment, it was absent. Kuchivatoda before it was grade 2. After treatment, it was totally absent. Dorbalan before it was grade 1. After treatment, grade 0. It's about the objective parameters which were improved. FPS 192, 138 came. PPBS before it was 310 to it came to 175. Before nerve conduction study, it was total sensory exonopathy. After treatment, totally it was reversed. And nerve conduction study was within normal limit. So latency means time taken for the nerve to conduct the impulses. So it should be reduced after treatment because if it reduces, then it will show that there is a demyelination regeneration and there is an improvement in nerve. So it reduced from 3.89 to 2.71, 4.96 to 3.96, 4.91 to 3.44, 5.80 to 5.3 when according to respective nerves. amplitude should be increased after the treatment because there should be increased number of the functional exons. So it increased from 3.3 to 7.3, 4.98 to 5.9, 5.99 to 7.5. So this is about nerve report after nerve conduction study report after the treatment. It came to within normal limits, which was conducted under the neurologist. Discussion: diabetic neuropathy is a type of nerve damage that occurs as a complication of diabetes. So, Lakshanas of diabetic neuropathy and Madhumaya Upadrava are nearly identical. So, the main culprit of this disease is Vata dosha, whether it is increased by Avarana or Dhatu Kshayaja. The Vata either by Avarana Jana and Dhatu Kshayaja, along with Kapha and Pitta, are responsible for all these type of Lakshanas. And in Ashtanga specifically, he mentioned that Daha is by Pittaja Madhumaya Upadrava, Shosha is by Vataja Madhumaya Upadrava, Sukti as Kapha Jopadrava, Kapha pathology involved in this disease are Pitta Kaphavrata Vata, Rattavrata, Pranavrata, Jnanavrata, Mamsavrata, Asti Majjavrata, and Udanavrata Vata. And Gata Vatas are Rattavrata, Rattavgata, Sarvangavata, Panchavrata Vata. So in nerve conduction study, we can see demyelination pathology or encephalopathy or both pathology we can see in some patients. By amplitude latency, we can differentiate this encephalopathy and demyelination. If the latency is affected more than amplitude, then it will be demyelination conditions. If amplitude is affected more than latency, then it will consider as encephalopathy or demyelination. And probable mode of actions were Siraveda access. It restores normal Vatagati, improves the blood circulation for microvascular healing, and it is indicated directly by the high Vatarakta because in this case, the pathology, if we see in deeply, then it will resemble the pathology of the Vatarakta. So we have to treat the patient as Vatavedi, Pramehagna or Vadumehagna along with Vatarakta. Siraveda acts as psychoneuroendocrinial regulation. When we prick the patient with the needle in Siraveda, it will stimulate the HPA axis, which will release the cortisol, which will decrease the stress in these patients and acts the overall and the neural desensitization. And this is about the Madhutainika Basti. In Kalpantana of the Ashtanga Hridaya, he mentioned in Basti Chikitsa, Madhutainika Basti as a Rasayana and Pramehagni. So it will act both as Avaranabna along with it will act as a Brahmana. So it mainly acts as a Kaphavatahara. So Saitavaravana as a Kapachitana Nipani, it will act Madhu due to Tridoshahara Lekana. And Yonata Mulakwata as a Shoshahara, Shonita Vikara, and Chulabha we can consider it. And Shatapushpa due to Diktarasa Lagutikshna Guna, it will act as Vatakafana and Deepana Shulagna. So this is about the Rasayana Shilajita Rasayana as it is mentioned in Rasayoga Saga, right? It is the Madhume Shrestha Rasayana for the Madhumeha. That's why we selected this Shilajatu. Along with that, it is having the Tikta Katu Kashaya Rasa Katu Vipaka, Ushta Nira Shoshan and Chedra. Both acts as Madhumeha along with neuropathy. Vatarasa as Saraswati, it is having Vatarakta Prameha Shura and Vatavedi. It will act as Nadi Durbal, it will act on Nadi Durbalata and Vata Vyadi. The yogas which were selected in these diseases are which will be having the Falashruti as Vataraktagna, Pramehagna, Vata Vyadi. So it will act whole act on both Madhumeha and Madhumeha Upadrava. So conclusion is demyelination externality can be reversed by an effective Ayurveda protocol along with controlled blood sugar by Samprapti Vigatana of Madhumeha Upadrava. And in this study, the combined effect of Siravada, Vidadelika Basti, Vataris and Shilajatu Rasana improved case subjectively along with the objective parameters. Thank you.
Thank you, Dr. Pallavi. Thank you for the wonderful presentation.
Thank you, sir.
Next, I would like to invite Dr. Hina Khan for the paper presentation.
To myself, Dr. Hina Khan, second year Shrilyakantra student from SMBT College of Ayurveda. The topic of my paper presentation is the role of trapose beach, that is cucumber seeds, in symptomatic management of Pitta Mutra Krucha with special reference to acute cystitis. Ayurveda classical texts like Brihatraya and Laghutraya have widely described Mutra Krucha. The term Mutra Krucha comes under the disorders of Mutravaha Skotas. Description of this disease is mentioned in almost all classical texts, which reflects its prevalence in the ancient period. It is a disease involving the Basti Marma. As Basti is one among the three Marma, it has great therapeutic importance. As mentioned in Madhav Nidan, Mutrasya Kruchena Bhavana, Dukkena Pravritti. Difficulty in voiding of urine is known as Mutra Krucha. The Mutravaha Srotas maintains hemostasis of fluids in the body. It also detoxifies the body by eliminating certain waste products through mutra, which is found in Vashegat Stan and stored in the basti. Mutra is an outcome product of digestion of food and metabolism in the body. In Pitta's Mutra Krucha, the vitiated Pitta, along with the Vata, on reaching basti, afflicts the Mutravaha Srotas, due to which the patient feels difficulty in micturition, along with symptoms like Pita Mutra, Sadaha Mutra Pravritti, Savija Mutra Pravritti, and more Mutra Pravritti. Various types of Mutra Krucha are described by Acharyas, out of which the Lakshanas of Pitta's Mutra Krucha, which includes strong persistent urge to urinate, burning sensation while urinating, passing frequently small amounts of urine, blood in urine, etc., have close resemblance with the signs and symptoms of cystitis. A healthy urinary tract is generally resistant to infections. However, for anatomical reasons, female lower urinary tract is more susceptible. Predisposing factors include female sex, poor hygiene conditions, environment, poverty, and illiteracy. Also contribute to the increasing percentage of urinary tract infections. Bacteria are by far the most common invading organism. Cystitis is an inflammation of the urinary bladder. It can be painful and annoying. It can lead to serious health problems of infection if the infection spreads to the kidney. Nowadays, due to the modern lifestyle, busy schedule, people more often have to depend on food which lack hygiene, nutrients, or harmful to the health. Normal urge to micturate and defecate are avoided due to fast and busy lifestyle. Suppression of these urges leads to beta growth. Although acute cystitis is a benign condition, recurrent episodes are associated with a reduction in quality of life, a negative impact on everyday activity and working ability, disturbances in sexual life, etc., which are troublesome for patients. Acute cystitis is a commonly common condition in day-to-day life with an increasing incidence and prevalence rate. Especially in remote and rural areas, due to lack of facilities, sanitization, education, and awareness has led to higher chances of unhygienic conditions, leading to cystitis. Despite large number of available analgesics and anti-inflammatory drugs, there is still need of new analgesics and anti-inflammatory drugs with minimum side effects. Medicinal plants are among one of the best options to discover new medicinal agents, as these are rich in phytochemicals. Tripus beach, that is cucumber seeds, can prove to be effective in improving the signs and symptoms of Pitta culture by the virtue of its properties, and chemical constituents like madhu, sheet, mutral, etc. can act as Pitta shamak and help in easy voiding of urine. Its anti-inflammatory, antioxidant, and analgesic properties will be helpful in reducing the inflammatory changes and pain. Trapose beige is easily available and cost effective as well as palatable drug, and thus I have selected this drug to find out its role in management of signs and symptoms of Pitta Mudra. The Lakshanas of Pitta Mudra as described by Charak in Chikita Slan, chapter number 26. Pitam, Saraktam, Sarujam, Sadaham, Krucham, Murmur, Adi Pittat. If the dysuria is due to Pitta dosh, urine may be yellowish, it speaks of blood. The passage of the urine is with difficulty, and the pain is burning in nature. About the drug, as described in Kaide Nikantu, Raposa is a creeper found in the wild and also abundantly cultivated all over India for its use as a vegetable. The reference of Trapus species given in Mahaprakash Nikantu is as follows: Tad Bijam Mutrivam Shitam Ruksham Pitta Astra Krutshajit. The Latin name is Kitinus stylus. The rasa is Madhur Tikta. Virya Shita Vipak Madhu. Karma Vata Pittahara Mudra Malya Mutra Basti Vishodha. Mode of action of Trapus speech can be described as follows.
Thank you, Dr. Hina. Next is also a paper presentation. I would like to invite Dr. Pooja Vishwas Patil for the paper presentation on the topic A Clinical Comparative Study to Evaluate Role of Ashut Kashaya and Vadarakthahara Kashaya in Vadarakta Gouty Arthritis.
Good evening, everyone. This is Dr. Pooja Patil, final year PG Scholar, Department of Kaya Chikitsa. I am doing my study, PG study in Ashwini Ayurvedic Medical College, Davangere. Today, I am representing a clinical comparative study to evaluate the role of Ashwagandha and Vatarakta Kashaya in Vatarakta with reference of gouty arthritis. Here is the table of content. Brief resume of intended work. Need for study. Vatarakta is one of the main diseases of Vata. It is Vata Pradhan Idosha's valley where Rakta is the main dosha. It is an illness where both Vata and Rakta are afflicted by distinct etiological factors. Vatarakta can be very well correlated with gouty arthritis in modern science. Gouty arthritis is a disorder of urine metabolism. In this disease, monosodium urate monohydrate crystals are deposited around the synovial joints. The line of treatment in modern science is NSAIDs, glucocorticosteroids, which fail to treat the disease. But in Ayurveda, there is a discussion around the line of treatment being Shodhana, Shamana, and Baihya Chikitsa. which can be effectively treat the disease. Patient mostly prefer Shaman Chikitsa. So in present study, Ashwata Kashaya and Vatraktahar Kashaya are selected. As Ashwat Kashaya is said to alleviate Tridosha and Daruna Vatrakta. Vatraktahar Kashaya is Vatrakta Shamaka due to its antioxidant anti-aging property. Is the review of literature. The Vatrakta is mentioned in so many Ayurvedic classics such as Charak Samhita, Vaishya Ratnavali, Shushu Samhita, Ashtang Sangraha, Ashtang Hriday, and so on. Drug review. Ashwata Kashaya is mentioned in Charak Samhita, Chikitsa Sthana. Vatraktahar Kashaya is mentioned in Sahasra Yoga by Chaukambar Sanskriti. Previous work done. Objective of the study. Hypothesis. Null hypothesis and alternate hypothesis. Materials and methods of the study. Sources of data. Literary sources. The details of literature of Adhyakta were collected from the Ayurvedic classics and from modern medical books, journals, and from internet. Sample sources: patients of either sex diagnosed to be suffering from Vajrakta fulfilling inclusion criteria. And drug sources: drug will be properly identified and collected from the reliable sources. There is the preparation of medicine. Composition of Ashwat Kashaya is Ashwata, and composition of Vatraktahar Kashaya is Shatavari and Guruji. The dry herbs are pounded into the form of coarse powder, which is given to the patient. Patients are advised to take 12 grams of coarse powder, add 192 ml of water, start boiling this mixture in wide mouth container over the boiling fire. Keep stirring and reduce to the 24 ml. Method of collection of data. Study design. It is a clinical comparative study. Sampling technique. 40 subjects who fulfill the inclusion criteria. Then sample size. Group A and Group B, each consisting of 20 patients. Diagnostic criteria will be based on classical sign and symptoms of Vajrakta. Inclusion criteria. Patients are having sign and symptoms of Vajrakta mentioned in Ayurvedic classical textbooks like Sandhi Shula, Sandhi Graha, Sandhi Shotho, Vaivana, Sparsham, Svatva, Daha, etc. belonging to a group of 80 to 60. Uncomplicated cases of cardiac patients whose uric acid level is more than 3 to 6 mg per dl. Exclusion criteria. Patients were excluded who fulfill the exclusion criteria. Then interventions. Group A, 20 patients. Group B, 20 patients. Posology. In Group A, Ashwata Kashaya 24 ml twice a day before and after. Before food, according to Roga Rogi Burla with Madhu and as an Anupana. In Group B, Vatraktahar Kashaya 24 ml twice a day before food, according to Roga Rogi Burla with Madhu as an Anupana. Duration of the study 45 days, followed every 15th day. Assessment criteria. Assessment of clinical study will be done on subjective and objective parameters. Subjective parameters are Daha, Sandhi Shula, Sandhi Graha, Sandhi Tamravaranata, Sandhi Svarsha Satva, Sandhi Kriyakshatada, Sandhi Shula. Gradings of the subjective parameter. Gradings are gradings of Daha, grade 0, 1, 2, 3. Gradings of Sandhi Shula, Sandhi Graha, gradings of Tamravaranata, Sandhi Shavata, gradings of Sandhi Svarsha Sadvata, gradings of Sandhi Kriyakshata, gradings of Sandhi Shava. Objective parameter, serum uric acid level. Investigations, routine investigation, blood, CBC, ESR, RBS, then are affected during routine investigation, specific investigation, serum uric acid level, master charts on subjective parameters. For group A, Ashwat Kashai, in master chart consists of group 6, age, marital status, occupation, religion, diet, prakriti, agni of patients. Then according to symptoms of the patient, Sandhi Shula, Graha, Sandhi Shotha, Vaivaranya, Sandhi Sparsha, Satvata, then Daha.
Thank you, Dr. Pooja. Thank you for the presentation. Ayurveda offers a unique and traditional approach to child healthcare, focusing on prevention, balance, and natural healing. Next presentation is Strength of Ayurveda specific to child healthcare. I would like to invite Dr. Saurabh Ajit Changan for the paper presentation.
Hello everyone, I am Dr. Saurabh. My topic is Strength of Ayurveda, specific to child health care. Introduction of Ayurveda. Parivacha. Ayurveda is Ayurveda. Ita itam skabda kumara swasthi ansa bharat swasthi Ayurveda samachita. Ayurveda is Prajana. Swasthasya swasthya rakshana aturasya vitara prasadakcha. The entire Ayurveda is divided into 8 branches. First, Kaya Bala Udvargasanya Dosta Jaravasha is from God is Chikitsa, Yeshu Sensita. Second place in Ashtamudaya used to Kaumani. Strength of Ayurveda to child health care. In Vedas, two many references are found, like Rig Veda and Atharva Veda. First, nourishment of fertilized zygote, intestinal worm infestation in children, Dakshavrutharma Pedha Janutras. In Ayurveda, Kashyap Samhita highlights the depth and speciality to this branch. Following books are special classics of Ayurveda. Vruddha Kashyapa Samhita, Parvataka Tantra, Padhaka Tantra, Hiranyakshi Tantra, Ravankrita Kumara Tantra, Arogya Raksha Kalpatrum. Importance of Kumara Bhakti. Kumara Bhakti Ashtanam Tantranam Adamuchyate Ayurvadasya Mahuto. Devanaviva Havyashaha Anenahi Supadha Pitare Chiksabha. Kashyap Kumara Sthanak. Kumara Bhakti is attributed top priority among Ashtanga as that of fire above all methods, as it is crucial stage of foundation for future life. Only with other specialties like Kajol serve effort to manage the cases. Definition of Kumara. Kumara It is to be detailed science on a very state of child, Dhatri, initiation of the breast milk and its treatment. This will lead to intake of initiated breast milk and growth of together to treatment. Shishu Paricharya. There are three types of Paricharya. Jata Matra Shishu Paricharya, Sanjo Jata Shishu Paricharya, Navajata Shishu Paricharya. First, Jata Matra Shishu Paricharya. Paricharya Prana Pratyagavana. Cleaning, there are steps for Prana Pratyagavana. First, cleaning of airway. Taru Osta Kanda Jiha Parimarjanam with cotton swab. Second, stimulus to the baby. Shito, Shito the Keda, Ushto the Keda, Va, Mukha Parishekam with Krishna Kapilaka Purva and Ashkudu Shankashtam Karnamuya. Purva Parimarjana. Vernix Cassioda reviewed with Saindava Parigrita. Mukha Vishadana. Removal of fetal membrane and mucus plug from air passes vessel or oral cavity of the mouth. Garbhota woman. Ghee mixed with Saindava with administration to baby induce vomiting. Aapni Navi children. According to Charaka, Karpa Sutra at 8 angular distance from navel side anchored the Ardhadhara Shastra and loosely tie it around neck. Smears with Kushtha Taila for easy healing and prevent secondary infection. According to Ashtanga Hridaya, there are 4 angula and Ashtanga Hridaya 2 knots should be made and cut in between. Sadhya Vyakta Shishu Paricharya. Taila Parishekam Snanam Pichu Dharnam. Pichu for Pasuti Klesha. Simplest but effective due to longer duration. Udaka Kumbha Sthapanam. Water pot processed with mantras should be kept along the side of head. Prashanam for the first day. Attainment of Medha, Ayu and Balam. It also aims at speeding passage of lymphadenum. Establish patency of GIT. So Vajada Shuparcharya. Prashanam before the establishment of lactation, first day he honey gold made to lick baby. Second and third day he made with Lakshamana. After establishment of lactation, Suvarna Paramarjanam, Devaditra Prashanam, Statya Panam, right breast should be advised to be sucked. Raksha Karma, Rakshamana Karma, the concept of Graha and Bhuta are closely linked with Hindu mythology. In modern view, this can be compared with impact of wind due to unknown causes, infection, or psychiatric disorder. The Rakshamana, which once again revealed the specific sense of our ancient scholar regarding the nosocomial infection. Drugs like Khadira, Pilu, Parushaka, mantras, Mani Dharana, Dhupana, or Aghara, etc. Samskara. There are 60 samskaras in Kamarvatya. Before birth, Garbhadham, Pulsavana, Sipuntana. These 3 samskaras. After birth, in childhood, it was Jata Karma Sanskara, Nama Karma Sanskara, Nishkrama Sanskara, Annaprasha Sanskara, Chudakarma Sanskara, Karma Veda Sanskara. For education purpose, there are Upanana Sanskar, Vedharamba Sanskar, Samavartana Sanskar. In adult stage, there are Vivaha Sanskar, Vanaprastha Sanskar, Sannyas Sanskar. After death, Adhyasti Sanskar. Vedana Adhyaya. Acharya Kashyap enlisted 34 clinical conditions in Vedana Adhyaya of Sutasthana. The term Vedana here refers to the knowledge of science. The knowledge of science and symptoms in children, which are indicative of particular disease due to Samartham. If unique, the diseases are difficult to diagnose, and Vedant have made hotspot diagnosis of children with diseases in children. बालस्य हृदयम् औषधं पद्यथ प्राणस्य उपक्रमे अन्ये च विशेषः. Administration of medicine in children. So has clearly mentioned that the nature of the medicine to children should be tasty and congruent, and other aspects like dosages would also be speciality. Varmabharakumarakya iti etat trividam vaya. The word Kumara limited the age up to 16 years. Therefore, the maximum age limit Kumara is birth to 64. Ayu Pariksha in children was described in depth in order to assess not only the longevity but also the love of future life, which encourages the field of science of forecasting. This examination is also helpful to verify the congenital anomalies of children. Embryology is beautifully described by Harita. Apart from the device and birth-wise growth of embryo, he gave special description of establishment of places different used in the body. Prematurity is described as Apurva Divasagarva. Describe 5 Shiradosas. Fullika are described along with Graharoga. Harita stated that Bharat examines the knowledge of fertilization, pregnancy, and labor beside the therapeutic of children disease. कमानवृत्य अतिवर्धन वक्तव्य अज्ञात ही मेघागत इंद्रियादि पश्चय चिकित्सित परास्तु विद्यम शास्त्रज्ञ धर्मवतयः परिपालयति. About the branch of penetration, Acharya says that penetration should be more proficient in pathology and their observations to initiate treatment and the nature. The doshas of medicine depend upon the gravity and severity of disease. In pediatrician, the diagnosis as well as prognosis on the strength of clinical picture should be made at the earliest possible so that the specific line of management should be fixed soon. Due to this delicate state of child only. धूपचैवानुधूपश्च प्रतिधूपश्च जीवितः त्रिविधो धूप उद्दिष्टः कर्मभेदादचिकित्सकैः कौमारवृत्त्यास्त्वपरे जङ्गमस्थावर आश्रित व्यूढीभ्रुवते धूप काश्यपस्य मते स्थितः. Acharya discovered Graharoga, which is more incident in pediatric age. In context of Graharoga Chikitsa, Acharya discovered about Kulkarma, Rakshana Karma. Several regions were widely described for purpose of consumption in food. Also that describes desired sense of the body. This is named as Pulsur Saskara. It may be controversial topic in outlook of Western medicine, but definitely from interesting for research. Serial events of psychology and psychiatry are referred to pediatrics. Example, toys to be clean, not to be beautiful, but not fearful. The government to be chosen, and child will be prepared. No Musimanacha never wrote an administration, but never surveyed on the mathematical pathology. During the 2 women mathematical group for Paratantrata, last in never children with few body. The child will only get that. That's why it don't afford mistakes. The role of pediatrician is always critical as he has moved from the stage of pregnancy and hardly needs to for welfare option. In the medical field, Dhati inside hundreds have to face critical situations in view of child's benefit and risk for condition. Acharya defined the those who risk red weather to rebate it low to see children. So those who know basics should also be know some. The conclusion of this topic: child life is one of the major development areas. More or less information are available in almost all Ayurvedic texts at breathing and levels. Thank you so much.
Thank you, Doctor. Thank you for the wonderful presentation. Next, I'd like to invite Dr. Megha Maxi for the paper presentation on the topic Uttaravasti in gynecological practice. Dr. Megha, are you there? Dr. Megha, are you there? Dr. Megha, are you there?
She will be joining just now. She will be joining.
Okay, doctor.
Hello, sir.
Hello.
Hello, sir.
Good evening, doctor. You are audible.
Am I audible?
Yes, doctor. You are audible.
Okay. Sir, will you please share my screen?
Okay, doctor.
Slide.
Just a moment. Please start the session, Dr. Megha.
Hello. Yes, sir. Sir, can I start?
Sure, doctor. Please start, doctor.
Okay. Okay. Good evening, everyone. I am Dr. Megha Maxi, second year PG scholar from PNM Ayurveda Medical College, Cherugutti, Thrissur. Today, I am going to present about Uttaravasti in gynecological practice. So, over to the next slide. These are my contents. And to next slide. Okay, so in Ayurveda, Vasti is considered as an Ardha Chikitsa by some Acharyas and as a complete therapeutic procedure by others due to its vast areas of action. As defined by Acharya Charaka, Vasti is of three types, and among them, Uttaravasti has been highlighted for most of the urogenital disorders in both males and females. In Uttaravasti, the drug is administered through the ureteral, vaginal, or uterine route. Next slide, please. Nirukti of Uttaravasti is that, as defined by Charakacharya, Uttaramarga Diyamanteya Kimva Sreshta Gunadaya Uttaravasti. Saniruhat Uttaram Uttarena va Margena Diyade Uttaravasti is given by Ashtanga Samgraha. Next slide. Moving on to the classification of Uttaravasti. Based on drug administration, it can be classified as Naihika Uttaravasti and Nairuhika Uttaravasti. And based on the route of administration, divided into three: Mutrashega Uttaravasti, Yonigada Uttaravasti, and Garbhashigada Uttaravasti. Next slide. Moving on to the indications, the main indications are Shukradushti, Shondadushti, Pushpodrega, Rajanasha, Kashtartava, Mutraghada, Mutradosha, Yoni Vyabat, Aprasamsthiti, Shukrotsega, Sharkarashmari, Basti Vangshanameh Shula, Yoni Vibramsha, Ashragdara, Aprasavadi Mutre, Bindum Bindum Stravadi. And the contraindications are uterine or vaginal Uttaravasti is not administered for girls. And in cases of genetic and congenital anomalies, in cases of fistula, cancer, hypersensitivity, it is contraindicated. The Uttaravasti Endra mainly consists of Vastipudaga and Vastinetra. Vastipudaga is made up of the bladder of goat, sheep. In case of non-availability, neck skin of birds is chosen. And for Vastinetra, it is also called Pushpanetra. It is made up of Hema, Raupya, and the shape is of that of Gopuchakriti. It has 2 to 3 karnikas. The properties are Drida, Slakshna, and Vritta. Here, I've quoted the age, passage through which the medicine is given, the length, circumference of the nostril, and size of lumen, and karnika, separately for males, girls, adult women through the urinary route, and adult women through the vaginal route. The length in male through urinary route is 12 angula, and Maladi the time of administration is Purvana or Madhyana. Urinary Uttaravasti, no specific time is indicated. Uterine and vaginal Uttaravasti, Charaga and Vagbada has mentioned that to be done after cessation of menstruation and in emergency conditions, days other than Ridugala also. Next slide. Moving on to the dose, Charaga has mentioned, irrespective of route, Sneha can be given in an amount of half pala. Vagbada has quoted, for female, the Sneha has to be given in 1 preguncha and for girls in 1 shuk. Based on the gender, in males, Sneha can be given in 1 preguncha, Kwada can be given in 1 prasruta, and in females, Sneha can be given in 1 prasruta and Kwada as 2 prasruta. In current practice, through urinary route, 50 ml of Sneha and up to 200 ml of Kashaya is usually given, and through Yoni Maga, 5 to 10 ml of Sneha is given. Next slide. The procedure, as mentioned by Ashtanga Hridaya Sutrasthana, is that Uthanaya Shayanaya Samyak Samgoja Sakhni, Udajanva Strichaturdan, Ahoratrena Yochid, Vastis Triratram Ratram Evancha, Sneha Matram Vivarte, Traham Evancha Visramya, Pranidhya Punatraya. So, first it is mentioned the position, and it is said that it can be given after the cessation of menstruation in 3, 5, or 7 days. Management in case of non-return of Sneha is introduction of Yonivarti of Shodhanadigana, Spiktadana, Niruhavasti with Kashaya of Shodhanadigana or Virejana, and for management of Daha, Vasti either with Madhuka Kashaya plus Shakara and Madhu can be given, or Shiri Viksha Kashaya plus Paya can be given. Next slide. So here I've posted a picture of current practice. This was administered at our college just before the administration of Uttaravasti. This picture was taken. Next slide. So in current practice, we use the materials Vasti Netra. For uterine Uttaravasti, Rubin's cannula is used, or IUI cannula is used. For Vasti Pudaka, syringe containing 10 to 50 ml of capacity is used. We use Cusco speculum, sponge holding forceps, artery forceps, uterine sound, Hegas dilator, and additionally, we may also need swab, gauze, kidney tray, normal saline, gloves, xylocaine jelly, autoclave, etc. Next slide. So here is the procedure that we usually do in our OP basis and in IP basis. The Purva Karma is patient is asked to empty her bladder and made to lie in lithotomy position. External genitalia is swabbed. Yonic Shalna is done if needed. Pradhana Karma, under aseptic precautions, Cusco speculum is introduced. Generally insert the uterine sound. Medicine taken in the syringe is instilled either in the uterus or vagina, and Yoni Pijo is inserted thereafter. And Paschat Karma, the patient is made to lie down in head-low position for 10 minutes. Vitals are strictly monitored. Next slide. The commonly used medicines for Uttaravasti in our gynecological practice are Phalasarpi, Sugumaragrita, Mahanarayana Taila, Varunadi Kashaya, Kshirabala Taila, Shadavari Krita. In cases of tubal block, Kumari Taila, Evakshara Taila can be given. For ovulation induction, Shatapushpa Taila, Lashuna Taila, Mahanarayana Taila can be used. In cases of low FSH and PRL, Phalasarpi can be used. For cases of Gulma, Ksharavasti can be administered, and cases of Granthi, Varunadigrita can be administered. So this is with my presentation today. I hope it was okay for you all to hear from me. And thank you for this opportunity. I'm concluding with this. Thank you.
Thank you, Dr. Neha. Thank you for the wonderful presentation. Okay, next we go to the next presentation. I would like to invite Dr. Sneha for the paper presentation. Dr. Sneha, are you there? Dr. Sneha, are you there?
Yes, sir. Am I audible?
Yes, Dr. Audible. Good evening, Doctor.
Good evening. Can I start?
Sure, Doctor.
Good evening, one and all. Myself, Dr. Sneha Kashyap from PNNM Ayurveda Medical College, Shornur, Kerala. Today we are going to discuss about palliative care in Ayurveda. Can you share the PPT, sir?
Okay, just a moment, Doctor.
Okay.
Doctor, once again, can you send your PPT, Doctor? I will send you a message on your WhatsApp or just mail on the irapofficial@gmail.com.
Okay. Okay. You can continue the another presentation. I will
Okay,
send
Doctor.
it
Okay.
just in 1
Okay, Doctor. Okay. Dear participants, we know that Dantajanmika Adhyaya, found in the Kashyapa Samhita, focuses on the dental health and care of children. It provides detailed guidance on the teething process, the maintenance of oral hygiene, and the treatment of dental issues in infants and young children. The next topic is Dantajanmika Adhyaya, Kashyapa Samhita. I would like to invite Dr. Chaitanya Prakash Devram Balavi for the paper presentation.
दंतजन्मिक अध्याय काश्यप संहिता presented by Dr. Chaitanya Prakash Devram Wali, PG College, Department of Commerce, Technical Ayurvedic College and Postgraduate Training and Research Center, Kodori, Maharashtra. Guided by Dr. Shailesh Araj Gulkar, Associate Professor, Department of Commerce, Yashwant Ayurvedic College and Postgraduate Training and Research Center, Kodori, Maharashtra. दंत संहिता इह खलु द्वात्रिशुण्डदन्ताः तत्र अष्ट सकृज्जाताः वरुणदन्ता भवन्ति अतः शोषा द्विजाः. In human beings, there are 32 teeth. Among them, 8 are sakrujata, that means they erupt once in a life. Rest 24 are dvija, that means erupting twice in a life. Eruption. यावत् स्वेव च मासेषु जातस्य तत् उद्भीयन्ते तावत् स्वेव च वर्षेषु पतिताः पुनरुद्भिद्यन्ते. Here, Acharya Kashyap mentions that in whichever month the teeth appears, they fall and reappears in the same way. Definition. तत्र मध्यद्वो उत्तरो रागिदन्त सद्यो भवतः तौ पवित्रो तस्मात् साभ्यं खण्डं न श्राद्धं अर्हति पवित्रो हि सः. Middle upper row, that is Rajdanta, which is central incisor and which is 2 in number, these are considered sacred. If they break, the child becomes unfit for paying the homage, that is Shraddham, to their parents. That means they become a apavitra. Tayo ubhayatah, Pashvayoraphi Vastav. On both sides are Vasta. That means lateral incisor, which is 2 in number. Tayorapi Damshri, lateral to this Damshras, that is canine, which is 2 in number. Shesha Swaruda Hanavya Iticha Utsanti. Rest are Swaruda and Hanavya, that means premolars and molars. Tatha, Adhastata, similarly are present on the lower jaw. Dental formula. I for incisors, C for canines, E for premolar, and L for molar. So dental formula present in adult, that is ICPM is to 2123. In children, ICPM is to 2102. Eruption of teeth according to the sex of the child. Female child. तत्र कुमारेण नक्षत्रम् अल्पं नाभाकरं च दन्तजन्म सुशिरत्वार्थदंशानां प्रजोत्प्रभावात्. The eruption of teeth in a female child is early and causes less trouble due to the portions of the teeth and soft nature of the gum. Whereas in male child, प्रकृष्टकालबाधबलन्तकुमाराणाम् आचक्षते घनत्वातदंशानां स्थिरस्वभावात् च. The eruption of teeth in a male child takes longer time and causes the more trouble due to the compactness of the teeth and stable nature of the gum. दंतानां निषेधमूर्तित्व भेद वृद्धि पतन पुनर्भाव निवृत्ति स्थिति परिक्षय चलन पतन हद दुर्बलतो जाति विकासात निषेधात स्वभावात मातृपित्रो अनुकरणात स्वकर्म विशेषात च इति मचक्षते महर्षयः तथान्ये अपि शरीरवृद्धिरासं गुणदोष प्रादुर्भावः. The insemination, manifestation, eruption, development, falling, reappearance, cessation, stability, decaying, looseness, falling, firmness, and weakness of the teeth depend upon the jati, that is racial specification, and swabhava of the mata pita and the site. Appearance of the growth, decline properties, and defect of the other body part is also in the same way. Nunantu Chaturthadishu, Maseshu Danta, Nishichyamti. In human beings, there are inseminated from the 4th month onwards. Amangalyam Danta, which is 8 in number. Tatra Sadanta Janmacha, Purva Uttam Danta Janmacha, Virala Danta Janmacha, Hina Danta Tacha, Adhika Danta Tacha, Tarala Danta Tacha, Vivarna Danta Tacha, Putita Danta Tacha, Amangalyam Bhavati. Sadanta Janma means first with the teeth. Purvam Uttaradanta Janma means first eruption of the upper teeth. Virala Danta Janmacha means eruption of the scattered teeth. Hina Dantata means presence of less teeth. Adhika Dantata means presence of the more teeth. Tarala Dantata means presence of uneven teeth. Vivarna Dantata means discolored teeth. Means Patita Dantata means cracked teeth. Treatment of such a Amangalya Danta. तथा शान्त्यर्थमार्गनिष्ठं निर्वर्तेत कालीपाकम् अनाहुताग्निः प्रजापतिः इत्येते. Offering of butter and fruit, the waiter of Maruti should be done. Kalipakam, dish for ablation, should be offered to Prajapati without offering it to the Lord Agni. According to the Ashtanga Sangraha, worship of the Naiganesha Graha is advised. Dantotpatti Bhedam, which is 4 in number, Chaturvidham to Danta Janmacha Shakti, Kamudgam, Samruttam, Vivruttam, Danta Sampat, iti. Samudgam Shai, Nitya Sampatata, decrease in number due to the falling perpetually. Samruttam Adhanyam, Malishtam, inauspicious and the dirty. Vivruttam Vittam Anitya, Kala Dehatra Samachana, Danta Tvaka Ashu, Danta Vaivarnya, Paramasarna, Badam, iti. Worn out, invariably affected with the salivation, being uncovered get easily discolored and are easily affiliated with the disease. Danta Sampat means tooth erupted in 8 months. Time of teeth eruption and their effects. Chaturthi Masu Durbala, Ashuk Shaili Amaya Bahula, decay early and afflicted with the so many diseases. Panchami Masi, Siyandana, Pramarshina, Amaya Bahula, shaky with the moderate sensitivity, easily afflicted with the disease. Shashte Masi, Pratipa, Malagrahinam, Viburnum Gunadanta. In late stage, dirty, discolored, susceptible for the dental caries. संपत मासी दविकूड स्फोटिना रजीवमंत खंडा वृक्षा विषमाष्ट्र उन्नताश with the two pockets split, stripped, broken, dried, irregular and protuberant. Ashtamen masi सर्व गुणे संपन्न. Best qualities of teeth. दंत संपत पूर्णता, समता, घनता, शिथिलता, स्निग्धता, श्लक्ष्णता, निर्मलता, निरामयता, किंचित उत्तरोन्नता, दंतबंधनानां च समता, रक्तता, स्निग्धता, बृहत्तम, स्थिरमूलता, completeness, evenness, compactness, white in color, in toss smooth, clean, disease-free, slight protuberance of upper bun, evenness of the gum, redness and unrighteousness, compactness of the gums with a big, compact and stableness of the root. Danta, which is 5 in number, Hinurgana Sita, Asita, Pravibhakta, Danta Bandhanatvam, Prashastam, Rishayuk, Vadanti. Hina, which we are less in number. Ulbana means teeth which are more in number. Sita means teeth which are white in color. Masita means teeth which are black in color. Pravibhakta Danta Bandhanatvam means teeth which undivided gum. Dantotpatti Hedi. According to the Acharya Kashyap is Rakta and according to the Acharya Bhagavad, Asthit and the Majja. Sequence of eruption of the primary and the secondary tooth. Primary, deciduous teeth. Maxillary. Central incisor starts eruption in 7.5 months and starts shedding in 7 to 8 years of age. Lateral incisor eruption starts in 9 months and shedding in 8 to 9 years of age. Canines eruption starts in 18 months and shedding starting 11 to 12 years of age. Maxillary, first molar, eruption starting 14 months and shedding in 10 to 11 years. Second molar, eruption starting 24 months and shedding starting 10 to 12 years. Mandibular teeth, central incisor, start eruption in 6.5 months and shading starting 6 to 7 years of age. Lateral incisor, eruption starting 7 months and shading starting 7 to 8 years of age. Canine, eruption starting 16 months and shading starting 9 to 11 years of age. First molar, eruption starting 12 months and shading starting 10 to 12 years of age. Second molar, eruption starting 20 months and shading starting 10 to 13 years of age. Eruption permanent teeth. Maxillary teeth, mandibular teeth. Central incisor, maxillary teeth 7 to 8 years and mandibular teeth 6 to 7 years of age. Lateral incisor, maxillary 8 to 9 years and mandibular is 7 to 8 years of age. Canine, maxillary 11 to 12 years and mandibular 9 to 10 years of age. First premolar, maxillary 10 to 11 years and mandibular 10 to 12 years of age. Second premolar, maxillary 10 to 12 years and mandibular 11 to 12 years of age. First molar, maxillary 6 to 7 years and the mandibular 6 to 7 years of age. Second molar, maxillary 12 to 13 years and mandibular 11 to 13 years of age. Third molar, maxillary 13 to 17 years and mandibular 13 to 17 years of age. Thank you.
Thank you, Dr. Chaitanya Prakash. Thank you for the presentation. We know that palliative care in Ayurveda focuses on providing comfort, relieving pain, and improving the quality of life for patients with chronic or terminal illness. Through personalized treatments like herbal remedies, oil therapies, dietary adjustment, and lifestyle modifications, Ayurveda helps manage symptoms such as pain, fatigue, and stress while promoting emotional and spiritual well-being. Are there. We have to detailedly learn on the palliative care in Ayurveda in the next presentation. I would like to invite Dr. Sneha K for the presentation.
Good evening, one and all. Myself, Dr. Sneha from PNNM Ayurveda Medical College and Hospital, Shornur, Kerala. Today we are going to discuss about palliative care in Ayurveda. First of all, palliative care is an approach to improve the quality of life of a patient as well as his family members who is suffering from a life-threatening illness. The word palliative means pallium, that is to clog. This is to address or eliminate. Is it audible? Hello?
Yes, Doctor. Audible. Please continue, Doctor.
Okay.
Audible, Doctor.
Pallium means clock over, to address the underlying causes. Should not address the underlying causes, it is to eliminate the effects. Next slide, please. Next. This is Dr. Cicely Sandwer, who is the founder of Hospice Movement. She is the inspiration behind the idea of palliative care. And this famous quotation, "You matter because you are you, and you matter to the last moment of your life." Once Dr. Cicely has asked a patient who knows that he was about to die, "What is the final wish that you have?" And he replied, he wants a person who he really thinks that he's trying to understand what he is going through. So this is the chance of every practitioner to be a person to improve the quality of life of patient as well as the family member of a conditions like cancer, HIV, dementia, progressive neurological disorders, motor neuron disorders, COPD, heart diseases, liver and kidney dysfunctions due to various causes. So, what is palliative therapy? Whether it is a main therapy? No, it is a simultaneous therapy. The palliative care should always go as a supported with the main course of treatment. What is goal of palliative care? So, achieving the possible quality of life of patient and family members, and also affirms life and regards dying as a normal process, provide relief from pain and other distressing symptoms, to help the family cope during patient's illness and their own bereavement. What is the important thing in palliative care? That is the communication skills. So making connection, establishing rapport, building up trust, maintaining a connection, being available, spending time, sharing secrets, sharing self, maintaining trust are the biggest things. Breaking the connection after the death of patient is also important. There are several programs conducted by Ayush in Kerala as well as many parts of our country like Snehadara, Snehasparsham, Ayushparsham, etc. So we'll go to the Ayurvedic management, what we can provide to the patient who is suffering from a serious illness or bedridden cases. In case they are having chwaram, we can suggest them vetumaran with honey or ginger. In cases where patient is suffering from vomiting, we can prescribe them Gulijadi Kashayam, Laja Saktu, Villodi Lehyam, Amrapallava Kwadam, etc. In Koshtrishula, we can give them Ashtachurnam, Hinguvajadi Churnam, or Dhanvantaram Guliga. In case of patients who are suffering from Adisaram, we can prescribe Kudajarishtam, Kudajaganavadi, Villadi Guliga, Villodi Lehyam, and Ashtakshari Guliga. Oral care is very much important in case of pain and palliative care. So, we can give Triphala with honey, Arimeda Ditailam, Gandusha and Kabala, Pratisaranam. As you always know that pain and palliative is mainly focusing on cancer patients. Not only cancer patient, but the most condition what we are observing nowadays for palliative care is cancer condition, where pain is the main issue to be solved. So we can advise Daras, Dashamula Shirapagam, Dashamula Karaskaram, and Dasasinduram. And Vedana Stabana Gana told by Charaga can be given as Churna or Kashayam or Kashaya Panajalam. And also Shulakna Gana drugs can be used. Insomnia. Insomnia is the condition where the family also suffers. The family member who is taking care of the patient will also suffer from insomnia. We can give Takradara. We can address yoga, pranayama, asana, and murda taila, including talam, like Valiya Chandanadi, or Himasagara Tailam. We can also give Mansamitra Vadagam and some patent medicines like Relax, Sumenta, etc. In case if the patient is suffering from anorexia, the drug of choices like Deepanapajana drugs and give importance to palatability always. We can give Ashtachurnam syrup, Villuadi Lehyam, Pippalyasavam, Panchakolasavam, and lemon juice. Lemon juice, ginger, and honey. That will be available for every patient in house only, so we can prescribe them. In case of urinary tract infections, like I said, bedridden cases and serious illness means they will be having frequent attacks of urinary tract infections, where we can advise Pichus, Braityadi Kashayam, Braityadi Kashaya Panajalam, Chandraprabha Vadi, Gokshura Gugulu. In those who are having bed sore, because they are lying for a long time in bed, they cannot move their limbs in many cases. So we always remember to check a patient in both directions, right and left, both, especially the buttocks area, whether they are developing any bed sore. So we can prescribe them Alpamara Kashaya Dara, Dhubana with Gugulu, etc. and Tilakalka applications, as we are always doing Jatyadi Grida or Jatyadi Taila application. And also we can do all the treatment that has told for infections. Now the next one is constipation. As I told before, pain and palliative, we will more come to contact with such case like cancer, where they will be taking morphine. In morphine-induced constipation, we can interfere with Triphalachurnam, Phalavarti, or Hidya Virejanam, or Trivitlehyam. So this is about palliative care in Ayurveda. Always remember that there is no situation where nothing can be done. There may be a limit to cure, but no limit to care. Thank you.
Thank you, Dr. Sneha. Thank you for the wonderful presentation. Next, we go to the another paper presentation. I would like to invite Dr. Amrita Lakshmi T for the paper presentation.
Good evening, everyone. Namaste, Shri Gurubhyo Namaha. I am Dr. Amrita Lakshmi, and my presentation is one of these series on the Ayurvedic management of Hashimoto thyroiditis following post-COVID-19. So, to brief about the condition, Hashimoto thyroiditis is an autoimmune condition in which the thyroid gland is destroyed by the thyroid antibodies such as anti-TPO or anti-PG. But in most of the, that is 95% of the cases, it is anti-TPO that leads to the Hashimoto thyroiditis. And when we see in the post-COVID era, there has been a sudden surge in the cases of thyroid dysfunctions, especially the autoimmune thyroiditis. So this has been studied by numerous institutions at the global level. That is the relationship between the thyroid and COVID-19 infection has been studied. So I have taken two such studies.
One is from the American College of Endocrinology, where they have revealed that 50% of the 356 patients, COVID patients that is, had thyroid dysfunction, which includes Hashimoto thyroiditis in their post-COVID case, as post-infected case. Okay. In the ASSP, the Papua 23 Hospital in Italy, revealed that 599 COVID patients out of 599 COVID patients, almost 105 patients had autoimmune thyroiditis in the post-infected phase, who were not previously a known case of such condition. So this shows the exponential increase in the autoimmune thyroiditis after the COVID-19 infection. So this needs to be addressed. Moving on to the pathophysiology of this Hashimoto thyroiditis. So the SARS-CoV-2 virus, it has a special affinity towards ECE2 receptors. So these ECE2 receptors are abundantly found in lungs. That is why these virus directly attack the lungs and they manifest COVID-19 infection. But interestingly, these ECE2 receptors are found in large numbers in thyroid gland next to the lungs. That is, we are the second gland to have the largest number of ACE2 receptors. So that is why the SARS-CoV virus go and attach to the thyroid gland ACE2 receptors, and we bring about the inflammatory cascade that happens, and which ultimately leads to the infiltration of IL-2 and other inflammatory cytokines, which leads to the destruction of thyroid follicles, and thereby it reduces the amount of thyroid hormone production. So this condition is known as Hashimoto thyroiditis. This being an autoimmune condition, our Rasayana has a very good as it has antioxidant and immunomodulative property. Moving on to the case. So the case is a 24-year-old female working in IT sector from Bangalore who complained of tiredness and weight since 2 years associated with dizziness since 2 years and mood swings since past 1 year. So the only specific history, so that is the significant history, the patient who was COVID-19 infection in 2021. And looking at the family history, both her parents had a COVID-19 infection as well in 2021. And her mother had a motor arthritis. So this particular patient has a unique to conditions. Moving to the timeline. So in September 2021, the patient had COVID-19 infection. She first contracted the COVID-19 infection, and from the very next month, she had experienced tiredness and weight gain. And around May 2022, she also started having mood swings episode, and followed closely by the dizziness episodes also. So she first consulted a doctor who then diagnosed her with Hashimoto thyroiditis as her TSH was high and her anti-TPO level was also high, which shows that anti-TPO was positive. And she was also started on levothyroxine. She took it for about 8 to 10 months, but she did not find any difference in her condition. Her weight gain was still there, and she was still feeling tiredness. And the only thing was that her dizziness episode was reduced. So she approached our OPD in May 2023. During her visit, the physical examination showed a normal value except for the pulse rate, which was low at 62 per minute, 62 pulse per minute, and then her facial appearance was puffy, and her nail was brittle, and her skin was tight. Other than that, the thyroid gland inspection was normal. And the patient was assessed using the Zolsky clinical score for hypothyroidism. And she had scored 8 out of 12, which shows that patient has clinical hypothyroidism. And these are the lab reports. This shows the TSH is a
elevated at 23.03, and the anti-TPO was positive and the value was 838, where negative is considered as below 5.6. So the therapeutic intervention that we had given in this case was the Satyavamana with H2 Madhufanta, Madanafla Yoga, and Shiram. And following the Shadana, we have given Rasayana Prayoga with Rasayana Churna, that is 2 grams morning and night after food. So these are the before and after treatment assessment. We can see that CPSH has significantly reduced from 23 to 3. So these are the before and after treatment assessment of using these Welsky's clinical score. So we can see that the score has been drastically decreased from 8 to 2. So this shows the improvement in this condition. So coming to the discussion part, Rasayana Churna, it has only 3 drugs, that is Amlaki, Guruchi, and Yogshura, and it has its reference in Ashtanga Hridayam Uttarastharam Rasayana Chikitsa. So for the patient, previous to the Ramana, we had given about Kshara to bring about the kapha increase. And Purva Karma was Vyanga and Vashvasveda, and totally 8 Vedas were the So Vamana was given because it had a Shodaka effect, and the Malarupa kapha is expelled only through the Vamana route, and also it thereby it reduces the Manda Guna of the patient. So looking at the symptoms of the hypothyroidism, we can infer that the Manda Guna of the kapha has increased. So to tackle that, we have given Vamana. Next, moving on to the mode of action of the drug. So the picture as a pradhanata of all the 3 drugs, along with the Dina property of Roshura Guruchi and the Pachana property of Guruchi and Amlaki, it acts at Agni level. And the Guruchi, having the Shodaka property, it cleanses the Shotas. And the Rasayana of all the 3 drugs, it works at the Agni level. And along with the Kasaswasahara property of Roshura and Guruchi shows that these drugs we work on the respiratory pathology as well. Since in this case, the Hashimoto is linked to the secondary to the respiratory infection, it is also important to address that issue. And the Krimihara property of these drugs also helps in curbing the infective pathology of the COVID-19, and it stops the further progression of this infection. And the Rasayana property of all the 3 drugs, it helps in regularizing the thyroid follicular cell regeneration. Now looking at the chemical composition, so the quercetin and galicafetin amla helps in inhibiting the binding capacity of SARS-CoV-2 AC2 receptors. So this was a study. This was a study. I just don't remember the place of study right now. And then economic extract of the Gochura and Guruchi, it helps in regulating the IL-2 and other cytokine infiltration, and Amla extract helps in preventing the oxidative stress damage and cytotoxicity in thyroid gland. So this was proven by animal study that they had given Amla extract to the rats, and it had showed a specific anti-cytotoxicity effect in thyroid gland cells. So all these things in combination helps in curbing these pathologies. So the advantage of this study is that in contemporary science, they do not have much options for the treatment of Hashimoto thyroiditis except for the T4 replacement therapy. They only focus more on replacing this replacing the deficiency rather than treating the root cause. So this is where our science plays the role. We focus more on treating the disease from the root, that is, we correct from the right from the Dhatu level, and so the patient will not require any lifelong medications. So this was the advantage, and the disadvantage we faced in this case was the patient was a resident in Bangalore, and She was here in Chennai for a week. She came here for some marriage. So she didn't give us much time to, carry out the proper Vamana protocol. So we had to go with the Sadhya Vamana. And we immediately went with the Rasana Prayoga because the patient also requested that she did not want much of medications because she being in an IT field, her schedule was erratic. So she was not able to follow the medication. So we kept it very simple. And the research scope of the study is the fact that there hasn't been any article or case study published about post-COVID thyroiditis in India shows the unawareness of such conditions. So we Vaidyas should address, we should be aware of these conditions and should address this at the very preliminary stage. Especially our Ayurveda has more scope and more options to treat such conditions when compared to the other sciences. So with this, I would like to conclude my presentation. Thank you.
Thank you, Dr. Amrita. Thank you for the wonderful presentation. Next, I would like to invite Dr. Prajakta Vishnu Bise for the paper presentation. Dr. Prajakta Vishnu, are you there?
Yes, sir, I am here.
Good evening, doctor.
Good evening, sir. Myself, Dr. Prajakta Bise. I want to present my topic. The PPT, please.
Just a moment, doctor.
Good evening, sir.
Good evening, doctor. Please start the session, doctor.
Myself, Dr. Prajakta Bise, Yashwant Ayurvedic Medical College, Kodoli, Department of Panchakarma, PG final year. Next slide, please. My topic name is lower back pain managed by Panchakarma treatment. Backache is a pervasive health issue that transcends age, occupation, and lifestyle, affecting millions of people globally. It is the fifth most common reason for the physician visit these days. Traditional medical approaches typically address back pain through pharmacological intervention and surgical procedures, which may not always target the root cause of the condition. This is where Ayurveda, the ancient holistic healing system, offers a unique and effective approach for a back pain. This blog will explore the Ayurvedic understanding of backache, which is an Ayurvedic treatment for back pain, discussing specific therapeutic modalities and their physiological impacts to offer a comprehensive perspective on this age-old healing tradition. Understanding low backache. Low back pain occurrence is increasing day by day due to sedentary lifestyle and unhealthy work patterns of young adults. Pressure on the intervertebral disc is highest in sitting position, 30% less in standing, and 50% less in lying down, so that longer sitting will be more uncomfortable than the standing and walking. In this corporate era, people doing long hours of sitting jobs are most prone to get low back pain. Low backache can be characterized into acute, subacute, or chronic pain. Acute pain mainly typically results from sudden injury or strain and lasts for few days to weeks. Less than 6 weeks. Lasts less than 6 weeks. Subacute pain lasts for 6 to 12 weeks, and chronic pain persists for more than 3 months and may be due to conditions such as degenerative disc disease, spinal stenosis, and osteoarthritis, etc. Common causes for low back pain includes heavy physical work, poor posture, unaccustomed weightlifting, prolonged periodic of static work posture, obesity. Cause related to spine includes lumbar spondylosis, lumbar stenosis, infection, tumor. Common symptoms include persistent dull ache or sharp pain, muscle stiffness or spasm, radiating pain to the lower limbs, that means sciatica, reduced flexibility and mobility, transient numbness and paresthesia in the dermatome of the nerve root. Ayurvedic perspective on low backache. According to Ayurveda, low backache is primarily linked to an imbalance in the Vata dosha. Acharya says that there is no sure pain without the vitiation of Vata. Vatasya Upakrama and Vatvaidya Chikitsa can be adopted in the treatment of Vatvaidya. Ayurvedic treatment for low backache mainly aims at reducing the pain and stiffness and arresting the process of degeneration and reoccurrence. Panchakarma for low backache. First, Snehan. It includes both internal and external Snehan treatments. Snehan is done in the Nirupstambhavastha of Vata, in which there is no association of arm present. To achieve the Niramavastha, reduction procedure are done in the first place. Internal Snehapan comprises of medicated oil and ghee intake that has Vathar properties. Second one is Swedan, herbal steam therapy. Elevates Vata softens the body and disintegrates the adhered morbid materials. Vedan is indicated for Samvadis procedure including Patra Pinda Sweth, Churna Pinda Sweth, Nadi Sweth, Parishak Sweth are done here. Third one is Mrudu Sanshodhan. For the elimination of dosha, Snigdha Virechana is advised in the Vatvedi. Irantel is recommended for the Nitya Virechana in Vatvedi. Fourth one is Basti. Medicated enema therapy. Basti is the one of the most crucial treatments for Vata disorders and is highly effective for chronic low back pain. Medicated oil or herbal decoctions are administered as enemas to cleanse the colon and balance the Vata dosha. Basti helps to remove accumulated toxins, reduce inflammation, and nourish the tissue, offering long-term relief from low backache. Fifth one is Kati Basti. Localized oil treatment. In this treatment, a reservoir of warm medicated oil is placed on the lower back for a specific duration. This acts as both Snehan and Spedan. Helps to increase the blood flow, reduces inflammation. PGGL. PGGL, also known as Tel Dhara, involves the continuous pouring of warm medicated oil over the body. This therapy combines the benefits of Abhyanga and Swedan, providing profound relaxation, improved circulation, and relief from pain and stiffness. Thank you, sir.
Thank you, Doctor. Thank you for the wonderful presentation. Okay, next we go to the next presentation. I would like to invite Dr. Shabaluri Wagid Khan for the paper presentation on the topic Review Study on Effect of Prenatal Yoga in Pregnancy.
Hello, good evening, everyone. Am I audible? Hello. Hello. Hello, am I audible?
Thank you, Doctor. Thank you for the wonderful presentation. Next, I'd like to invite Dr. Ashwati US for the paper presentation.
Good afternoon all. Myself Dr. Ashwati US, second year PG scholar, Department of Dravyaguna Vignana, Amrita School of Ayurveda. I am hereby presenting my topic on literature review on role of Sandhaniya Mahakashaya Dravya in the management of wound healing. Moving to the introduction, the existence of herbal medicine worldwide has a long history. They are being used and well documented by ancient Indian, Egyptians, Greeks, and Chinese for various therapeutic purposes. Among the knowledge of ancient medicinal practices, Ayurveda stays unique from a vast variety of healing methods used and discussed in the literature. Vrana is a term derived from the root word vran, meaning splitting or tearing of body tissue, and thus called as vrana. In more details, vrana is defined as that which leaves a scar after destruction of the skin by any kind of intrinsic or extrinsic factors. The two main types of prana are Nija and Agandu. The Nija prana occurs due to the intrinsic factors which is caused by the aggravation of Tridosha, whereas Aganduja prana arises due to the external factors such as assault or injury to the body. The pathogenesis of prana is described as the destruction of Mamsa Dhatu due to the adoption of its etiological factors resulting in Raktadushti. Healing of wound is a complex and dynamic process, and it can be concluded under 4 headings. One is coagulation and hemostasis, second one is inflammation, third one is proliferation, and fourth one is wound remodeling with scar tissue formation. In Charaka Samhita Sutrasthana, Acharya Charaka explains Sandaniya Mahakashaya. The Sandaniya Mahakashaya Devyas are the group of drugs which possess Sandaniya action. The review aims to find out the role of Sandaniya Mahakashaya Devyas in the management of wound healing, and the details are elaborately mentioned here. Research question: does Sandaniya Mahakashaya Devyas possess wound healing activity? Hypothesis: null hypothesis. Sandaniya Mahakashaya Devyas does not possess wound healing activity. Alternate hypothesis: Sandaniya Mahakashaya Devyas possess wound healing activity. Methodology: Samhitas and Nigandus were searched for reviewing Guna and Karma of Sandaniya Mahakashaya Devyas. Databases like Scopus, PubMed, ResearchGate, etc. were searched for scientific papers to find out the phytoconstituents present in each Devya of Sandaniya Mahakashaya. Result: in this, Madhuga possesses Madhur Rasa, Prishnapanni possesses Madhura Kadu Rasa, Lodra and Priyangu possess Kashaya Madhura Tikta Rasa. Pada possess Tikta Rasa, Samanga and Gudji possess Tikta Kashaya Rasa, Katfala shows Kashaya Tikta Kadu Rasa, Mojarasa shows Kashaya Rasa, and the Adagi shows Kashaya Kadu Rasa. In case of Vibhaga, Madhuga, Gudji, Prishnapanni and Mojarasa shows Madhura Vibhaga, Pada, Samanga, Dadagi, Lodra, Priyangu and Katfala shows Kadu Vibhaga. In case of Virya, Madhuga, Samanga, Mojarasa, Dadagi, Lodra and Priyangu shows Shida Virya. Gudiji and Prishnapanni, Pada, Katfala shows Ushna Virya. In case of Guna, Madhuga, Gudiji, Priyangu possess Guru Guna. Madhuga and Mojarasa shows Snigdha Guna. Gudiji, Prishnapanni, Pada, Samanga, Mojarasa, Dadagi and Katfala shows Lagu Guna. Prishnapanni shows Saraguna. Pada and Katfala shows Tishna Guna. Samanga, Dadagi, Lodra and Priyangu shows Ruksha Guna. In case of Karma, Madhuga possesses both Vishakna and Vranahara karmas. Guduji, Dadagi and Priyangu shows Vishakna action. Pada, Samanga, Mojarasa, Dadagi shows Vranahara action. Moving to the discussion. In case of Madhuga, because of Madhura Rasa, it possesses Prinana, Shadakshina Sandanagara, Stairihara, Vishahara. Chemical constituents such as glyceric acid, labradine present in Madhuga shows antioxidant and anti-inflammatory properties. The drug provides nourishment and promotes proper blood supply to the ulcer and heals the wound. Because of Shidavirya, it is Pittahara and Raktaprasada. In case of Gudji, bark of Gudji having alkaloids, glycosides, lactones and saponins, they are mainly responsible for wound healing. Due to Guru and Snigdha Guna, it gives nutritive action. Tiktarasa present in the Gudji shows aggravation of prevent the aggravation of Pitta and digest amatoxins. Scraps away the unwanted tissues and dries up the moisture. Gudji will also remove the microbial growth and reduce burning sensation. In case of Prishnaparni, it has antiseptic, antimicrobial, anti-inflammatory and analgesic properties. Because of its laguguna, it effect in healing the ulcer, and the root contain more phosphorus and calcium, so it also useful in fracture healing. In case of Pada, because of Tikta Rasa, it relieves burning sensation, itching and scrapes the unwanted tissues. Various studies have proved its anti-inflammatory, anti-helminthic, antioxidant and anti-hemorrhagic effect of Pada. It contains flavonoid, curatin, shows anti-ulcer properties. In case of Samanga, due to its Tikta Kashaya Rasa and Shida Virya, it balances Kapha Pitta dosha and promotes Vranahara, Sandhaniya and Shobhara action. The leaf of the plant having various bioactive components such as phytosterols, alkaloids and glycosides that can be facilitate healing by increasing the rate and extent of wound closure. In case of Mojrasa is used in pharmaceutical industries for the preparation for medicine used for bleeding disorders. The drug is Shidavirya and Kashaya Rasa, demulcent and hemostatic. It is well used to heal wounds, ulcers, reduce inflammation because of its binding nature. In case of Dadagi, due to Jobana and Shida properties, it helps in quick healing of wound. The phytoconstituent woodfordine present in the Dadagi shows analgesic and anti-inflammatory properties. It also shows anti-ulcer, immunomodulatory, antibacterial properties that are useful in ulcers and infections. In case of Lodra, it is an ancient healing herb. Its stem possesses anti-inflammatory and anti-ulcer properties. Due to its Pitta Shamaka action, it enhances cellular growth and tissue regeneration. In case of Priyango, it is a cool Ayurvedic herb being Shida Virya and Tikta Madhura Rasa. Tikta Kashaya Madhurasa, it is Vata-Pitta Shamaka, Dahahara and Stambhaka. The bark of the Priyangu is highly useful in controlling bleeding from the wounds. In case of Kadphala have analgesic, antimicrobial, anti-ulcer, antioxidant, anti-inflammatory actions, and the bark is very much useful to control bleeding from the fresh wound, thereby helps in proper healing. The Deebana and Amahara properties, it shows the drug better result in healing the wound. Conclusion. The evidence related to Vranarobhaga Dravyas and its actions are well explained in traditional system of medicine. All the drugs mentioned under Sandhaniya Mahakashaya are having either Kadu, Tikta, Kashaya or Madhur Rasa, which are very much essential for the treatment of wounds. At the same time, the Sandhaniya Mahakashaya Dravyas are Amapajaga, Krimihara, Pranahara and Vishahara, showing its ability towards the proper management of wounds. Certain specific phytochemicals, being a bioactive component of the plant, are plays one of the major roles in accelerating wound healing. These are my references. Thank you.
Thank you, Dr. Sheetal Pawar. Thank you for the wonderful presentation. Next, we go to the another paper presentation on the topic management of unexplained female infertility through Ayurvedic treatment, a case study. I would like to invite Dr. Rituja Dhanawade for the paper presentation.
Evening everyone, I am Dr. Rituja Subhash Dhanawade, BMS, MS, Gynec and Oxford, College SSTAC Sangamner. Today I am going to perform a presentation on the topic management of unexplained female infertility through Ayurvedic treatment. So we will see the introduction. Reproduction, it is the biological process which plants and animals are capable of. If there is any disturbance in this cell, it may affect mental and physical health. So the infertility is the inability to conceive within 1 or more years of regular unprotected coitus. So prevalency of the infertility is 10 to 12%. Now we will see about the unexplained infertility. It is seen in those couples who have undergone complete basic infertility workup, and in whom there is no abnormality. So it may correlate with the Vandhatva, which is a Ayurvedic value. Ayurveda has the best solutions for the infertility through purificatory procedures and optimizing the functions of reproductive tissue. So we will see a case report of a patient who is 29 years older, married, nulliparous woman, and her 36 years old husband presented with the complaints of inability to conceive in 10 years of married life, irrespective of unprotected sexual life. She has not conceived. On interaction with the couple, it was found that there were no reasons for not having conception. She has her failed 6 times IUI attempts, IVF failed thrice. The lady's menstrual cycle were regular in the bleeding period was for 4 days. Dysmenorrhea on first 2 days. In coital history, no abnormality were detected. No contraceptive measures was adopted. So we will done the examination of the lady like the Shrit Pariksha, which is Prakriti, Vikriti, Saras, Samhana, Sattva, Satma, Ahashakti, Dyanashakti, Vaya, Praman. General examination of the lady has been done. Also, systemic examination is done. In investigation, the semen analysis of her husband already performed prior to the IUI process. So, routine investigations of that is hematological and biochemical reports were normal. Now we will learn the treatment given to the woman. So, on the 14th of July 2023, she has given the Abhyanga with Dhanvantar Tel, followed by the Vashvatsvedam, Snehapan with the Falagrita, and duration of 14 Vedas. During that, Shamanaushadhi of Gandharva Hastadi Kashai and Shatapushpa Churi is given. Then, after 1 month, that is 17th August of 2023, Mustadi Yapan Basti, Uttar Basti with Palagrita has been given with the Shamanaushadhi, that is Shatapushpa Churna, Gandharva Hastadi Kashai, and Kalyani Kodula. So, then after the treatment, couple was advised to the for conception for the next 3 months. Trial for conception for the next 3 months. So 3 months break was taken for treatment. Then after, on the 7th December of 2023, Anuvasan Basti with the 30 ml Falakruta, 30 ml Kalyanakagrita is given. Vatanpurnasya for 5 days. Abhyanga with the Ksherabala Taila, Shalapindasveda, Falagrita which is given. Then on in the Shamanaushadhi, Brahvachintaboni with gold, Sukumar Grita, Garbhapala Rasa, Darimati Grita, tablet lectinin, and Suvarna Basma is given. Then in result, it is seen that in follow-up consultation, the lady has got pregnant after 4 months, that is 25th of 2024. Her LLP was 13th of June 2024. UPT was positive on the 20th Feb of 2024. She reported feeling great. She underwent normal delivery. So here we will discuss about the detailed treatment principle. So the treatment principle adopted here was the Vatanaloman, Shodhan, Rasayan, Balya, Prusha, Garbhastapan with a psychological assurance. The main treatment course included Shodhan, that is Virechan, Sthanik Chikitsa like Uttar Basti and Pichu, along with the Shamanaushadis. So the Virechana finds its application in Valgat form as it works on the ovum. That is, it does the Dhatu Vishuddhi and increase the potency of ovum. So then next is Vatanuluman was adopted to subside the symptoms like dysmenorrhea. As a Vata is the mainly involved in the Vandhatva and Basti is the Paramaushadha for all Vata disorders. Hence Basti was given and Akagrita is a Balya, Mangalya and is a Shreshta for Punsavam. Hence was used for the Anuvasan Basti. It helped to treat her anxiety too. Falagrita is a Prajavardhan. It primarily targets adaptogenic
rejuvenating, strengthening of the reproductive tissue, anxiolytic and antidepressant properties. Conclusion drawn is that the infertility is becoming a burning issue since past decade. In contemporary medicine, treatment focuses on correcting the dysfunction which are diagnosed based on diagnostic tests. Also, there are various complications due to the treatments like hormonal therapy, ovulation, induction, and some of the diagnostic tests. In Ayurveda, for any case, correct diagnosis based on Roga and Rogi Pariksha. And timely management with a properly advised lifestyle and diet always yields good result. The present study concludes that the holistic approach of Ayurvedic system of medicines gives miraculous effect even in the cases of unexplained infertility. Thank you.
Thank you, Dr. Rituja. Thank you for the well-explained presentation. Next, we go to the another paper presentation. I would like to invite Dr. Mohsin Hakir Gangar for the paper presentation on a case study. Dr. Mohsin Kankar, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir. Myself, Dr. Mohsin Hakim Kankar, Kai Chikitsa PG second year. Can you share my PPT, sir?
Yes, doctor. Just a moment.
Okay.
Start the session, doctor.
Yeah. Thank you, sir. Case study on management of Shit Pitta with Kadiradi Yoga with special reference to chronic urticaria. Next slide. Abstract Shit Pitta is a Vata Pradhan Tridosh Vedi with the involvement of Dusha like Ras and Raktadhatu. It is characterized by Lakshan, Varti Damsta, Samsthana Shota, Kandu, Jwara, Chhardi, Vidaha, Toda for more than 6 weeks. This disease disturbs daily activity of the individuals. In present study, Khadiradi Yoga has given to patient. It contains a Khadirajista and Haridra Khanda. Introduction. In Ayurveda, Shita Pitta mentioned as one of the Tvak Vikara. Shita Pitta composed of the two words Shit and Pitta, which has different meaning. The word Shit indicate Vat and Kapha and their association with a Pitta dosha. Due to impairment of dosha, it leads to Ras and Rakta Dhatu Dushti. It spread externally and internally over the body, causing rashes. Is in today advanced lifestyle, improper and unhealthy food habit has low nutritional value in diet. Next slide, please. Roop of Shit Pitta. Varti Damsta Samsthana Shota, inflammation like insect bite. Kandu Bahula means severe itching. Toda Bahula, Chhardi, Jwara, Vidaha. Next slide, please. Objective to observe the effect of Khadiradi Yoga combination of Khadirarishta, Haridra Khanda internally in the management of Shita Pitta. Next slide, please. Method. A 23-year-old male patient presented with a complaint of severe itching all over the body since 3 years. Used several allopathic medication previously, but did not get relief completely. Severe itching and reddish discoloration and severe headache during the episode. In present study, we have given a Khadiradi Yoga, Haridra Khanda and Khadirajista for 3 months. On examination, height of the patient is 5 feet 10 inch. Weight of patient is 84 kg. Blood pressure 120/70 mm of Hg, and pulse is 75 per minute, and respiratory rate is 80 breath per minute. Neck, cardiovascular system, pulmonary, abdomen, and lymphatic and extremity examination are normal. Skin examination reveals multiple macular erythematous lesion on the arm, leg, abdomen, and chest. The individual lesion and basically round, ranging from 5 to 25 mm in diameter. Result after giving the Khadiradi yog, fever absent, headache absent, severe itching absent, multiple macular erythematous lesion size 30 mm absent. Discussion in present study, Khadiradi yog has been given to the patient. It contains a Khadir register and Haridra Khanda. Khadira is a base fight to against the Kushta, Vata, Kapha, and having a Krumigna and the Drugna property. Haridra has antibacterial, antimicrobial, Vata, Kapha, Hara, and Varna property. Haridra Khanda is a drug of choice in Shit Pitta, is mentioned in Bhaishajya Ratnavali due to its Katu Tikta Rasa. It clarify Agnimandya. So Jataragni increase which causes Dhatvagni. Thus, Dushti of Ras and Rakta Dhatu is specified. Conclusion: chronic urticaria, Shita Pitta seriously compromise the uh, quality of life of the patient due to its debilitating symptoms that can last for 4 year. In this study, major impair was observed in patient with the highest severity. An evaluation of the quality of life is fundamental to better assess disease progression and treatment efficacy. Shit Pitta is a Vata Kapha dominant disease having a symptoms same as a Kushta. In this present study, Khadiradi Yog contain a Vata Kapha Hara and Kushta Hara property. By using a medicine, patient got 95% relief. Thank you so much.
Thank you, Dr. Mohsin. Thank you for the presentation. Ayurveda addresses alcoholism as Madatya, highlighting its impact on the mind and body. Next presentation is alcoholism and Ayurvedic approach. I would like to invite Dr. Sheetal Raj for the presentation.
Am I audible?
Yes, Doctor, audible. Good evening, Doctor.
Good evening. Myself, Dr. Sheetal Raj, Associate Professor from the Department of Agada Tantra, Enapoy Ayurveda Medical College and Hospital, presenting before you alcoholism and Ayurvedic approach. Can you please share the slide?
Okay, Doctor, just a moment.
Moving on to the introduction. Drug abuse. These are the contents of my presentation. Drug abuse is a patterned use of a drug wherein a person needs a drug in order to function normally and is often accompanied by increased tolerance and symptoms of withdrawal when the drug is no longer present. It is a gateway to addiction and impacts many parts of a person's life. Repeated use of substances results in physical brain changes leading to impaired learning, decision-making, memory, and judgment. Drug abuse is known to cause depression or suicide and affects relationship with family and friends. Legal problems and financial woes are also common issues that result from addiction. Alcohol addiction is arguably among the most common. It manifests in the form of alcohol dependency, binge drinking, or regular heavy drinking. Alcohol addiction often starts with the social drinking and then progresses further and further until one finds him or herself dealing with an unbreakable addiction. In Ayurveda, the properties, dose, and uses of alcohol, signs and symptoms, and adverse effects of excessive intake of alcohol, as well as the management of alcoholism, are elaborated in the context of Madatya. There are several Ayurvedic treatment protocols that is effectively used in the treatment of alcoholism. This paper aims at an attempt to present the harmful effect of drug abuse and a review on the clinical case presentation on Madatiya. Slide on alcoholism. Please change the slide. Alcoholism, the definition is alcohol is an inebriant poison. The toxicity of alcohol depends on the number and position of hydroxyl group and the alkyl group. There are mainly classified into monohydroxy alcohol and polyhydroxy alcohol. And ethyl alcohol is the most commonly used alcohol, and this can result in both acute and chronic alcoholism. The symptoms of methyl alcohol is almost similar to ethyl alcohol, and ocular toxicity is a significant feature of methyl alcohol. Next slide, please. Mada is a yoni samskara namadye visheshe bahutachaya bhutva bhavatyega vida samanyan mada lakshanata. That which is having different varieties on the basis of source, method of preparation, name, etc., and has the unique feature of producing intoxication is known as Mada. And Madatiya Avastha, next slide please. Madatiya Avastha includes Pradama, Dvidiya and Tridiya. Pradama, where Ojas is not stimulated, Dvidiya, where Ojas is mildly affected, and Tridiya, where Ojas is completely affected. And Madatiya can be classified into Vadaja, Pittaja, Kapaja, and Sannibadaja Madatiya. And in each of these, the patient will be having Ahara, Vihara, and Madhya that can aggravate that particular dosha. Vadaja Madatiya can cause symptoms like Hikka, Shwasa, Shiru, Rija, Nidra, Nasha, etc. Pittaja Madatiya causes Trishna, Daha, Jwara, Adisara, and Kapaja Madatiya causes Prasega, Aruji, Chardi, Gurutva, etc. Sannibadaja Madatiya, there is an aggravation of all the three doshas. And just like Visha, at times Madhya causes disease and at times it results in death. Moving on to Madatiya Chikitsa. Madhya in Madatiya. When a person consumes Madhya, which is Tishna, Ushna, Amla, and Vidahi, then the Annarasa becomes Utleda and Vidagda, which ultimately becomes a Kshara in nature. This produces Andardaha, Jwara, Trishna, Mucha, etc. To correct this ailment, Madhya is given so that the Kshara gets mixed up with the Madhya, which is the best Amla Dravya, and Madhura Rasa is produced. Shira in Madatiya, when a patient gives a Madhyapana by Upavasa, Pajana, and Dosha Shodhana, Kabha will be in Shina Avastha and the patient suffers from weakness and lightness. So in such a patient who is weak by Madhya and in whom Vada and Pitta are aggravated, Shira will act as Sida. Next is Harshana Kriya in Madatiya. Madatiya can cause Manasika Vigaras apart from Sharirika Vikaras. Madatiya cause derangement of mind, and this can be corrected by the following, like good food and drinks, a good companion, music, jokes and talks, entertaining party. Snehapana, Shodhana, Bhakti, Nasya, Shirodhara, Rasayana Drivyas can also be considered here. And this is the treatment of Madatiya as per the doshic predominance. Moving on to the case presentation. The first one is Nagabhushanam. Next slide, please. Nagabhushanam 2005-12. And this study was on the next slide, please. Yes, case 1. The study was on the efficacy of Karjurati Manda and Ashtanga Lavanayukta Tikta Takra in the management of Madatiya with special reference to alcohol withdrawal. Thirty patients divided into 3 equal groups. Ashtanga Lavana, 6 gram with 500 ml of Takra is given twice a day for the first group. And Karjurati Manda 100 ml for the second group at 6 a.m. and 9 p.m. And a combination of these 2 drugs for the third group twice daily with 1 hour gap in between the medications for a period of 15 days. On comparison between the groups, the combination of Karjurati Manda and Ashtanga Lavanayukta Takra was more effective than the other 2 groups. The next case is on case number 2, that is Anand B in the year 2006. In this clinical study, the efficacy of Shrikandasava 25 ml twice daily and Jyotishmati Taila 10 drops with milk in the management of Madatiya with special reference to withdrawal state was evaluated and compared. 30 subjects were selected and treated for the duration of 14 days. It was observed that in the symptoms such as anxiety and agitation, Jyotishmati Tailam was found to be more effective, and in symptoms such as sweating, tactile hallucination, auditory hallucination, and visual hallucination, the control drug, that is Srikandasavam, was more effective than treatment group. In symptoms like nausea, tremor, and the headache, both the groups were found to be effective in an almost equivalent manner. Next case is case number 3, Vinod K. The study was to assess the efficacy of an Ayurvedic treatment package in alcohol dependence. 20 subjects with alcohol dependence were selected and randomized into 2 groups. The study group subjects received on intervention with Ayurveda treatment package for 15 days, which included Deepana Bhajana, Snehapana with the Datriyadi Girda, Abhyanga and Virejana with Avipatti, Abhyanga and Virejana with Avipatti Churna. And control group subjects were given Pippali, Shirapaga, 100 ml BD after food for a period of 1 month, as done in the previous study. And it was observed that after the treatment, as well as the follow-up, in both circumstances, the trial group was found to be more effective. Case number 4 is on Muhammad Shafiq M. In the year 2014, study was to compare the effect of Marsha Nasya, that is high-dose Nasya in alcohol withdrawal syndrome, with the ongoing modern conservative management. 20 participants in each group who were diagnosed as alcohol withdrawal syndrome received a Marsha Nasya with the Shirabala Thaila, dose 1 ml to 3 ml, and the other 20 participants were managed with the modern conservative management as per modern psychiatrists from a de-addiction center. The duration was up to 7 days. It was observed that the symptoms such as nausea and vomiting, tremor, paroxysmal sweating, anxiety, agitation, auditory hallucination, headache, etc. Both the trial and control group found to be effective and statistically significant. Next, moving on to the discussion and conclusion. In the initial stages of alcoholism, the body can repair itself, but chronic alcoholism has deleterious effect on life. A holistic approach in alcoholism has shown promising results, and Ayurveda has various treatment protocols, even including Deva Vyapasya and Sattva-Vajaya Chikitsa, which is very beneficial. This is all I have to share with you. Thank you.
Thank you, Doctor. Thank you for the wonderful presentation.
I have a poster presentation too.
Okay, Doctor. Next, we'll go to the poster presentation.
Yes, yes.
On the topic, an insight into classical treatment principles of Alarka Visha. I will share the screen, Doctor. Just a moment.
Yes.
Please start the session, Doctor.
Continuing with my poster presentation titled An Insight into the Classical Treatment Principles of Alarka Visha. Dog bites incidents classified as Alarka Visha are observed globally. While dog bites frequently occur, they seldom result in fatalities. Currently, modern medicine primarily offers a prophylactic treatment or immunization against Alarka Visha. Ayurveda, however, provides insights into the treatment, signs and symptoms associated with this condition. This study aims to explore the concept of Alarka Visha with a particular focus on Shushuddha Samhita Kalpasthana. The aggravated Vadadi dosha will vitiate Kava dosha, and this will affect the Sajnavaha Shodhas and destroys the Sajna and greatly vitiate the Dhatu. And the Damsha Lakshana includes Damshastena Vidashtasya, Supta Krishna Sharatyasrip, Hudchiro Ripjara Stamba, Krishna Muchudbhavo Anuja. And the Asadhya Lakshana is that if the person who is bitten or affected by Alarka shows the cheshta and the shabda of animals from which the person got bite, and also if the bitten person see that particular animal in the mirror or water, then he dies. Jalasandrasa is Jalas Darshana Samspashana Shabdipyo Escha Sandrasir Adashta Maditam Jahyad Jalasandrasa Dogina. This is a condition wherein, even though the person is not bitten by the dog, if he is suffering from the sight and sound of water, if he is frightened by the sight and sound of water, it is called Jalasandrasa. Moving on to the Chikitsa, Damsham to Alarka Dashtasya, Daktamushnena Sarpisha, Pradihya Dagadi Staitai, Puranam Jagradam Pipet. Here, the first line of treatment is Agni Karma, and Agni Karma is done with the Ushna Sarpi, and followed by application of Agada, and that is Lepa, and oral intake of old ghee, Purana Grada. And here, Virejana is suggested with the Arka Kshira. So, this explains basic principle that Tasmat Damsha Visham Maulam, Handi Maulam to Damshajam. In case of Savara Visha, Jangama Visha, and in case of Jangama Visha, Savara Visha can act as an antidote. And other yogas like Vilwadi Gulika, Angola Uttramula Kashaya, Sharapunkadi Apupa, and Palala Dailadi Prayoga are indicated in Alarka Visha. The bath given in Alarka Visha is very important, and which is called Alarka Damshe Samandra Ushadi Snepanam. The patient should be admitted to a Shishira and Jalarehida Graha. When the Lakshana subsides, he should be given bath. On the second day, Shashtikeshali and hot milk is given, and on the third day and on the fifth day, half of apupa should be given again. And the alarka visha, before getting aggravated, should be aggravated this way. The patient should be given bath with the sanctified water in a junction of 4 rod or in the bank of a river, and a belly should be given with the pinyaga, mala, dedi, and the different kinds of mamsa. And the mantra starting with the Om Alarkadipada is chanted, followed by Virejana. And here Virejana is done to eliminate the remaining dosha or visha which is existing in the body. Conducting additional research on this topic will undoubtedly pave the way for the development of an innovative treatment approach for alarka visha. This is all I have to share with you. Thank you.
Thank you, Doctor. Thank you for sharing your knowledge and expertise with us. It was a remarkable and contribution to this seminar. Thank you so much, Doctor.
Thank you, sir.
Next is an interesting topic, Abhava Pradivya or substitute drug. I would like to invite Dr. Kannamal Chandravadan Jadhav for the paper presentation.
Hello, good evening, everyone. Myself, Dr. Sangeetha Kannan. I am PG College student of Pranava. Today, I am presenting the topic which is very important for Ayurveda practitioners and students who learn Ayurveda. The title of my topic is about the Kshara. Let's start with introduction. Ayurveda is one of the oldest traditional systems of Indian medicine. In 20th and 21st century, extinction of important medicinal plants was increased drastically because of the synthetic medicine side effects. That's why the herbal therapeutic was improved. In 15th and 16th century, the concept of Abhavati was introduced by Bhattaka, Yogaratnakar, and by Siddharth family. Ayurvedic Samitas like Charak and Tishur not mention the concept of fertility travel. Abhav travel means unavailable health, and the fertility travel means to substitute health. Abhava fertility travel means the health is replaced with another one with similar properties and their action. Fertility travel means of similarity of a property, that is, Rasa, Punya, Urea, Vita. But most important was action. Need for substitution. First, non-availability of original drug. Second, some herbs or the substance may become unavailable due to seasonal or geographical constraints. Third, exposure or endangered status of certain species. Fourth, regional unavailability. Sixth, tax effectiveness. Some original ingredients such as sugar or clear animal-derived solids may be so originally expensive. Substitute help to reduce the cost without compromising efficacy, making treatment accessible. Sixth, ethical and environmental concerns for rare or animal-derived ingredients, example filades, pearl, or nuts. Substitute help to reduce the ecological harm and adhere to ethical considerations. 7. Patient-specific requirements. Certain patients may have allergies, sensitivities, or dietary restrictions, for example, avoiding animal products or the specific plant. Types of substitution. Substitutions with totally different drugs. Example, citrus as a substitute of tomato. Substitution of two different species. Example, medicine. Substitution of species belonging to same family, example Datura metal and Datura samonium. Substitution of different parts of the plant. Example, Sirakaji Puliaru and the whole plant. Interest and substitute. First, Bhallatak, citrus, substitute with Dharati, Vakilisham, substitute with Mukta, Haritati, substitute with Amalati, Sagar, substitute with Krishna, Nilopan, substitute with Sina, Raktakandam, substitute with Uchi, Savya, substitute with Sita, Vastavarga, substitute with Jiva and Visabha, substitute with Vidarbanda, Meda and Mahameda, substitute with Satvaya, Haridhi and Nasi, substitute with Vidarbanda, I'm sorry, Varahikanda, Rakun and Shukramati, substitute with Visvadanda. Factors to be considered for selection of substitutes. First, similarity in rectum, that is say, example, Haridra and Daru Haridra both have a bitter and sentence meaning. Second, pharmacological substitution or the Geotetran Pratyodi Tavya. Example, insulin and sodium due to their similar effect on digestion. Third, regional substitution, that is Geotetran Pratyodi Tavya. Example, Rasana Rajnimantan with a locally available ingredient. Fourth, therapeutic substitution, that is Parmesan secondary dosage, example, cases, Nagapika, for its cooling and aromatic properties. Fifth, seasonal substitution, that is Salapradhan secondary drug. Example, fresh herbs like brahmi and dried formulation or the similar herbs like the Hindustan. Sixth, those the balancing properties of substitution, Vata, Pitta, Stone, Simple Bala, and Bala both balance the Vata. Formulation based substitution, Yogya Pratiniti Dravya, example, formulation like Savanta, alternative like Nanda, can be replaced by other sources which are influenced. Eight, economical substitution, or fertility drug. Example, Motilbhasma, self-absorption, for cost efficiency. So, ethical substitution, that is dynamic preventive process. Example, mud is replaced with water, or the synthetic mud. 9. Emergency substitution or apatkaline fertility treatment. Example, Gurukhi may replace other units for sterility with sugar. Advantages. Help a physician to prepare medication in time to fulfill the demand of consumer. Help when seasonal and geographical changes affect the drug availability. Flexibility in formulation. Substitutes provide Ayurvedic practitioners with options to modify formulation without deviating from the principle of treatment. Continuity of treatment in emergency or the cases where immediate treatment is necessary, substitutes prevent delay in providing remedy. Disadvantages. Commercial purpose can adapt the shortcut by means of a technology transfer. Conclusion. The Pratiniti Drama quickly ensured that treatment remains effective, accessible, and adaptable to modern challenges such as scarcity, cost, and ecological sustainability. It reflects the dynamics and the pragmatic approach of Europe, balancing tradition with practical needs. The use of Pratiniti Drama showcases Ayurveda's adaptability to modern challenges such as resource scarcity, environmental conservation, and global health needs by combining traditional medicine with practical solutions. It ensures that the timeless principle of Ayurveda remains relevant and effective in today's world. Thank you.
Thank you, Dr. Kannan Jadhav. Thank you for the well-explained presentation. Jayabala, known for its anti-inflammatory and skin-lightening properties, is a key Ayurvedic ingredient in managing Venga, melasma. The next presentation topic is Jayabala, the role in managing Venga. I would like to invite Dr. Chetana Vijay Suryavamshi for the paper presentation.
Good evening to all. I am Dr. Chetna Vijay Suryavanshi, PG second year student, Dravyakun Vignan Department. My college name is Loknete Rajaram Bapu Patil Ayurvedic Medical College, Islampur, Sangli. Today, I am here to present paper on Zyphod or nutmeg role in managing younger melasma, Ayurvedic insight. Introduction. As we all know, Ayurveda is an ancient science, also a complete guide to healthy living. Main goal of Ayurveda is prevention and cure. Skin plays important role in beauty and personality of individual. Melasma is a skin condition that causes patches, spots, and usually on the face. Vyanga and Mukha are one of the Kshudra Rogas. Vyanga is characterized by Niruj, Shavarna mandals occurring especially on face. Many Acharya explain Vyanga like Sushrut, Vagbhar, Bhavprakash, Madhav, Nida. According to Acharya, it caused by anger or exertion. And pitta dosh elevated and causes painless small size brownish black patches on face. Acharya Bhav Mishra mentioned Zati fir, Myristica fragrance, remedy for its action on Vyanga. Using Zyphod nutmeg in Vyanga melasma is cost effective, easily available with these side effects. Need of study Vyanga or melasma many times looks ugly and weird due to darkness of skin. So, one can lose their confidence and also cause mental side effects. Modern science recommends laser therapy, various types of steroids for treating melasma. Laser therapy is very expensive, but when the management of melasma has been done through Ayurveda, it will be cost effective and easily available with the least side effects. So, for self pleasure and better living of human being, remedy on Vyanga or melasma should be studied through Ayurvedic insight and scientific perspective. So, Vyanga, melasma. Vyanga, it is one of the Kshudra Rog characterized by the presence of Niruj or painless Shavarna mandals, bluish black patches on face. Vyanga caused due to the anger, exertion, and because of that, Vata and Pitta, both those get elevated, causes painless, small size brownish black patch on face. Nidan, excess heat exposure, stress, improper diet, etc. Melasma, it is the pigmentation disorder, a condition in which brown patches appears on the face, also light brown, dark brown, blue-gray patch on skin. They can appear as a flat patches, prickle like spots, causes UV exposure, hormonal imbalance, and genetics. Zyphod, nutmeg. जाति फलस्य लेपस्तु हरे व्यंगस्य निरिका. भाव प्रकाश शूद्र रोगाधिकार 42. Sanskrit name of Zyphod is Zatifal. Latin name Myristica fragrans out. Family Myristicaceae. Part used is Fuller. Guna, Lagu, Tikshna, Tikta Katu Rasa, and Vipak Katu Virya is Ushna. So, composition in Zyphod, it contains fixed oil, volatile oil, starch, cellulose, pentasense, resin, mineral elements. Active constituents are myristicin, elemicin, eugenol. Ripe seeds contain 5 to 15% of volatile oil and 25 to 40% fixed oil. Fixed oils contain lipids are the main fixed oils. Myristica fragrance, for example, myristicin, petroselin, palmitic acid. Myristic acid constitutes 74.9% of the total lipid content of nutmeg. Volatile oil, eugenol, isoeugenol.
Then action, anti-inflammatory, antioxidant, antimicrobial, depigmenting agent, carminative, analgesic, diuretic, antipyretic, hypolipidemic, anti-ulcerogenic, hypnotic, hallucinogenic, antispasmodic, and as an stimulant agent, enhance the blood circulation. Effects of nutmeg on the skin reduces the melanin production, promote skin rejuvenation, lightens the hyperpigmentation. Then the mode of action of Zyphor according to Ayurveda. The Tiktaras of Zatifol causes Pitta Shamak, which is vitiated due to the intake of the Pittahar dravyas. Disease Vyanga is considered the disease of disturbed Rajak Pitta. Rasa Rakta Vahastroto Dushti, Vat and Pitta Prakop, also involving cough, which obstruct the Rasa Vahastrotas, leading to the Shavatva of the skin by causing the Prokopic Bhrajak Pitta to be deposited below the skin layers that is in epidermis. Tikta Ras Ushnavirya of Zatifal mitigates Vata dosh and at the same time it stimulates the Bhrajak Pitta and help in scrapping of the rough, thick, black, dark layer formed on the skin. The Laghu Gun, Tikshna Gun and Ushna Gun properties along with the Katuras clears the channels helping the healthy Bhrajak Pitta and opens the free movement of Bhrajak Pitta on the skin. Bhrajak Pitta is responsible for Varna, Chaya and Prabha. External application. Acharya Bhav Mishra mentions the jati for myristica fragrance, remedy for its action on Vyanga. Classic says that the fine powder of this drug, made into paste using water and applied over the Mukha Pradesh, relieves the Vyanga. Mode of action according to the chemical composition, myristicin and meslignan. Myristicin, it is present in Zatifol, is known to be useful in reducing the production of the melanin secretion in the skin. It also has antioxidant properties which act on the free radical. Nutmeg has potent melanin biosynthesis inhibitory action. Meslignan, it is a bioactive ingredient found in nutmeg mess. It is a constituent of nutmeg, has an hypopigmentary effect and related melanogenic activity. Meslignan is a useful inhibitor of melanogenesis and beneficial in the treatment of the hyperpigmentation of melasma. Here, mode of action according to the chemical composition, then pharmacological properties of xyphor nutmeg. Depigmenting agent. Nutmeg reduces melanin synthesis through its inhibitory effect on tyrosinase, an enzyme essential for melanin production. This property makes it effective in lightening the hyperpigmented areas like melasma. Anti-aging, nutmeg improves the skin elasticity, reduces the wrinkles by stimulating the collagen synthesis. Its antioxidant and anti-inflammatory properties helps the delayed the signs of aging, exfoliates the skin. Nutmeg is also a natural exfoliant, which means it helps to remove the dead skin cells, improve the skin texture, and promote the skin renewal. Mood enhancer. Nutmeg has a mood enhancing properties due to its impact on serotonin production. It indirectly benefits the skin by reducing the stress-induced conditions such as melasma. Then, comparison with modern treatments. As we all know, modern treatment, hydroquinone, retinoids, laser therapy, and chemical pills. Ayurvedic benefits are cost-effective, no side effects, long-term improvement. Conclusion, Zyphor offers a natural, holistic, effective solution for managing the Vyanga. Combines external and internal treatment in the Ayurvedic principles. Promotes skin health without adverse effects. Here are some references. Thank you so much.
Thank you, Dr. Chetanalji. Thank you for the wonderful presentation. Next, we go to the another paper presentation. I would like to invite Dr. Snehal Bhalchandra Vibhude for the paper presentation.
Good evening to respected judges here. Myself, Vaidya Sneha Rajendra Vibhute from Lamaniko Rajaram Patil College, Islampur, Maharashtra. I am a second year PG student in Behavioral Department. My title is Vaidya Sir and head of the department is Vaidya Prasanna Garu sir. Today my topic for paper presentation is Ayurveda and Cardiovascular Comparative Study. So let's start with it. As Ayurveda, the ancient science of healing, embodies holistic health management through various formulations with passive and abstract key preparation. These formulations are traditional fermented decoctions that enhance the bioavailability of the herb while improving the therapeutic potency. Among these, Abhirishta is for medicinal purpose. Sarigadiaso, on the other hand, is traditionally used for managing liver disorders. Relevance of comparative study. What is the relevance? Comparative evaluation of Abhirishta and Sarivati also holds clinical and research importance, like pharmacological insights, formulation and preparation, therapeutic versatility, contemporary application. What are the objectives from this presentation? My objective is to aim, analyze, and compare the formulation, preparation methods, pharmacological properties, and therapeutic application of Abhirishta and Sarivati. By doing so, it seeks to highlight their unique roles and overlooking the benefits, thereby enhancing our understanding of their use in clinical practice and advancing Ayurvedic pharmaceutical research. First, let's start with the Abhirishta. Abhirishta is from Charak Chikitsa 14 Arsha Chikitsa. The list of the Devdravya from Abhirishta is enlisted here. The main ingredients of the Abhirishta is Haritiki, which is Kashar Pradam Kocharas, Madhu Vipak, Ushna Virya, and Laghu Ruksha Guni. It is Tridoshakna and Vishishta Karma of Haritiki is Dipan Pachan, Vibhuntanun, Anuluman, and Rasai. The main indication of Abhirishta is Arsh, and other indications are Gudaj Rog, Grahani, Pandu, Rudrog, Pliha, Gulma, Udar, Pushta, Hope, Shok, Aruchi, Rumi, Grahi, Arbud, Vyanga, Rajakshma, and Jol. Among these ingredients of Abhirishta, Haritiki, Amitki, and Intervaruni are Shodhan Prabhav. Thus, Rukshan, Shaman of Kapha Pitta Dosh. Abhirishta is of Pachan Kalpa, Shodhan, Shrotamimurtanashan, and Anunuman Kalpa. It does the Dhatu Agnivartanakar and does the Bhuvan of Sushma Karma. Let's see the use of Abhirishta in Vedis. In Arsha, it is used as a Shushka Arsha, thus Racham Prabhav, Universal Karya, and Srotam Agnivartanashan. For in Arsha, in Grahani, it is work on the Kapaj Grahani. Works in mainly Stiglatava Atisevan Janya Grahani Dosh and does the deeper Karya. As Stiglatava, it is does the Rukshan Karya in the Grahani. In Pandu, it works on the Kapaj Pandu, thus Rukshan Chikitsa. Thus Rukshan Chikitsa, Balavarna Agnivarthan, and reduce the Dhatu Shaitanya or in Panduvati. Rudra, Amlagunab Dravya is Rudre from Abhirishta, thus Shoto Abhutanasham, thus Vatalamal. And Udavarta Janya Rudrok, it can be used. Kushta Vyanga, it does works on the proper Ratana and Apti. Kapaj Kushta, it is used. Thus the Shodhan of Dina Dosha, which are in the Kushta, and reduces Shaitilya. And the Varna Prasadan is Karma is given on the Abhirishta. If again in Vatraktan Veda Survat, Arishta Kalpana is said to be for Chikisa for Vatraktan Veda Survat. Use and Takra and Abhirishta given. So we can use the Abhirishta as it does the Veda Nashan. Other one is the Sarivadi also. Let's start with this. Sarivadi is of Bhaishyaja Ratnavali reference Pramay Vedakadika. Again, the Dravya is enlisted from the Sarivadi also. Main ingredient is Sariva, Madhurus, Sheet Virya, Vipak Madhuri. Guru has like the good. Main indication of Pramay Vedaka. Other indication of Pramaya, Vatrakta, Bhagavan, Ubdash. Sarivadi also whose main ingredient is Sariva is Tridosh Nashak, and Pachan, Shukrupa, and Mutra. This Kalpu, the Shaman of Raktadosh, reduces Raktasrav due to its Kashai, Gun Pradhan Dravya. It is a Raktasodar due to Kutki, works on the Vyapurut and Kihan. This Kalp works in Rakta Veda Dushin Pradhan, Samprapti. It works on the Pramaya and works as Chitta Kapugna, Lady Samprapti. Works as a Putra, acts on the maiden. Aam Pachan, Rasayan Karma. Pramay Pidika, does Rakta Prasadan, Aam Vishnasan, and does the Samsatkari. Sarivati also does the patient paper, Shodhan, and Ropan Karma. So we can use it also in cellulitis, abscess, and currency.
In Vatarakta, it works on Vatarakta and Name. Vatarakta Uddhava Chikitsa, Bhedan Shodhan Ropan Chikitsa is given by Acharya Charak. So we can use the Bharivadi as well here. In Uddhava Shvadi, it is Shitvirya, Vranaropak Shodhar, Krumihar, Ampachal, Rakta Shodhak, works on Rakta Mouse Dhatu, and works in Mrita Mutra Kuchhavadi as well. So let's compare the both Abhyarishta Sarivadyasu. First is Rasa Viryapa. Abhyarishta Rasa Viryapa means Kasharas Ushna Virya Praturupa. Sarivadyasu Kasharas Sich Virya Praturupa. Those Vaganinaman Pitpavardhan Kapunashan. And Sarivadyasu Pikkashama. Dhatu or works on Rasa Rakta Mouse Fluid. It works on Rasa Rakta Mouse made Shukra. It works on Malashakri. And it works on Mutra and Sway. Udar, Amashe, Tapashe, Gudwali. And in Sarivadyasu, it works on Yakrut, Sliha, Tvacha, Yurukka, Buddha, Yoni, Garbhasha. Strotas, Adna, Rasa, Mouse, Raktava, Purisha. And for Sarivadyasu, it works on Rasa, Rakta, Mouse, Peta, Shukra, Artho, Mudra, Swe. In Samavasta, we can use Abhyarishta. For Samnira, we can both we can use the Sarivadyasu. This for Agnivardhani is Abhyarishta. Samanya works does on the Agni by Sarivadyasu. विशेष गुण आज अभ्यारिष्ट अनुलोमक शोधन लेखन वेतन पाचन कार्यवाद्याचे सोमपुत्र रक्तशोधक त्वच वर्ण्य विश्नाशक श्रोतरोध विभक्त पुरुष क्लेश अग्नि संप्राप्ति we can use अभ्यारिष्ट for रक्त दृष्टि पित्त क्लेश संप्राप्ति we can use सारिवदास. So what is the conclusion behind this comparative study? That Abhyarishta and Sarivadyasu can use both in the kaphopetic vikar, but with given by mixing together. Abhyarishta is more suitable for digestive disorder, while Sarivadyasu is ideal for skin and urinary problems. Both formulation works through distinct mechanisms, supporting Ayurvedic principle and personal medicine. Their combination may also be synergetic in treating complex conditions involving digestive skin or urinary issues. Other one are references given from the Charak Surya and Kshara examination. Thank you.
Thank you, Dr. Snehal Vibhude. Thank you for the well-explained presentation. Next is a medicinal plant review, Gambhari, Melina arborea. I would like to invite Dr. Poonam Navnath Pawar for the paper presentation.
Hello everyone, myself Dr. Poonam Namath. I'm from LRP Ayurvedic Medical College, Islampur, and I'm third year student, Guna. First of all, I would love to thank all members for giving me a chance to present this paper. And sorry for due to some network issue, I cannot connect virtually. My topic name is Medicinal Plant Review, Gambhari. Extract.
Ayurveda is a science of life practiced by ancient medicine, which is based on Atharvaveda, one of the oldest scriptures of Hindus. The objective of Ayurveda is to contract the imbalance of three very essential elements, Vata, Pitta, Kapha, which constitute the three doshas from which the body originates. It is the three doshas which regulates the normal working of human body. In this modern era, there is a need to evaluate the efficacy of crude drug, herbal drug, in justifying their acceptability in modern system of medicine. In regards with the evaluation of standardization of drug, different techniques like morphological, microscopical, physical, chemical, and biological evaluation is involved. Gambhari is a well-known drug mentioned in Ayurveda used for various by Acharya Charaka, Acharya Sushruta, Acharya Bhagavad, and most of the used in Ayurveda. Literature also some Nighindus has specifically mentioned uses of parts of Gambhari. Introduction. Gambhara Melina arborea, commonly known as dinner tree, Chandrahar tree, is a small to medium tree belonging to family Verbenaceae. Literature review. Literature review Gambhari was done from Vedas up to recent work to obtain true knowledge about Gambhari. Vedic period. In ancient medicine, literature like Vedas, the synonyms of Gambhari like Rohini, Kashmiri, and Shriparni, etc. has been described. In Charak Samhita, it is mentioned in Shultakara Varga, Dahaprashamana Varga, Virachana Pagvarga, Palavarga, and Madhurastanga, and used in Chavanprash as a Kwathidravya. As a content of Madhukadi Kashai in fever, as a Praktha Shak in Raktapitta. As a Kashmirati Grita in Kasa, in Dashamulati Grita as a Vatanashaka, and as a Virachana Karaka Yoga. In Sushruta Samhita, Gambhari is mentioned in Sarivati Varga, Dashamula, Palavarga, Madhuragana, and Brihata Panchama, and used in fever as a content of Drakshadi Kwar in Murch along with Kharju and Chirunji. In Ashtamuda, it is mentioned in Brihata Panchama, Madhuragana, Sarivati Varga used for fever as a content of Sarva Jwara Nashaka Yoga. In heart disease as a content of Shvagashpadi Grita, for fever as a Kashmirati Grita. Nigantu. Bharat Prakash Nigantu has mentioned Gambhari in Guruchadi Varga. Priya Nigantu has mentioned Gambhari in Haritikadi Varga. Dhanvantari Nigantu has mentioned Gambhari in Guruchadi Prathama Varga. Raja Nigantu has mentioned Gambhari in Pravagrani Varga. Prayojanga Rajanigantu also mentioned that Prayojanga like Twaka, Patra, Phala, Phalamajja, Matra, Phalaswarasa, 10 to 12, 20 grammars mentioned. Sahyadam Nigantu has mentioned Gambhari in Aushadhi Varga. Also synonyms are mentioned. Shaligram Nigantu has mentioned Gambhari in Guruchadi Varga. Synonyms. Gambhari. It means it produces plenty of water. Kashmiri. It is famous because of good quality. Pita Rohini. It produces yellow fever. Madhuparni. It leaves as sweet as honey. Vernacular names. Latin name Melina arboreali. English for tea bushwood. Hindi Gambhar, Kakaguri, Sevad. Marathi Shivana, Kashmiri. Rasa Pitta Kashaya Madhura, Virya Ushna, Vipakatu, Guna Guru. Familial Verbenaceae, genus Melina, species Aruria. Distribution. An iron tree 60 feet high with a cleared board of 20 to 30 feet and a girth of 5 to 7 feet found scattered in a deciduous forest throughout the greater part of India and Andaman at full altitude of 500 feet. Woodland grows in the hill areas of the Himalayas, Nilgiri, and also on the eastern and western coast of India. In India, it occurs extensively from the Ravi eastwards in the sub-Himalayas tract common throughout some and adjoining area of north and west Bengal. Also in southern India and planted elsewhere on a large scale, also found in West Bengal forest in mixed forest. Botanical description, microscopic language, nearly cylindrical with uneven surface, grayish brown brittle, steel, exploiting with thin plaques, whitish gray, leaf opposite broadly ovate, folded, glandular, glabrous above and maxillary. Fruit was tomentose beneath, sometimes pinnately or palmly compound 10 to 15 centimeter long, 5 to 80 centimeter long. Color dark green, taste sweet, odor sweetish, flower beautiful brownish yellow in terminal panicles. Fruit fleshy, royal, juice, orange yellow, when arrival. Microscopic characters. Transverse section of leaves show 8 to 6 layer of cap, thick arranged in congenial direction in broken places towards thicker layers. Fruit. Microscopically, fruit shows pericarp differentiated into single-layered pericarp, multi-layered mesocarp, and endocarp. Leaf. Microscopically, leaves show fragments of transferred cut cord cells and in surface isolated groups of stone cells and shapes and thickness. Flowers. Completely bisexual, bracted, burning in cells. Here, Gandhari picture, whole plant, leaf, flower, fruits, and seed. Medicinal uses, classical. Bahya burning and pain. Because of cooling and soothing actions, the leaves release burning and pain. In such cases, leaves are tied to the affected fever-induced headache. Paste of leaves is applied over the forehead in case of forehead caused by fever. Gout. Pulverized root is applied locally for gout. Central nervous system. It is used in vertigo, brain debility, and water disorders. It is also a brain tonic. Digestive system. Fruit relieves excess thirst, fruit period, improves appetite and digestion. So used in diarrhea, constipation, and hemorrhoids. Circulatory system. The bark of fruit is used internally in edema due to any cause as it relieves edema. Though the ripe fruit is carbonic, its juice is useful in cardiac disorders. The mixture of roots of gandhari plus gunja leaves plus yashti madhu plus sugar with milk is a good galactobacc. Respiratory system. A ripe fruit is a nutritive tonic so useful in tuberculosis and cachexia. Urinary system. Fruit and leaves are diuretic. The juice is given in dysuria, gonorrhea, and cystitis. Reproductive system. Besides being galactobacc, the fruit is apodaciaca. Fruit are used in semen debility and to prevent miscarriage. Deduction of the root bark is given in postpartum disorder. Temperature. Reduce fever and journey. Sapnikaran. The bark is bitter tonic having nutritive and regenerating properties. It is also an antidote. The bark was used in post-pharyngeal debility. It is also used in externally and internally in scorpio and snake. And again, here it goes. Root powder. Root powder dose is 1 to 3 grams. Decoction is 20 to 30 ml. Here conclusion. On comprehensive review of Gandhari, it is found that Gandhari is described in Vedas. Brihatrays and Laghutrays. There are synonyms like Kashmiri, Kambhari, Pitaluvini, Madhukarni, Shrikarni, Kashmiri, Vataruta, Sufala, Kira are described in various niganthus. Gambhara belongs to family Gardeniaceae and commonly known as Chandanvara tree. Pomtic, beechwood plant. It is used. Its fruit is used in Daha, Rudroga, Kasa, and Raktapitta. Whereas root is used in Shofa, Jwara, Daha, Raktadosha, Vata Vikara, Varsha, Raktapitta, and Brahma. Gambhari is having Guru, Kunat, Kashaya, Madhvadas, Ushna Vidya, and Katulika. On account of other properties, it is a Shofahara, Davahara, Raktaboshahara, and Arshahara. Here's some references. Thank you all. Here my paper is presented. Thank you for giving me this opportunity. Thank you.
Thank you, Dr. Poonam Pava. Thank you for the wonderful presentation. We know that Chandanadevarti, a significant formulation in Ayurveda, is renowned for its therapeutic application in eye disorders. The next presentation topic is exploring Chandanadevarti, a comparative compilation from ancient texts. I would like to invite Dr. Aarti Tanisha RS for the paper presentation.
Good evening everyone. Myself Dr. Aarti Tanusha, first year PG scholar from Department of Rashastra and Vaishnaja Kalpana, Sri Jayendra Saraswati Ayurveda College and Hospital, Chennai. Today my presentation topic is on exploring Chandanadevarti, a comparative compilation from ancient texts. In Ayurveda, Vaishnaja Kalpana is one of the important branch which deals with the preparation and processing of the Ayurvedic formulations. It explains variety of kalpanas like Panchavida Kashaya Kalpana, Sneha Kalpana, Sandhana Kalpana, Varti Kalpana, Arka Kalpana, etc. So one among them is Varti Kalpana, which is a derivative of Vati Kalpana. It is one among the secondary preparation in Ayurvedic pharmaceutics, which is explained under Sthanika Chikitsa. Chandanadevarti is a herbo-mineral formulation explained under Netra Roga in various texts. It is one of the Netra Varti. In general, Varti is prepared by two methods, that is Bhavana and Paka method. But Netra Varti is prepared by Bhavana method, where the drugs are pounded, sieved and triturated with the specific liquid and made into Varti, then dried under shade and stored. So at the time of application, it is to be rubbed with water or any other specific liquid and applied on inner eyelids as anjana with finger or shalaka. So Chandanadevarti is indicated in Netra Rogas like Timira, Vranashukra, Raktabhishanda across various texts. So there are different varieties of Chandanadevarti which is mentioned in our classics. Bharata Vaishnaja Ratnakara has compiled some varieties of Chandanadevarti. So this is an attempt to compile the varieties from our books, ancient books. Aims and objectives of this presentation is to put an insight on various references and indications of Chandanadevarti and to highlight the variations among
Hello, doctor. Next, I would like to invite Dr. Gaurav Srivastava for the paper presentation.
Yes, sir, I'm here.
Good evening, doctor. Sorry for the delay, doctor. Good evening.
Good evening to all of you. Myself, Gaurav Srivastava from Department of Panchkarma, Bharati Vidyapith, Ayurvedic Medical College. Here I am to represent you a case study, Ayurvedic approach to manage ankylosing spondylitis. The Ayurvedic diagnosis of AMVAS is made for ankylosing spondylitis in present cases. We present a case of AS which was treated with Ayurvedic management of AMVAS for 2 months. Various Ayurvedic Panchkarma procedure and internal medicines have provided promising resulting especially in reducing the pain, decreasing the severity of deformities and also improving quality of life within short of time and without causing any adverse effect in present. Description of patient: a 43-year male patient from Maharashtra, Pune. Appearance: physical build thin, skin complexion dark, hair condition black, facial expression anoxious, physical and mental disposition pain, conscious and oriented. Occupation and socioeconomic status is businessman and lower middle class. Complaints of patient is lower back pain since 6 years, bilateral hip joint pain since 5 years, right knee joint pain since 5 years, cervical pain since 5 years, and morning stiffness since 5 years. Inspection: cervical spine, forward head posture, dorsal spine kyphosis, lumbar spine normal. Blood investigation have done. HLA-B27 is positive. ASR 25 mm per hour. X-ray finding: LS spine, fusion of sacroiliac joint, Tager sign present. Cervical spine X-ray show reduced space between the intervertebral disc and plate sclerosis is present. Here are the investigations of the patient's X-ray and reports. History of patient is chronic alcoholic, smoking since 10 years. No history of DM2, no history of hypertension, and no any past surgical history. Treatment plan is Chitragati Vati in 2BD, 500 mg each. Srinath Google twice a day, 500 mg each. Ashwagandha chun, Pipli chun, Samir Pandagras, and Sunti chun twice a day. Dashmularist 20 ml twice a day, Arantel 10 ml at night. पंचकर्म प्रोसीजन वॉज बालू का स्वेदन, कटी वस्ती, स्नेहपान, सर्वांग स्नेह सर्वांग स्वेदन, विरेचन, संसर्जन कर्म, एरन मुलादी, निरुवस्ती was done. Observation: here are the ingredients and mode of action of Vati, Chitragati Vati, Srinath Google, Ashwagandha chun, Pipli chun, Samir Pandagras, Sunti chun. Discussion of Panchkarma process was Snehan, Swedan, Virechan. Observation at the midpoints. At the midpoint of the treatment, patient had experienced significant reduce in pain, particularly in lumbar region. Patient also noted a reduction in morning stiffness, allowing for a more comfortable start of the day. Progress of the treatment is the condition subsides significantly in terms of symptoms, with no signs of aggravations. The Ayurvedic approach, including Panchkarma therapies, provide effective in improving the patient quality of life and stabilizing the disease. Outcome of the endpoint: maximum relief in pain, improved daily functions, improved sleep and appetite, improve in range of motion, improve in spinal tenderness. Before treatment and after treatment comparison is symptom like fatigue. Before treatment point scale was 8 and after treatment scale was 4. Neck pain, back pain and hip pain. Before treatment is 10 and after treatment is 5. Pain and stiffness in other joint. Before treatment is 9 and after treatment is 5. Joint tenderness Morning stiffness, intensity. Before treatment is 8, after treatment is 5. Morning stiffness durations. Before treatment is 5 and after treatment is 2. Total meaning scoring is 8.3 before treatment and after treatment it is 4.3. The scale is used in this comparison is Bath Ankylosing Spondylitis Disease Activity Index, BAS-DAI. Here are the range of motion cervical spine as well as lumbar spine. Range of motion of hip joint before treatment and after treatment. Conclusion: the present study shows the Ayurvedic mode of treatment works effectively in the management of ankylosing spondylitis, that is arm bath. Though AS cannot be cured completely, but its symptoms and disease progression can be effectively managed through Ayurveda, which will save from the potential side effects of the other drugs, ultimately improve the quality of life of the disease. Thank you.
Thank you,
Thank you
Doctor.
so much.
Thank you for the wonderful presentation.
Sir, I have also
One
poster presentation
poster
also.
presentation is there. The topic of poster presentation is a role of Panchakarma treatment in Avabahuga. I will share the screen, Doctor. Just a moment.
I have shared my screen.
Okay.
Are you able to see my screen role of Panchakarma treatment in Avabahuga?
No, Doctor. I think there are something problems in your screen, Doctor. I will share
Okay,
for you,
sir.
Doctor. Just a moment.
Okay. Okay.
Please start the session, Doctor.
Good evening to all of you. Myself, Dr. Gaurav Srivastav from Department of Panchkarma from Bharati Vidyapit. Role of Panchkarma treatment in Avabahuga in under the guidance of Dr. Santosh E. Chavan, Professor and HOD of Panchkarma Department. Avabahuga means affects Avabahuga mainly affects Ansasandhi. It is also known as frozen shoulder. Symptoms of Avabahuga is pain, muscle wasting, and limitations to range of motion. So, what is the role of Panchkarma treatment? So, I will explain all the roles like Snehan, Swedan, Svet, Marma. So, first we will start Snehan. What is the role of Snehan in Avabahuga? स्नेह द्रव पजेस द्रव्य सूक्ष्म मधु मंद मृदु गुरु गुण which are just opposite to Vat, so it elevates Vat. What is the role of Swedan in Avabahuga? After Snehan, Swedan should be given, which elevates pain, stiffness, edema in shoulder joint, and also clears the blockage of passage, that is Shroto Avarod. What is the role of Snehvasti in Avabahuga? It promotes Bhrangan and also cures Vatvyadi and restores the disturbed cough and beat at their authentic seats, and hence enables in breaking the pathogenesis. Role of Nashya: it acts on the disease of Urdu Jatrugat Rog and the Prakupit Dosh are expelled out from the Uttamangang, and Brangananashya also provide nourishment to Uttamangang. Role of Agnikarma in Abhauk is it has a Vat Kaph Shamak properties and treats the pain and stiffness. Perform at the tender side of the shoulder joint. Role of Upnasvet in Abhauk is when Vat is situated as Snayu, Sandhi Asti, then Nirgundi Eran Patra, Kalk Upnasvet is used. Role of Marma: the proper stimulation of Ansh Marma point helps in the reduction of pain intensity. Discussion: Abhog is a disease in which Vata get vitiated and situated in Ansasandhi and produce symptoms like Shul, Istabdata, acids, Krachashadya Vyadhi. Only Shaman Aushadhi is not enough to treat the disease, so Panchkarma Chikitsa is of prime importance. Conclusion: all Snehan, Swedan, Sneha Basti, Agni Karma are very beneficial in Abhog, that is also known as frozen shoulder in modern science. In treatment of above, Nasya play a vital role not only symptomatically but in overall manner. So there is Panchkarma is very useful in treatment of above, that is frozen shoulder, in reducing pain, muscle wasting, limitation to range of motion, all. Thank you so much to all.
Thank you, Doctor. Thank you for your excellent paper and poster presentation. Despite the late hour, your energy remained unwavering and you presented in an exceptional manner. We sincerely appreciate your dedication and effort. Next, we
Thank
go
you,
to
sir.
the final presentation. I would like to invite Dr. Aarti Tanisha RS for the paper presentation.
Good evening, everyone. Myself, Dr. Aarti Tanusha, first year PG scholar from Department of Rashastra and Vaishnaja Kalpana, Shri Jayendra Saraswati Ayurveda College and Hospital, Chennai. Today, my presentation topic is on exploring Chandanadi Varti, a comparative compilation from ancient texts. In Ayurveda, Vaishnaja Kalpana is one of the important branch which deals with the preparation and processing of the Ayurvedic formulations. It explains variety of kalpanas like Panchavida Kashaya Kalpana, Sneha Kalpana, Sandhana Kalpana, Varti Kalpana, Arka Kalpana, etc. So one among them is Varti Kalpana, which is a derivative of Vati Kalpana. It is one among the secondary preparation in Ayurvedic pharmaceutics, which is explained under Sthanika Chikitsa. Chandanadi Varti is a herbo-mineral formulation explained under Netra Roga in various texts. It is one of the Netra Varti. In general, Varti is prepared by two methods, that is Bhavana and Paka method. But Netra Varti is prepared by Bhavana method, where the drugs are pounded, sieved and triturated with the specific liquid and made into Varti, then dried under shade and stored. So at the time of application, it is to be rubbed with water or any other specific liquid and applied on inner eyelids as anjana with finger or shalaka. So Chandanadi Varti is indicated in Netra Rogas like Timira, Vranashukra, Raktabhishanda across various texts. So there are different varieties of Chandanadi Varti which is mentioned in our classics. Bharata Vaishnaja Ratnakara has compiled some varieties of Chandanadi Varti. So this is an attempt to compile the varieties from our books, ancient books. Aims and objectives of this presentation is to put an insight on various references and indications of Chandanadi Varti and to highlight the variations among different texts. The references are taken from texts like Bharata Vaishnaja Ratnakara, Vangasena, Sushruta, Vrindamadhava, Arogya Kalpadruma, Vaishnaja Ratnavali, some articles and books, other books, etc. So coming to the literature review, Chandanadi Varti 1. It is seen in Sushruta Samhita Uttara Tantra in Raktabhishanda Pradisheda Adhyaya. Here both herbal and mineral ingredients are mentioned like Shweta Chandana, Shweta Kamala, Nimba Niryasa, Shilajatu, Loha Basma, Vittala, Kamse, Malabaga, etc. So from this Vati is made by triturating with Nimba Niryasa and then Madhu and Vati is made of Eva size and used as Anjana. It is indicated in Rakta Vishyanda. In Tika, the Pramana is also mentioned like Harenu Matra is for Lekana and Ardha Harenu is for Prasadana and Dviguna for Ropana. So the other reference is from Vrinda Madhava in Netra Roga Adhikara. Here only herbal ingredients are mentioned like Chandana, Gairika, Laksha, etc. And Vati is to be made by triturating with Gaganambu or Sheetambu and made into Vati and applied as Anjana. It is indicated in Vranashukra and also purifies Rakta. So the next reference is from Chakradatta in Netra Roga Adhikara, mentioned in Vranashukra Chikitsa. Here also same reference is seen as Chandana, Gairika, Laksha, the ingredients mentioned, and this Vati is indicated in Vranashukra and cleanses the eyes. The other reference is from same Chakradatta in the same chapter but under Timira Chikitsa. This is mentioned under the Anya Vati with different ingredients such as Chandana, Trifala, Puga and Palasha Taru. So it is indicated in Timira. So next reference is from the Vangasena Samhita in Netra Roga Adhikara. Here also only herbal ingredients are mentioned like Shweta Chandana, Trifala, Puga, Palasha, etc. So the ingredients are taken and pounded with water and made into Vati and applied as Anjana, which is indicated in Timira. And in the text Rasaratnakara in Chakshuroda Adhikara, similar formulation is seen as in Vangasena, but here Rakta Chandana is mentioned instead of Shweta Chandana and other ingredients are same and it is indicated in Timira. The next is from Yoga Ratnakara. Here equal amount of only herbal ingredients like Rakta Chandana, Gairika, etc. are taken and made into Vati, indicated in Vranashukra and conditions of vitiated Rakta. The next is from the Vaishya Ratnavali. It mentioned as Vranashukrahari Vati in Netra Roga Adhyaya, Netra Roga Chikitsa Adhyaya. Here also only herbal ingredients are to be taken and made into Vati by triturating in Kalvayantra by adding water. So this Vati is to be rubbed with honey and applied as Sanjana in Raktaja Vranashukra Roga. The next is from Arogya Kalpadruma. In Netra Roga Chikitsa, the ingredients mentioned are Shweta Chandana, Rakta Chandana, Laksha, etc. And these are taken in equal quantity and indicated in diseases like Sarvakshi Roga, Akshipaka, etc. So this table discusses the drugs mentioned in Chandanadi Vati by different authors. This is the continuation. Here, the drugs mentioned in different classics are noted. And table 2 is indications of Chandanadi Vati in different books like Shushruta Samhita in Rakta Vishyanda, Vrinda Madhava in Vranashukra. Likewise, different indications are mentioned in different books. And Bhavana Dravya also differs from each book, each author. So the market available formulation of Chandanadi Vati is manufactured by Aushadhi Manufacturing Company, Thrissur, and sold by Pharmayush. The reference is taken from Aragya Kalpatruma. Here the ingredients mentioned are such as follows: Shweta Chandana, Rakta Chandana, etc. They are taken in equal quantity as one part. So these are the pictures of the ingredients. Then here about preparation, it is mentioned like taken in equal quantity and made into Vati. Indications like Sarvakshi as we have seen already. So coming to the discussion, Chandanadi Vati is one of the Netra Vati which is mentioned in classics under the Vati Kalpana. It is indications in Timira, Oga, Vranashukra, etc. So there are various formulations and in this presentation 9 formulations have been discussed. The references we can see as Vaishya Ratnavali has mentioned his formulation as Vranashukra Hari Vati, whereas others mentioned as Chandanadi Vati. Chandana is seen as the common ingredient in all the Vati preparation. And Vangasena, Shushruta, Vrinda Madhava has mentioned Shweta Chandana, whereas others mentioned Rakta Chandana in place of Shweta Chandana. But in Arogya Kalpadruma, it explained both variety of Chandana. So similarly, there are differences in like Vrinda Madhava, etc. mentioned Gairika as one of the ingredient, others didn't mention. Sushruta has not mentioned Gairika but mentioned other mineral ingredients like Ogavasma, etc. And Arogya Kalpadruma has mentioned different indications and method of application also. So conclusion, Chandanaadi Varti is herbo mineral preparation explained under Netra Roga in various classical texts. It is one of the Netra Varti which is to be applied as Sanjana and which does local action by its Shodhana and Ropana property. So it is a preliminary work which has carried out to highlight regarding the literary aspects of Chandanaadi Varti in various texts. These are the references.
Thank you, Dr. Arti Dhanisha. Thank you for the wonderful presentation. As we come up to the end of the first day of Pranava National Seminar presentation, I would like to take this opportunity to express my heartfelt gratitude to all those who contributed to making this day a grand success. First and foremost, I extend my deepest appreciation to our esteemed panel members who have worked tirelessly day and night to ensure the seamless execution of this seminar. Their commitment to excellence and their unwavering support have been instrumental in shaping the quality of today's presentations. To our presenters, I must say your dedication and passion for research and Ayurveda were evident in every word and slide you presented. Today we witnessed a diverse range of topics that were not only insightful but also thought-provoking. From groundbreaking ideas to timeless classical concepts, each presentation brought something unique to the table. This depth of knowledge and exchange of ideas is what makes this seminar truly remarkable. To all the participants at attendees, your enthusiasm and engagement throughout the day added immense value to this event. It is your active participation, thoughtful questions, and constructive feedback that create an environment of learning and collaboration. The topic discussed today, such as the classical treatment principle of Alarkavisha, the role of Jaipal in managing the Venga, and the integrative Ayurvedic approaches to diabetic natural neuropathy, have undoubtedly provided new insights and practical applications. Each presentation shed light on critical areas of Ayurveda, and we are confident that these discussions will pave the way for future research and clinical advancements. As we conclude the first day, I am certain that the knowledge shared today will guide many of us toward deeper understanding and implementation in our respective fields. The relevance of these topics, especially in the modern healthcare scenario, cannot be overstated. Before I conclude, let me once again extend my gratitude to all the organizers, panel members, presenters, and participants who came together to make today's session a great success. Your efforts and collaborations have been exemplary and they reflect the true spirit of learning and community. We look forward to welcoming you all back tomorrow for another day of enlightening discussions and presentations. Until then, thank you, stay safe, and let us continue to uphold the rich traditions and scientific advancement of Ayurveda. Wishing you all a wonderful night ahead.